Thank you very much. If I can invite my panelists onto the stage with me, otherwise I'm feeling a bit lonely. So we just heard a fantastic session, really talking about getting real, doing things that our mothers would understand and having impact across the system. And this panel is really well timed because that's exactly the conversation we're going to be having. How do you embed health into climate policy, and how do you make sure within health that we deliver on our responsibilities? Well, I'm sure you don't need me to tell you that we need to act now. The recent WHO Commission in Europe, led by the former Prime Minister of Iceland, wants us to get really serious. They declared climate change and health as an issue of public health concern of international significance. That's the top level of concern apart from a pandemic. But we also know that health has to act because of our impact. And we are, as you will all know, 5% of the impact globally. And that makes us worse than aviation and shipping combined. And that means that we have to take responsibility and we have to act. Well, in 2026, do we find ourselves at the beginning of the journey? No, we don't. Action has been happening for a number of years. In the UK, the NHS declared a climate emergency in 2020, and it has been committed and has learnt from now over 5 years of action how you actually go about embedding things. And we're going to use that as part of our panel today to understand what that means, not only for the NHS, but more broadly. But also globally, climate and health has been part of the agenda in COPs since COP26 in Glasgow. And WHO has formed its ATASH mechanism, where it's bringing together over 100 healthcare systems. So it's all happening. The challenge is moving from the need to act into how we do it, which is why our panel today is just so well placed, because each of them brings a different part of the system. And it's a great pleasure to introduce them and get them to tell you, perhaps to begin with, where they see things from their perspective. So if I could start maybe, Jimena, with you, if you could tell us what you do and how you think we can accelerate action and embed this into the system globally.
Sure, thanks. Yeah, and thanks everybody for showing up. It's an incredible privilege to be with you today. My name is Jimena Ezeguirre. I'm a climate change adaptation specialist at ESSA Technologies. And I come to this discussion from a climate governance perspective. I've been working as a policy specialist for almost all of my career, previously within the Government of Canada and currently as a specialist consultant. And most recently, I've been working with the International Climate Councils Network and their membership to really understand how climate councils can accelerate the integration of health into the climate advice that they provide to governments. And yeah, so that's my contribution. I'm thinking about it as from a climate governance perspective, because from what we're hearing with councils, this issue of climate and health integration is not necessarily an issue related to just technical evidence, but it's about really understanding who's asking the health question around the Climate Council table, who is around the table, how to make sure or translate translate evidence into concrete pathways, as was just mentioned. And so I see that as a reason why it's really important to start better integrating climate and health today. And basically, from what we're hearing too with climate councils, integration of health is happening whether we recognize it or not, because, you know, as we've just heard from the initial discussion, all climate impacts have a health dimension. Therefore, all policies related to adaptation are related to health, and climate mitigation, everything we do relating to energy, transport, food, even emergency management, all have climate and health dimensions. And so whether we recognize it or not, health is very important for climate policy, and therefore any tools, pathways to accelerate that integration will be really important.
And who do you think needs to be around the table?
Yeah, so from what we're learning, this is not an issue. I mean, this session is framed around the health system, but really from what we're learning with the councils is that a lot of the agency about what to do about health is in the power of health determining sectors or those other sectors outside of the health sector. So again, energy, transport, food, water, housing, you name it, all of those sectors. And so they really need to be at the table when it comes to trying to understand what are the impacts of climate change on health and what are the impacts of responses to climate on different populations, and then who is most able to adapt, who isn't, and then what about the structural determinants of health, so occupations, socioeconomic conditions, marginalization, racialization, all of those phenomena also need to be looked at very critically.
Yeah, so it's really making sure we get out of our echo chamber in health and make sure we're talking to not the usual suspects.
That's right.
Absolutely, great message. So I think often we forget that there are some important global players who really influence the system, and so it's a great pleasure to introduce Bren from Roche, who's Chief Sustainability Officer there. How do you see things from your perspective as a global company?
Yeah, and thanks also from my side for joining this session. So maybe a little bit of background. I mean, Roche is a global innovative healthcare company with two main divisions, so diagnostics and medicines. And we are headquartered in Switzerland and operating in over 100 countries. And also we have been supplying our products for a long time to the UK, since 1908. So I guess that's before even the NHS was established. So we have a long-standing relationship, and we don't see ourselves just as a supplier, but also share the responsibility for building a sustainable and resilient healthcare system. So from our perspective, it's really important to work together, and there's a lot of players in the systems to get this right. I'm not going to dwell on all the actions we take, but basically we like to increase access to medicines and diagnostics. There's still huge unmet needs and gaps in the world, but obviously not at the expense, right? So we have a whole program on managing our environmental footprint, and we do that upstream, downstream, and obviously in our operations. And one of the things, again, you'll find a lot of information obviously on the report, on the website, and what have you. But one of the actions we've taken, and which is important to take action individually and collectively, is working with 6 biopharma companies, including the UK players, AstraZeneca and GSK, on being net zero by 2045 across across the whole value chain. And as you know, 90% of the emissions sit in that value chain. So together we set ourselves very ambitious goals. And for Roche, we're going even a step further, where we say we want to get to absolute net zero for our own operational emissions. So that's one of the things we do as an industry player. But obviously, this requires a system-level response, right? We're talking about things here, Jim and I already alluded to, which play at at all levels, and also requires action. So we think it's very important, and hence also why we are here. That we do collaborate with the other players, and there's quite a few in the healthcare system. It's a very place-based industry. So I joined this sector 2.5 years ago, and it's not so easy because yes, the research, the science is very global, but it has to be delivered in every health system. So we interact with 150 health systems around the world. So it's a very place-based industries where we really need to work together individually and collectively, and health system by health system. And we really like the UK from that perspective, because NHS has been an exemplar, right? Really taking the lead in what the health system and the government can do to really send a clear signal. And this is what we mostly need, I would say, a clear market signal to make sure that also the industry players are very clear that this is important. It's not just about cost, affordability, clinical evidence. It's also about products that are sustainable and resilient. Yeah. So that's where I'm coming from, to be honest.
Absolutely.
In a nutshell.
Absolutely. And you mentioned the Sustainable Markets Initiative, which is, for those of you who don't know, our king here in the UK, initiative across economic sectors to bring together different players to really think about how we accelerate action on climate change. And it's very much about healthy people on a healthy planet. So it absolutely resonates with those of us who are part of that health system task force. What do you think it's given us in terms of understanding? I know there's been quite a lot of work on metrics. How is the Sustainable Markets Initiative helping us to advance action?
Yeah, obviously biased because we're a few years in now in that coalition under King Charles. And again, it's mostly European biopharma companies. And we would love also for some of the other players to join. It's got a lot of work streams, which I think are relevant for this discussion. And maybe to mention one, right, to show what it really brings to the table. So one of the things is take-back systems, right, where we make sure that the products we send out in the market are also, return circularity. And they're very happy to mention that, all the industry players, plus also some of the new non-European players, are joining forces to basically design a take-back system for auto-injectables, for other medical devices. More and more medicines will come with a device, right, in the future. So it's very important that we also design for circularity and design for disassembly. So that's one of the things we do. The other one is, and again, it has a bit of a British touch, so maybe worth mentioning, Fiona, is the PAS 2019, which is the first life cycle assessment standard for pharmaceutical products. So it was launched at the end of last year, and it's done with the NHS again, the industry, and the schedule is owned by the British Standard Institute, BSI. So I think that's an important standard, which at least makes sure that we have a shared understanding and a shared standard when we talk about these issues. That really brings science into this, right? So the PAS 2090, Fiona, is one of those things, one of the 7-8 work streams that has really concretely delivered on a standard which is now being used by the different industries. So we take our own medicine, we apply it to our own portfolio, but we also ask suppliers to start using that standard. And we hope that also the health systems, and again, the NHS and others, are using this standard to really set their requirements into the market. And I think this is one of those actions that we took collectively to really enable system change. And we hope, and we're driving the uptake of that standard also in all those 100+ health systems, making sure that when you ask for products, they have been assessed by that PAS 2019. So it sounds a bit technical, but it's really important that we're on the same page. And we have a common language, a common standard that can be used by not just health systems, also by governments, even hopefully hospitals, so that we really have an aligned standard, which is really, I would say, common practice in many, many industries. But we came as a healthcare sector quite late, I guess, to the table. But now we have, that first time we have this standard to measuring the environmental footprint for pharmaceutical products.
Yeah.
And I can go on, which I won't. But this shows that taking collectively action, again, with academia, with the NHS, with the industry players, I think really matters to making a difference.
Yeah, absolutely. It's that joining up across the system. And I mean, you mentioned, metrics and having measurement. And as, the old adage goes, you can't actually manage something unless you can measure it. And at the heart of measuring it is making decisions. And part of making decisions is holding people to account and understanding where we've got to in the system. So Chris Naylor's from the King's Fund, but also from the Centre for Sustainable Healthcare. And you've done quite a lot of work to not only look at where the UK has got to in terms of, or the NHS in England has got to in terms of its commitments, but how that relates to accountability and what systems would drive change. Can you tell us a little bit about that?
Sure, yeah, so thank you. My background is in health policy and health systems research, and I think from a policy perspective, there are a couple of fundamental challenges that we still need to grapple with. So one is the alignment challenge, and one is a kind of short-termism challenge. So a few weeks ago, we published a piece of research report on the King's Fund's website I sympathised with Alan's comments earlier, because I'm pretty sure my mother hasn't read it either, but if a couple of people in this room would, then that would make me feel better about myself. Freely available. What we looked at in that report was, so as Berend mentioned, the NHS is a really interesting example of climate action and sustainability within a healthcare system. And there's been some really great progress over the last few years that we should celebrate. So we now, every NHS organisation has to have a green plan. It has to have a nominated sustainability lead at board level. We've seen some big successes in terms of things like phasing out the use of the anaesthetic gas desflurane, which is a very potent greenhouse gas. Overall, the NHS in England has managed to achieve a 14% reduction in its direct carbon emissions over the last 5 years. So lots to celebrate, but what we found in the research was that firstly, so on this point about the alignment challenge, we have a clear policy goal. So the NHS is committed to getting to net zero by 2040. But what we don't have yet is all of the governance and the accountability mechanisms within the healthcare system aligned behind that goal. So a really simple example, NHS organisations are required to have a green plan, as I say, but they're not held to account for the contents of that green plan or for delivering the commitments made in that green plan. At national level, we have various kind of frameworks that are used to hold the NHS to account. So there's something called the NHS Oversight Framework, which is how the government and NHS England judges the performance of different NHS organisations. And at the moment, a lot of the stuff in the NHS Oversight Framework is about how are you balancing the books in this financial year? Are you getting to grips with your waiting times for hospital care? And it's not sufficiently about, are we making best use of resources, financial resources, natural resources, to maximise the health benefit that we get from the NHS for the people of the country? And that brings me on to the sort of second challenge, which is this issue of kind of short-termism. So I think the NHS has a structural weakness in terms of long-term investment and long-term planning generally. We do have a 10-year plan for the NHS in England now. It does contain a short section on climate and health, but I think we're some way off from really embedding climate and sustainability within all of the sort of policy levers that the Department of Health has available to it.
You're right. So part of the problem underlying that is mindset, I think. And part of the mindset I think people bring to it, which doesn't always help, is that this is something additional they need to do. And I know, because we did it together when the 10-year plan was being developed, we were arguing that actually delivering sustainability is part of the solution, and in fact would enable healthcare systems to get the level of productivity, to get the efficiency and the health outcomes they want. So can you tell us a little bit about that?
Yeah, absolutely. I mean, I think what climate change does in a way is it forces the healthcare system to grapple with some hard truths that it needs to grapple with anyway. And one is this point that I've already made about value. So at the moment, we're not getting value for money out of the NHS, in part because we are not able to act in a sufficiently long-term way. So there are changes we could make that would be better for patients, better for taxpayers, and in many cases better for the planet as well. But at the moment, even when all those three things are there in principle, in practice, it's hard for people running the NHS organisations to get the business case to stack up in practice, because maybe the financial returns aren't going to come for a few years' time, and they need to justify the investment in the very short term, or the health gains will come some way to the future, or that classic challenge of the sort of financial return will accrue to someone else's budget. So all of those kind of systemic issues mean that there are things that we could be doing differently that would have that kind of triple win, but at the moment the way the system is set up doesn't make it easy for people to kind of implement those opportunities.
Yeah, absolutely. So the case is there, and I guess what we see in our own work is that clinicians are often driving that change, and they want to use that green lens to help them improve their own healthcare, deliver it more effectively, and then really reduce waste, think about how they improve outcomes at the same time as reducing environmental impact. And therein, I think, lies the paradox, because when you go into a health policy environment, people kind of think that this is the center of the universe, that actually this is what makes stuff happen. Actually, healthcare is place-based, as Berend was reminding us, and it's incredibly local. And in the end, healthcare is delivered because of the conversation that the clinician has with the patient every day, the hospitals that we turn up with, the GPs we see. And I know when I went into my policy role that you heard about 20 years ago, I'd never read a government white paper. And there I was being responsible for developing them. But for me, it wasn't about those big policy initiatives. It was about getting it practically down to the what do we need to deliver every day. And that's why we're so pleased to have Jo Burton on the panel, because Jo, you've really been grappling with this issue at UCH. You lead transformation around sustainability, and you've also been able to see that at a bigger level as a young fellow for One World. I think you'll have to remind me. But what I'd like to hear about is, what does it mean when you're actually delivering care? How do you see it, and what would you like to see change?
Thanks, Fiona. Great to see so many people in the room that we're standing room only. Yeah, as Fiona said, I'm Jo Burton. I'm the Sustainability Project Lead at University College London Hospitals. We're a large London teaching hospital. I also chair a group called the Circular Economy Healthcare Alliance, 16 NHS trusts driving bottom-up change. I'm going to start just by reiterating a point that you actually said at the start, Fiona. Health systems are responsible for 5% of global emissions. I think that fact sometimes shocks people. I think if we had a country responsible for 5% of global emissions, it would be far higher up on the agenda than perhaps health is. We hear a lot about health policy. We hear a lot about the impacts of climate change on health, but I don't think we hear so much about how health is part of the problem as well. And I think that's something we need to reframe. I'm not going to sit here and say that healthcare is a bad thing, far from it, but I think healthcare needs to take account of the fact that it has an environmental footprint and do something to try and limit that. In terms of what we see on the ground, I think I'm going to start by trying to dispel a notion, perhaps, that the NHS is as cohesive as some of you may think that it is. The NHS operates on semi-local levels, so different organisations are essentially semi-independent entities. And what that means is that what happens in one organisation doesn't always neatly translate into another. Policy is policy, as Fiona says, but policy only means something if it is actually implemented. And for that to happen, it can be really, really difficult. Some of the challenges Chris has already touched upon. How do we have the money to actually implement this? Who is going to be the one to do it? Do we have the space to do it? Can we do it in the kind of facilities that we've got, some of which are over 100 years old? However, what I have seen, particularly over the last 4 to 5 years, is this is really going up the agenda. As Fiona says, clinicians come to us, and this actually really matters to them. They really want to deliver this. Our clinical staff are really conscious of the environmental impact that they have on the delivery of the care that they provide. Patients are also conscious of this. If you've gone in ever for an operation, you may have noticed, well, I look at this a lot, the number of bins in an operating theatre. Doesn't sound sexy, but it is. There's a lot of waste that is responsible from healthcare, and we have the solutions in place already. We have some organisations that have done, as sort of already mentioned, anaesthetic gases and done it really well. We've had some organisations that have introduced large numbers of reusable items, whether that's reusable medical textiles, whether that's scopes, whether that's investigative equipment. but others that haven't. So we're in a position where we have some organisations, like my own, that are in a really good place, that have got a really brought-in board, that have got mechanisms for delivery. And unfortunately, we have other organisations who are NHS and who have the same responsibilities to their patients, who aren't necessarily in a good as position to deliver as we would like them to be. And if we are to hit those targets that we're talking about today, we need to ensure that everyone, everywhere, across the health system, is able to deliver as effectively as each other.
Really good ambition. So there's potentially a vacancy coming up nationally. if you were in that role for a day, what would you do to join up the NHS?
If I was Prime Minister for a day, that is such a great question, isn't it, Fiona? I think fundamentally, I'm going to come back to a point that you made, Chris, about the long-termism versus short-termism. The NHS often thinks quite short term. It runs in annual funding cycles. And those of you who may work in the health system will know we have a funny thing that happens in December, January time where money that wasn't around suddenly becomes available because the capital that has been allocated hasn't been spent. What that means is that we have a massive rush in January, February to try and get things done, which perhaps, if we'd have been thinking a little bit more early, would have been able to deliver more cohesively. So if I was Prime Minister for a day, this is such a tough question, isn't it, Fiona? I'm going to say something that maybe not everyone else would say, but I would want us to see our funding cycles be longer than a year. I think fundamentally, if we could have funding cycles that work longer in it than a year, we'd translate the conversation away from just, we need to do sustainability because it's the right thing for health and for patients, to, we do it because it's right for patients, but it also saves us money over the long term. It also increases our resilience. For example, if we had, say, reusable gowns and we were to have another pandemic, suddenly we've got a stock in place we can reuse and reprocess as we need it. I think if we had those long-term funding cycles, we could make those arguments a lot more powerfully. And to the point that Chris was making about how you get these things through in a system that has got huge numbers of priorities, number one of which is to provide the best care for our patients. If you can make those arguments, it's better for the patient, it's better for the planet, and it's better for our bottom line, then we deliver more effectively. And I think the only way to make that happen is to try and change these 12-month funding cycles.
Okay. Well, let's hope, ambition can get you lots of places. So I think also as patients, and what we know from surveys that are done nationally and globally, is that people want their health to come first. Of course they do, we all do. And people also care about waste. So I think you're right, the stars are aligned and we should just get on and do it. So on that principle of just getting on and doing it, could I ask each of our panelists just to say, if you were national or global leader, what's the one thing you do? And then what I'm going to do is open it to the floor, because I'm sure a lot of you have got some great thoughts and ideas and questions about how we can continue the conversation. So, him and her. If you were global leader for the day, what would you do?
Yes, tough question. I think from my vantage point on improving climate governance, I think what I would do is invest more in the translation layer of climate governance, which basically means being able to take the evidence base that exists on sort of the foundation of climate change impacts on health, as well as how climate policy can result in health gains, and turn that into indicators, into budget arguments, into metrics, into practical methods that people in their everyday work, everyday jobs can use to better integrate health into their climate decisions. So making an effort to invest in that translation layer, and examples of those institutions that perform that translation function are, climate councils, national or subnational. They don't have an implementation role, but they advise governments on climate policy and sometimes perform watchdog roles and sometimes have official convening roles. And so making sure that their everyday workflows, that their climate job is also a health job would be where I would put my dollars or pounds, I guess.
Exactly. Brand.
I didn't come into the UK to thought about that question. And I'm supposed to be a global leader every day.
You are a global leader,
so it's not so easy.
So as global leader, what would you do?
I mean, I would say I'm coming back to the demand signal, right? Nothing beats a clear demand signal, right? It doesn't have to be perfect, and we can learn again from other industries. Think about construction, right? We see now in construction that there is a financial incentive for project developers, for construction companies to build low carbon. And it started 14 years ago. It was a very simple scheme. It's now rolled out also in the UK, in Ireland, started in the Netherlands, it's now over 10 European countries, India, and it only incentivizes 10%. You get a fictitious reduction on your bid, so you can be a little bit more expensive, but long-term, right, more advantageous to society, and it really transformed and accelerated the transition in construction. I would argue in healthcare, which accounts for 10% of GDP and yes, 5% of GHG, we can do something like that. You know, we have the resources, we have the brains, the interest. So my wish would be, let's create a clear market signal. Again, it doesn't have to be, and I'm aware there's competing priorities, as we all know, but if we send a clear signal, market signal in, like the NHS, but hopefully even a bit stronger, not just asking for the information, also integrating it into external value recognition, into the NICE mechanisms, into procurement, that goes a long way. So that would be my wish.
Brilliant. Chris?
So politicians can obviously help by developing kind of technical solutions and the policies and so on, but their role is also to lead and to provide leadership. And I think that is, if you're going to push me to say one thing, I think that's the thing that we need to see now. So what I would like to see politicians doing is talking about this as just being part of high quality healthcare. So we want health services that are effective, that are responsive to people's needs, that are equitable, and that are sustainable, and that use resources, financial or natural resources, wisely. And I think to see politicians talking in those terms would be really catalytic, because and to use your term about market signals, there are also market signals within the NHS. The NHS can be quite a top-down system sometimes, and people working in it, hospital chief execs and so on, take their cue from what they hear ministers talking about. So by kind of framing sustainability as just being part of what it means to be a high-quality health system, I think that would send a really powerful signal to the rest of the NHS.
Yeah, and politics often catches up with what systems are already doing, and so it would actually be a very easy step. I think that's what we're hearing. Joe, you're in this unique position of being able to have two wishes. In your first day in office, so you've got one extra now. What would you want the system to change?
I think I'm going to reiterate the point that Chris made. I think there has to be the acknowledgement that not only do we have the health impacts of climate change, we have an impact of health on climate change. I think I'd like to flip that on its head just a little bit. I think we really need to acknowledge that this is something that matters. And I think once we get to the point of acknowledgement and we actually understand that this is something that people care about, that has an impact, suddenly it becomes something that goes up the agenda. I think until this is something that is openly recognised by all, that good quality healthcare is sustainable healthcare, then I think we've still got some work to do.
Yep, and it matters to your voters. So please, have you got any questions for us? Yes, please, a gentleman in a blue shirt behind the pillar.
Oliver Marchand, I'm the CEO of a new startup that analyzes cost-benefit analysis. Hi, my name is Oliver Marchand. I'm the CEO of a new startup that analyzes cost-benefit analysis of adaptation projects. And I have a question specifically to Joe, because we struggle with the same time horizon issue. But I was wondering, I mean, before you become Prime Minister and change the investment cycles of public money, wouldn't there be like a middle ground where in a yearly investment cycle you just look at, longer term, even just a 5-year cost-benefit analysis?
Yes, but I think the important thing to remember is that we're trying to compare these projects that we're delivering against the whole other realm of projects in an NHS estate. The NHS backlog is in the multi-billions to ensure that our estate is fit for purpose for the future. So it's not so much a case that we are looking at these things in isolation, we are comparing them against the wider portfolio that we have to deliver. I don't have a neat answer to that, But what we're increasingly seeing is those projects are being viewed in other terms. So to give one example, we're looking at the air handling units that we have in our estate. I won't go into the details of what they are, but they're important for our airflows. We need to replace those. But if we can replace those with a more sustainable version that uses less energy and is better at its job, then we've hit two birds, one stone, if you like. We have not only done something in our backlog, but we've also done something that improves our sustainability. So I think our middle ground there is not so much to look at some of those things on a 5-year cycle, but it's to look at those things that we already have to do, and can we do those things in a more sustainable way, as opposed to just replacing like with like.
Yep. Exactly. And I think the important thing is to change the narrative. We're paying for it today. Exactly as you say, it's about how we use the resources we're currently using to do things better. So let's not be under any illusions that we're not investing in this. We are by default. Please, you have a question at the front.
Thank you so much, and thank you for this panel. My name is Karina Hirsch. I'm the interim chief executive of the Margaret Pike Trust, an NGO working on sexual and reproductive health and rights, mostly in low and middle income countries. So I thank you for the discussion today and talking about the mitigation of the health sector and using our incredibly privileged position in the UK and some of the countries you spoke about. However, I think in a world where half of the population, 4.6 billion people, do not have any access to healthcare, I think that's kind of glaring that perspective wasn't perhaps so represented on the panel. So I'd just like to hear a little bit about what you might be doing either as Roche or as some of the national health councils to be working, especially with least developed countries, on getting their inputs in terms of adaptive capacity and resilience, because that is really what a country like Uganda that contributes 0.2% of global emissions, that is their concern. And I'd like to hear a little bit about that, please. Thank you.
A point well made. Himana.
Sure, yeah. So the work that I do with international climate councils includes membership from lower and middle income countries. On actually the advisory committee that is working with me on this project is represented South Africa. So South Africa has the Presidential Climate Commission, which is a climate council that reports directly to the president, as the name indicates. And they are very active on the adaptation side in trying to really understand how to address climate adaptation policy in tandem with health. In particular, heat stress is something that they've really started working on. And they recognize that within the council itself and more kind of government-wide, there is lower capacity issues, not just on the data side, on the health evidence, health delivery, like all sorts of issues. But they're moving forward, the council is, in terms of filling evidence gaps by working in partnership with universities, getting some development assistance, and basically getting kind of the resource and the technical capacity from partnerships. And so I would say that within the council, there's a lot of within the ICCN, there's a lot of representation from lower middle income countries and from all global regions. And that forum where there's peer learning across different jurisdictions is proving to be incredibly effective in just getting ideas about how to do different things on an everyday basis.
Thank you. Perhaps if we could go for our final question.
Yeah, thanks. My name's Steve Podmore. I worked on climate and sustainable finance for about 17 years, and then my brother passed away, my mother had a massive stroke, I gave up and looked after her for 15 months, and she had another stroke and passed away, and it made me up close and personal to the NHS. So as a result, I'm launching a project called Let's Fix the NHS, a crowdsourcing and media project. But my question is about innovative finance. One of the things we've got is upside down economics, where the cost is long-term, we're not spending in so many areas, and it just is perverse incentives everywhere. My question is, I don't think we've got that many banks or that many investors in the room. And what is the role of innovative finance at scale and the policy to create the conditions? Because we've got to have an awful lot more funding solutions for everything that cross-sects with sustainable development and health, and we don't have those from our usual suspects.
Who'd like to give a thought on that? Brent, you've seen this agenda from a number of different sectors.
It's a very broad question, and during London Climate Week, there are a few dozens of these sessions, right? What's the role of finance? So it's a very fair question. And I would say, also getting, linking to your question, of course, our role as an industry is co-shaping sustainable, right, and resilient healthcare system. That's a huge challenge. And our core contribution to society is closing that diagnostics gap. Half, like you said, half of the global population don't have access to early to diagnostics. And on the pharma side, there's a lot of unmet needs. So I'm going to refer to another publication which nobody reads, which is the annual report of Roche, the sustainability. And my team is spending a lot of money, a lot of time and money in publishing that report. And access is our core contribution to society. And to your point, we are measuring. So it's not just talk, right? We are measuring actually what we call impact measurement, the outcomes and monetized impacts, right, of our access to patients. So we have goals, again, if you go to those publications where we say we want to triple the value, the societal value to societies. In Africa, we have a 10x strategy, right, where we want to make sure that in the LMEC countries, 10 times as much people reach our medicines, right? So there's a huge gap. Specifically on diagnostics, there's that triple win, right, where we can really reduce the environmental burden, reduce, if you do diagnostics research, right, you will avoid a lot of hospitalization. You will meet the patients where they are, at home, so they don't have to travel. And you reduce, right, cost and the burden on the healthcare system. That said, and innovative finance is obviously needed. But I think, again, I'm coming back to my market signal. As soon as we collectively, we pay, in most countries, it's a public good, healthcare. So, right, if the shareholders start sending that market signal, then the finance world will wake up. Because as soon as investors, right, and banks see that this, that we're asking for sustainable healthcare, then it crops up on the agenda. As soon as they see how sustainable healthcare is affecting, basically the bottom line.
I'm so sorry, but we need to wrap up. It's a really important question, and I think, like any conversation, we've had far too much to talk about, and of course not enough time, but there is the coffee break, so don't despair. I think for me, what we've tried to really outline is why we need to move from the theory of how we join up the system to the practice. Picking up on Alan's theme, you can see we all believe in this. We're passionate. We are absolutely clear about what the pathways are. And we've had a bit of fun with the idea of if we were leaders for the day. But the reality is we are all leaders for the day. Each of you and each of us in our daily role has an opportunity to start where we are, do what we can, and accelerate change. So after this week is over and all the fun and excitement and conversations have died down, just think about how you're going to lead from this, because everybody has to work together to join up the system. So enjoy the rest of the conference, and please join me with thanking my panel.
Amazing. Thank you so much, everybody. And as Fiona alluded to, there is now a vacancy. The address is number 10 Downing Street. Keir Starmer has just resigned. So we will be looking at our 7th Prime Minister in 10 years in the UK. I think we've probably lost count of what number Health Secretary that makes as well. But yeah, another summer of some turmoil. One area where we hopefully see a little bit more stability is in cities. And cities are very, very often at the forefront of climate change, experiencing it with all of the difficulties that urban change and growth brings. So the next part of our day, of our session, is going to zoom in a little bit more and look precisely at how cities are dealing with the climate crisis, how they are protecting their citizens' health in the face of adverse heat, polluted air and water, and so much more. To get us started, it is a genuine delight to welcome the Deputy Mayor of London for Environment and Energy and a very good friend of the Conduit, Mette Coburn.
Thank you. Good morning, everyone. Welcome to London Climate Action Week. This is the biggest ever London Climate Action Week. We've got over 1,300 events happening across our city. It's literally the Glastonbury of climate weeks. And we're really pleased, whilst New York may have won the NBA championships, when it comes to Climate Week, London is now the champions. Also, I should just say, what a day to be having this conversation. I know we're going to be talking about resilience, but I think number 10 can also do with a bit of a resilience strategy. Anyway, don't quote me on that. Look, my name is Mete Koban. I'm the Deputy Mayor of London for this incredible city. On behalf of the Mayor, I lead on one of the biggest issues of our time, which is around how do we make sure that London is protected against the impacts of climate change. Because the reality is, it doesn't impact everyone equally. That is the first and foremost thing to remember, which is it does not impact everyone equally. And I'm very pleased that we're being able to have this conference and summit here today. And I want to say a special thank you to the Conduit. I think you've got a packed agenda all week, over 5,000 people taking place. I mean, a couple of years ago, that would have been the total number of London Climate Action Week. And thank you to you for being able to put on this incredible summit. So let's give a massive round of applause to the whole Conduit team, please. I also want to just say a thank you to the Wellcome Trust. I could see Alan, Garth, and the whole team here. The work that you do, not only to be able to enable things like this to happen, but also thinking about how do we actually reach Londoners at scale. We worked together recently on the launch of No Extra Time, which is around how do we actually raise awareness around heat, particularly among young Londoners and people who ordinarily wouldn't be thinking about this agenda. And we couldn't do what we do in London without you. So let's give a massive round of applause to the whole Wellcome Trust team. Look, I said climate change doesn't impact everyone equally. I never make this a secret, and you know, many of you would have heard me say this before, but I'm not someone who is a traditional environmentalist. I came to care about this issue because communities like mine were more impacted by climate change than we knew it. You only have to look at the fact that this week, I mean, we're having this conversation about London Climate Action Week. I mean, I'm here with Emma, who was the chair of the London Climate Resilience Review. It is on set record to be the hottest June we've ever had in London. Last month was the hottest month we ever had for May in London. Last year was the hottest year we've ever had in London. And the question is, who pays the price for these extreme hot temperatures that they didn't cause? And what impact does it have on the lives of so many of our Londoners across our city? Or the fact that if you look at pollution levels across our city, there are 500,000 people across our city who will never ever be able to breathe the full capacity of their lungs because of a crisis that they didn't cause in the first place. Because we're dependent on fossil fuels, and every time those toxins go in our air, it pollutes and stunts the lungs of so many of young Londoners. It's an absolute scandal that we've normalized breathing dirty air. Or the fact that because we're dependent on fossil fuels and because we have these volatile energy markets, it's working class Londoners who are paying the price every time something happens around the world and their energy prices go up. So for me, when we're talking about heat and the impact of climate change, we've got to really bring it back down to one thing. Who is paying the price? Who is paying the price for this ultimate disaster that they didn't cause in the first place? And the thing that I'm most optimistic about on this week, not only there's so many incredible people in this room, which we're going to talk about all the incredible progress that is being made, but it's also about how do we make sure that we center those communities really at the heart of this conversation. Look, on Friday, we're going to have the biggest ever youth summit on climate action this week. And the special thing about that, and the thing that me and the mayor was really pushing around the Youth Climate Action Summit, is to make sure we don't just put together a sort of a talk shop. It's about making sure that actually those youth voices, those people who are going to be ultimately left with the planet in the way that we leave it, are really at the heart of creating those solutions. Last year when we had the Youth Summit, on the back of the Youth Summit, we launched a £12 million Green Roots Fund, directly showing the impact that those young Londoners are having on shaping City Hall's policy. This year, I'm proud to announce that on the back of the Youth Summit, that is going to directly feed into London's new climate action plan. And so there is a huge opportunity for really thinking about how do we actually center those communities really at the heart of it. Now, I spoke about some of the impacts of climate change, but I also want to say we're joined by some incredible mayors here from the States. We've got the mayor of City of Miami and Phoenix with us here today too. And they're going to talk to you about some of the progress that is being made across cities. And here in London, I should just say, I'm reminded of a quote that I've always lived by growing up, which is, it always seems impossible until it's done. Do you know who that's by? Nelson Mandela. It always seems impossible until it's done. When the mayor of London first got elected in 2016, scientists and experts told him it would take 193 years for us to reach the legal limits of air quality in London. 193 years. Impossible to imagine during our lifetime. Literally impossible. Well, my friends, I've got some good news for all of you. As of last year, for the first time in London's history, nearly 180 years sooner than what experts predicted, London has now reached the legal air quality limits. It is an incredible... It is an incredible achievement, but it comes back down to one thing. The key driver that really moved the mayor, which was actually meeting the mother of a young child who tragically lost her life, a young girl, a young black girl called Ella Roberta, who no fault of her own. She was the first person in the world to have died, to have pollution cited on her death certificate. Ella was a very fit and healthy girl at the age of 5 or 6. She wasn't born with those issues, which just proves the point that if we don't take action, so many of our young people's futures are being robbed away from them. But we've also made incredible progress when it comes to what we're doing around resilience across our city. I mentioned Emma Howard-Boyd. Emma led the London Climate Resilience Review, and the mayor launched the London Climate Resilience Review because in 2021, we had devastating flash floods across our city, thousands of basement properties who were flooded across our city, hundreds of millions of pounds cost to our economy. And behind all of those stats, those are generations of memories that will never be recovered from all those basement properties being flooded. And in 2022, we had extreme heat. Temperatures hit 40 degrees summers, temperatures. And I think we had over 300 people who sadly lost their life related to the heat that we had in our city. So this isn't something that is abstract or, may happen or may not happen because we haven't experienced it in London before. We're already seeing how this is impacting Londoners' lives every single day. And I reflect on the community I'm from in Hackney, in London, where we've got more than 60% social housing. All those homes who aren't built to withstand this level of heat. People are struggling. They're really struggling. Which is why we've really got to ramp up our efforts. And so I'm really pleased to announce today that the Mayor of London this week will be announcing a new heat plan in London focused on 6 different areas. Focusing on built environment and actually thinking about how do we really accelerate our efforts to retrofit across our city, but also how do we reimagine our public realm. And that's thinking about how do we make sure that we have much more cooler homes in the summer, but also thinking about our commercial buildings and how do we make sure they're much more cooler so our workers as well are working in the best possible condition. We're going to be focusing about how do we actually boost nature and really restore nature across our city. And that's really important because we spent centuries dewilding our city, disconnecting people from the benefits of nature, both in terms of physical and mental well-being. And although we've shown huge progress in that area, we've created the equivalent of 2,000 football pitches of green spaces across our city. We brought back beavers to London. First beaver's name was Justin Bieber. and we also had Sigourney Beaver too. This is actually a true story, what I'm about to say. And we're not here to talk about this, so I'm not trying to take away from the seriousness of the conversation, but Sigourney actually bit Justin And then we had to separate them, and then one went to Enfield, and one went to Ealing. But the Ealing Beavers, in all seriousness, yeah, there was a news story that came out last week. There's a station called Greenford Station. And Greenford Station, that used to regularly get flooded, stopped flooding after we brought the beavers to Paradise Fields Park, which is nearby. Right? Which shows that if you invest in nature-based solutions, nature can heal all of these disasters that are forthcoming across our city. So we have a huge job to play in that. But the final thing that I just want to say is, look, policy is very important, and what you do is very important. And there's loads of things you can do in the short term, and we've been working very hard, working with Emma. You know, we've installed over 100 water fountains across our city. We've got a cool spaces map that is available for Londoners. We've planted more than 640,000 trees across our city to help cool the temperatures. There's loads of interim measures. We brought together over 90 agencies through Operation Helios to really test our resilience across our city, because we know it has a huge impact in terms of our transport infrastructure, in terms of our workers, all of the above. But also, it's not just about the policy, it's about how you do policy. It's about how you actually bring people on you with that journey. And for me, why the conversation, and Alan and team, why I thank you so much for really pushing forward the health agenda on climate, is because that is how you win hearts and minds. This week, you will see that we're going to be announcing the new mortality rate in London directly related to pollution. And that's really important because, you know, when I first became deputy mayor, one of the first things that I was given was this 1 year on ULEZ report from the ultra low emission zone, right? That's the world's largest clean air zone. And it had some amazing stats in there about, you know, reduction of roadside nitrogen dioxide levels down by 54% in inner London, over 27% in outer London, carbon emissions down by so on and so forth in every borough. Fantastic, great. But what does that mean to your every single day Londoner? What does it mean to your every single day Londoner? Doesn't mean a lot. And so we have a huge job to make sure that we're actually able to communicate this agenda in a way where we're actually being able to win hearts and minds. Because my friends, and I'm sure our friends from America is going to talk about this more, this agenda unfortunately has been politicized in a way that it should never ever have been politicized. And we have a huge job to think about how do we communicate this in a way where if I'm thinking about a young Mete, how do you reach out to a young Mete? Someone who ordinarily wouldn't be thinking about climate change. And so if we're talking about the impact of pollution, what is the impact on our hospital admissions? What is the impact on our GP admissions? What is the impact on, for example, our economy, on sick leave? All of the above. And so the co-production, co-design, and how we communicate the health impacts of heat is incredibly important. We have such a long way to go on that journey. We don't have all of the answers, but that's why I'm so proud of the work that we're also doing with C40 cities, because actually one of the great things about C40 cities is that we're able to learn so much from each different cities. You know, the work that Kate's doing in Phoenix around data centers and already the heat levels that you're already experiencing. There's so much that we've been able to learn from that here in London. And just having that, you know, mayor to mayor peer network where you can actually gain that access, or actually having officers working together, has been incredibly important for us. And we're going to have some really exciting announcements this week from C40 cities as well. But look, finally, as you can tell, I'm one of those politicians you can rattle on for forever. I just want to say a massive thank you to all of you. You know, I want this to be the start of a conversation, not the end of a conversation. We have, by no means, we have got such a long way to go in getting this right. We're going to have our new heat plan that's going to be announced this week. Please engage in it. Challenge us where you think we can do better as a city for Londoners. And actually work with us to make sure that we can actually deliver a fairer and greener London for everyone to be able to enjoy it, and to make sure that no one is left behind. Thank you so much, and I hope you have a great conference.
Thank you so much to Mete. And as he mentioned, we've got an incredible lineup with to hear with our guests from the US. We'll hear from them very, very shortly. To lead that discussion, I'm delighted to welcome our host for the session, Cassie Sutherland, Managing Director of Climate Solutions and Networks at C40. Cassie previously worked at the Greater London Authority. Now at C40, she leads the development and delivery of sector programs and support to cities in energies and buildings, food and waste, transport, urban planning, air quality, and climate resilience. Cassie, it sounds like you have an enormous amount of time in your hands, so thank you for being here today.
Well, thank you so much. And yes, the collection of all those things is I'm really trying to help cities get stuff done. I think that's the aim, and really the aim of C40 generally. We're, as Mette mentioned, a network of nearly 100 cities all around the world who are taking the most ambitious levels of climate action. And our job as a network is to help them deliver those ambitions, learn from each other, inspire each other, and make change that's truly impactful on a global level. So, with that in mind, I'm delighted to welcome two city leaders who are truly delivering at scale, at pace, and are going to join me for a conversation for the next 40 minutes or so. So let me welcome to the stage Mayor Gallego from the city of Phoenix and Mayor Higgins from the city of Miami. Thank you so much for joining us. So you're going to hear about the great leadership and action that Mayor Higgins and Mayor Gallego are doing, but we're also delighted that they are members of C40 as well and really leading the way for lots of action. Especially, we're going to talk about, climate impacts, heat and health today. I feel like you're going to teach us a thing or two, both of you, about how to deal with this heat in London. And sitting next to the mayors, as I'm gently sweating, and they're looking pretty well composed this morning, I feel like I personally have quite a lot to learn from them in this. My upbringing in the north of England did not help me in these 38 degrees in London. So you'll excuse me for that already. But I think what's really exciting about our session now is to really, we're not just going to talk about the commitments that you've made, and I think, this is really leading on from Mette's great opening remarks there. It's about the action cities are taking to protect residents during these kind of rising climate impacts that have an environmental, a social, an economic issue, but also the transformation of cities. As mayors, you're looking across those two time horizons, the protecting people now, but the transforming to ensure that cities can continue to thrive, be prosperous, be places people want to live into the future. So we're really looking forward to hearing across those two time horizons. But let me get stuck in. Let me get straight into our discussion today. So, Mayor Higgins, maybe I can come to you first and say, in the city of Miami, what is the most immediate climate stress that your city is facing, and how is it really showing up in the daily lives of your residents?
We've been talking a lot about heat here, but for us, the effects of heat equal water and flooding. And so we're, I think, a little bit different than my friend Kate from Phoenix. We see flooding now. It doesn't even have to be raining. The sea level has risen in Florida. And unlike many other places in America, the Florida Peninsula is all limestone. So there's no solid rock underneath us. We can't build seawalls necessarily, high seawalls to protect us from the water. The water can literally come up from under the ground. So the water is rising, not just next to the coastline, but sometimes the places most vulnerable to water and rising seas are inland because of the limestone. The temperature of the water, particularly for us, is outrageously high. It puts our tourism industry in impact, which obviously has a negative impact on jobs. Everything from the coral reefs dying to the lack of oxygen in the bay when it's not particularly deep. We have had massive, massive fish kills where you can literally almost, go out and the entire bay is just nothing but belly up fish. So for us, the flooding and all of these associated water issues are key. And then obviously the aggressiveness of hurricanes. We are terrified of these outrageous accelerations. I think we saw that last year and the year before, particularly in Acapulco, where you go to bed at midnight and it's a tropical storm and you wake up in the morning and it's a Category 5 hurricane that just wiped out Acapulco. So for us, it's really the impact of water. That's what people talk about. Mete mentioned the politics of America around climate. If you're in the state of Florida, we probably have the worst environment. Sometimes it's actually illegal in the state of Florida to talk about or implement policies around it. But our residents, you can talk about water and flooding on their streets, and they all agree. So we have to use words to get around the kinds of things that other people are much more comfortable talking about to be able to get to solutions.
Yeah, thank you, Mayor Higgins. It's so powerful, that also kind of meeting residents where they're at and what they want to talk about as well. And of course, how it's affecting them in terms of jobs and their livelihoods and so on. And Mayor Gallego, in Phoenix, what is the most immediate climate stress that your city is facing, and how is it really showing up for people in their daily lives?
It's absolutely heat, and so we try to focus on that in a wide variety of ways, and we've implemented some strategies that apparently might be useful in London and the UK. So Phoenix is a hot desert city. We're near the Grand Canyon in the United States inland, so different.
Yeah.
I do not have to worry about oceans. But one of the policies we've done that I'd recommend to other communities is a worker safety policy. So all of our business partners at the city have to have a heat plan if they're doing outdoor work. So that often would involve making sure you have shade for your workforce, water breaks, ice on site, and that would apply if you're loading baggage at our airport, which we operate, or if you're tending grounds and doing landscaping. And we think that's been very helpful, just asking the employers to think about it and put worker health at the forefront. We have a wonderful committee that's advised us that includes trade unionists and PhDs in health, and it's really helped us come up with great policies. We also have a Shade Phoenix plan. Yes.
I like a bit of audience participation.
I love that, yes.
I love a whoop for a good policy. Yeah, let's go. See how many we can get throughout
Right,
today's
exactly,
session.
yes. We'll definitely go for whoops for good policy. Fabulous. So we look at everything. We're doing more than 500 shade structures in the built environment and planting tens of thousands of trees. We're trying to do it where people are walking. So if there's a library between a school, we want to have shaded corridors. We know that trees can make up a 30-degree difference in Phoenix. We do have one strategic advantage: it is not humid. So when you're in the shade, it makes a huge difference. We're doing in our areas where we see the most people walking, like our downtown, we have a shade requirement of 75% shade cover, and it makes such a difference. It was inspired a little bit. We had people who would hide behind a traffic signal where there'd be 3 inches of shade, and they'd wait to cross in that 3 inches of shade. So we said, we can do better than 3 inches of shade. Our artists have been amazing. They've really embraced creating beautiful art that celebrates our city and creates shade. And we're lucky. We're named after the mythical bird, so it makes for very good public art but you can create beautiful canopies, and it's really enriched the city and been very positive. Our heat work has been incredibly widely supported. So in the United States, we go to our voters all the time to ask for approval for certain spending items. And I did a big general obligation bond, which is capital package across the city, so building everything from libraries to fire stations. We did this very special public opinion polling where we give people the length of a pretty long ballot initiative, and they can highlight what they like and what they don't like. The most popular thing in the bond were our firefighters. They're very beloved. But second most was our heat work. People really felt we could make a difference. They were willing to tax themselves with property tax, which is a really big deal, and say that we could invest in heat, then it would make a big difference. And that was really exciting to me, that not only are they willing to spend money, but they think government can improve things. So that was very inspiring, a little, hopefully, good news from the United States. And since I am speaking to a global audience, I just want to make sure everyone knows the majority of the economy in the United States is still explicitly working to reduce our greenhouse gas emissions. So really important.
Absolutely.
Mayor Higgins and I are doing work with a group called America's All In while we're here, and just working to say, from our biggest states to some of our smallest cities, we are still working on this at the subnational level. So local government may save the day.
It may indeed. Thank you so much, Mayor Gallego. And you know, across the C40 network, we are seeing such amazing action from the US cities in our network that is inspiring elsewhere, and just that action not only sustaining, but growing, you know, and really kind of gaining more impact. And thank you very much. And I think there's so much in there that other cities will be able to learn from, and whether it's at city level, whether it's at local authority level, you know, different levels of subnational things. Mayor Gallego, you talked about bringing together different groups to really then engage in the plans, you know, and the development of that. And I think from Mete's point before about how we make policy, not just the substance, but bringing together trade unionists and academics, and really kind of ensuring that buy-in and design is so important, because of course the impacts that we're seeing are overlapping and kind of, you know, all impacting each other, aren't they? There's lots of kind of, you know, cross contamination, if you like, or cascading failures, you call it in the resilience world, don't you? Kind of these things. And maybe Mayor Higgins, I can come to you there of, you know, I'm sure Miami is facing a number of those overlapping stresses. You talked already about the huge range of impacts from the water stress, you know, whether it's economic, whether it's environmental, whether it's social. And we want to be able to talk today about the actions that you're seeing. So how do you manage some of those overlapping stresses in Miami, and maybe give us an example of something that you're doing?
We have a couple of things that are happening. One is we have a major stormwater action plan. And that is a data-driven plan that's analyzed the entire city. It's about $1 billion in capital projects. We don't have all the billions of dollars yet, but we have over almost $200 million, also from a bond that our voters voted to tax themselves to help stop flooding in their neighborhoods. Excuse me. And that does everything from raises roads to stormwater pumps to one-way backwater valves to make sure water's flowing the direction that we want it to flow. But the other piece in all of that is making sure that our projects are doing more than one thing. And I'll give you an example, our parks. We're trying to use our parks to essentially be places where resiliency happens. And many of our parks are along the water. And so sometimes we'll have a seawall, but we are now building new seawalls called living seawalls. They're 3D printed concrete, and they're biomimicry of what the natural sea might look like. And we have university studies that are proving that more marine life is in there. The water is being oxygenated in all of that area. And then coupled with that, we're doing living shorelines. We just have to be realistic. The water's rising, and we have to be able to give up some things. So that is all kinds of, from mangroves to rocks, just building it out feet and feet outside of those seawalls. But then, to make people happy with all these resiliency things, you give them a kayak launch so that they're able to take advantage of the newer and cleaner water. And then just on the other side of all of this, we're now building beautiful trails and walkways with trees, real trees. You know, Florida, we have to educate our population. Trees not only cool you off, as Kate knows well, but in our case, if we have the right kind of trees, they help with flooding, right? Because they absorb so much water when we're having a storm through their root system. And so we're having to re-educate our population that palm trees are not trees, they're grasses, and they don't absorb any water from their roots. They look lovely, but they're decorative. They're not actually helping with flooding. And then, of course, in all of this heat, we are having to set up what we're calling resilience hubs and cooling centers. And so the cooling centers are just that. They're at our libraries, they're at our parks. People can come when we have implemented May 1st through the end of October heat season. We have text messages that go out and phone calls. We're calling our residents saying tomorrow is going to be an excessive heat day. You know, call 311 if you need to know where to go to have air conditioning and do that. And then our resilience hubs are really designed for when we have a big storm. And these are in our low-income neighborhoods, right? Because when power goes out, those residents are the most adversely affected by food insecurity, financial insecurity. And again, those would be in parks. Sometimes they're actually in churches, but trusted neighborhood organizations. They've got generator power. The generators are elevated above flood level. They've got food. They've got water, the ability for people to charge. And so really making sure that the cooling centers and resiliency centers are in the neighborhoods that cannot afford to get out of town when a storm is coming.
Oh, so interesting, Mayor Higgins, and so practical there. I haven't heard that biomimicry of seawalls.
Biomimicry,
before.
that
This
is
a
like,
new one for
there
me.
you go. That's my word. It's cool. Look it up. Look up Kind Designs. Check it out. And they're a Miami-based company printing these seawalls right in town.
Brilliant.
Yeah.
I've seen that for some examples, but never for seawalls. So I think that's really fantastic. And also that point of, the kind of re-education of what is the infrastructure that will bring value and change here. So that could be nature-based, what kinds of trees, what kinds of planting, how do we create that space? That's so important. And how thinking particularly around that kind of protection that you've given the residents there, the cooling centres, the resiliency hubs and so on. How are you kind of making sure that any of the investments you're putting into resiliency are also extending into a longer term protection for people rather than just kind of in the moment of a storm or a hurricane?
I think that is the point of our stormwater master plan. We have got to make sure our streets don't flood on any given day. Forget about storms. They are flooding now. You can go out there, if it's a full moon, we call them king tides, and the streets will be flooded, and our parks will flood. And that is building everyday resiliency in. And our residents know that they live on a street that floods. And so we have a shoreline, in addition to that plan, we have done a shoreline resiliency plan, and it looks at 4 archetypes. We have the Miami River and we have the Bay. And so we've got 2 different designs for parks that are along the river and along the bay. And then we have 2 different designs if we're along, if we're kind of not just a park, but our street deads on. And we have right now already under construction 2 of the 4 projects in those archetypes, so we can see how is this design that we've done protecting that particular street or that particular park, so that we know we've done it right when we expand to all of our other streets that that hit the bay or the river, and all of our parks that are along. You've got to design not for the storms, which could only come once every 4 or 5 years. You got to design. Right now, we flood every week, particularly during the rainy season, which we're in the midst of now. So we cannot design for storms. We have to design for storm surge, but we got to design for what's happening. Climate change is a today thing and everyday thing. Storms happen every other couple of days. But for us, we got to keep people cool, and we got to keep their streets from flooding now.
Thank you so much. That kind of the daily impact that we're seeing. And talking about that kind of daily impact and the impact on people, Mayor Gallego, maybe you can tell us a bit more about, the real impact that heat is having on people's health in the city of Phoenix as well. And what are some of those kind of, how are you managing that? How are you helping people through that, sort of the prevention as well as then the protection?
Absolutely. So it's a real challenge for us in the city, and we try to be very intentional about it. I was pleased to appoint a chief heat officer. We actually are both history makers in terms of U.S. and heat. So before the mayor served the city of Miami, she was a county elected official, which is a more regional level of government. And her county appointed the first chief heat officer in our country. And then Phoenix was able to appoint the first chief heat officer at the city. So that means year round, we plan for heat and really try to think about how we can build a smarter, safer city so that we can be more resilient. That's everything from the physical infrastructure. So we have now paved 150 miles with cool pavement, which is a lighter reflective coating. So, if you wear a black t-shirt, you get much hotter than if you wear a white t-shirt, which reflects the heat. And so that helps us particularly cool the city at night, because we were finding black pavement kept the heat in overnight. And so our nighttime low temperatures kept getting hotter and hotter. Our natural desert environment cools dramatically overnight, but the hot black pavement did not. So could we keep a more comfortable city in that area? We're looking at different paint coatings. So if you're going to plug your startups, I got to talk about, plug one of mine. We have a company, Encoat, that does heat emissive paint. If you watch in the United States, many of our World Cup venues now have that startups paint on there, so it helps the physical infrastructure cool, and that can have really important local heat impacts that we're excited about. Phoenix just invested $50 million, or committed $50 million in a new medical school. So Arizona State University is our big university system. They're opening up a campus in London, so please look out for them, a very innovative school. They've been ranked #1 for sustainability in the United States and have been incredible partners of ours. So they're starting a new medical school. You'll get a degree in engineering in addition to a medical degree, and we're really thinking about how we can change the city, including the built environment. As part of the city's investment, they've agreed to focus on heat, and so that's everything from, are there certain electrolytes that our firefighters should be drinking to help them work fires in the summer, to our most vulnerable populations. We know that certain people facing addiction may be more vulnerable to heat and may have worse medical outcomes, so they're helping us. What interventions should we have in that area? And we're really optimistic that we can save lives in this area. During the 2021 London heat wave, our fire department talked with the deputy mayor who oversees the fire service here, and we shared some of the things we do. We have mobile cooling units, so they could go out into a community that had lost electricity, or if there were an active fire, the firefighters can go and cool down in that area, and that's been very helpful. We also put ice on our fire trucks and do things like cold water immersion therapy, which can cool the body dramatically more quickly than other methods, and so it could even prevent brain damage and some of the more acute symptoms of heat stroke by getting out there. And it's a pretty simple, it's a giant blue bag that a human body can be immersed in with ice, and we think it's really improving health outcomes and being a strategic, fairly low-tech way to help people during heat events.
Oh, thank you, Mayor Gallego, for sharing those such practical things, and that kind of sharing between fire departments, through education facilities, across cities is so important to say these are some of the simple yet really effective, these are the most impactful solutions that you can have maybe in those emergency situations. Mayor Higgins, maybe I can ask you a similar question about the health of residents and some of those issues you're seeing around, whether it's from flooding, whether it's probably water quality as well, how is that really affecting the health of some of the residents of Miami?
Well, heat for us, it's hot all the time, all year long, right? I think we maybe get a week where, I don't know, we bundle up, but you would make fun of us. So essentially you're running the air conditioning all year long, which is fine if you're affluent, but it is incredibly costly if you are a low-income working family. And so a lot of the work that you end up, who are most vulnerable? Little children in that situation, older people, not being able to afford the air conditioning that they need to stay cooler. So we are implementing a number of weatherization programs for people that either own their homes but are older and on fixed income. And then also basically no interest loans, which you pay back over time, that are for landlords to retrofit older buildings that either have really crappy air conditioning or terrible windows that are not particularly energy efficient. So we're not trying to keep you warm, we're trying to keep you cool with better windows. We also are in the middle of, thanks to C40, doing indoor temperature studies. We have heat sensors in 7 of our poorest neighborhoods in people's homes, which, by the way, took a lot. People did not want to participate. Right now in the United States, there's a lot of fear. Miami's an immigrant community that the government would be monitoring them, and we're just really trying to see where your home is so hot so we can help cool it down. And we were lucky enough to find enough families in enough neighborhoods to do that. So that data is forthcoming, and that will inform how we further cool things off. Speaking of water, you can use water in a good way. We are upgrading and redesigning our parks with more swimming pools and splash pads, so that, again, you can get kids, you can get old folks in there. And it also puts a burden on making sure we have more swimming lessons. Low-income kids don't necessarily know how to swim, and so that's been a big part of getting kids into the pool, getting their families into the parks, where we do have nice tree canopy, and we are improving the tree canopy. But our outdoor workers, we're in the terrible situation in Florida where our state legislature has made it illegal for municipalities to implement heat regulations for outdoor construction workers and others. We are literally not allowed to require shade. We're not allowed to require water breaks. We're not allowed to require fans on construction site. Don't get me going. So what we and at our airport, we tend to do a little shaming. We tend to get community groups involved, talking about if they're going to build this, they want these built in through a community benefits agreement. And at least this way, if it's on city land, we are actually able to get them to come to the table and agree to it. And now we have a couple of companies that are just finding it easier to say yes to that, because they don't want any resident opposition. So you have to get around you have to comply with state laws. Obviously, we're a local government, we can't be out of compliance, but you can navigate to get what you want in small ways. But it would be nice to be able to require them, but we're not allowed to.
I love a creative solution, though. It sounds like a creative solution to a problem. And so interesting, you're talking about the impact of the cost of air conditioning. You know, in Europe, we've talked for many years about tackling fuel poverty, but really tackling cool poverty is really, front of mind for many populations in Europe now. And I think we have a lot to learn there from cities in the US about that kind of, the cost burden that it puts on residents. So I have 100 questions, always, especially for such wonderful leaders like this. But I'm going to go out to the audience for a few questions for a few minutes before we come for some closing points. So any questions in the audience? So the first hand was here, just in front of this pillar, and I think there's a microphone coming, and then I've got one over there, and I've got one over there, so I'll do those.
And if you could introduce yourself, we'd love to know who's here.
Please do. Yes, thank you.
Oh, if it's not on. Oh, it is.
There it is. We've got you.
Hi, I don't really know how to introduce myself because I'm a scientific director, but I'm really here because climate is something I want to move into. I don't really have much knowledge at the moment. So thank you for that. But I suppose my question really is on air conditioning, because when I talk to any fellow Londoners, they're the two words you're most likely to hear. And thank you for acknowledging that it is needed in some circumstances. There is cool poverty. And also, though, I'm kind of aware, could this be a solution that also contributes to the problem? I know that in Spain, as a climate action, they've actually introduced legal limits on how low or how high you can turn your heating system. And I'm thinking about the mentality that underpins everything that happens, and the kind of the technology can save us, or at least technology will make us more comfortable right now. And how big a problem is that? I mean, you've both spoken about incredible kind of non-high-tech solutions that aren't going to add to the problem, but how do you tackle that mentality of, oh, I'm too hot, I'll just turn the air conditioning really low and I won't think about the fact that maybe I'm using it unnecessarily and making the problem worse?
Yeah. You're absolutely right. Air conditioning with the heat that spins off, and you all are in a little bit better situation because you're low humidity. But in high humidity environments, puts out a lot of heat. Unfortunately, there's two, we talk about the cool poverty. People that tend to live in lower priced, kind of subpar housing tends to be built without any energy efficiency in mind. So it's worse. Many of the larger homes and people that have designed and are more affluent can design their homes to actually minimize the cost and the impact. So they're actually, even though the home is bigger, they're using less power in their air conditioning. I actually think air conditioning is an area where there's a lot of innovation going on. It has been stuck probably for decades as being very, very energy inefficient and heat producing, but I know there's a lot of innovation going on. in that area. We also need to see, particularly in putting in more fans and the old-fashioned designs. I grew up in New Mexico, man. We didn't have air conditioning. Our walls were, I don't know how thick they were. They were adobe walls, and the windows were designed. So I do think you're going to see a whole new set of designs. The Middle East, by the way, they didn't have any air conditioning. It was just as hot 500 years ago as it is now in our towns. But everything was designed for air to move, and we've gotten away from a lot of those. And so, for example, in our heat strategy, it's shade, water, design. Those are the three elements of it. And you've talked about it, the shade structure. So you're right, air conditioning, in some ways, we need it from a health perspective, particularly with the elderly, but it could exacerbate the problem if not done properly.
So we do have standards where you, as a landlord, have to provide a certain environment, and it cannot get too hot in that community because the heat can be very dangerous. So that's where we have chosen. In case you just added a new word to your vocabulary, adobe is a mud building technique that's native to the southwestern United States and is, again, very environmentally friendly and efficient. We, particularly in our downtown, are trying to design so that wind tunnels, and then that you can have the natural wind cooling effect. We also have 2 lakes under our downtown, which we use for district cooling. So I think in most of Europe, district heating would be more common, but we do have district cooling, which can be a much more efficient way to heat. And we've not had this challenge, but should there be a major power outage, would probably provide cooling for much longer. So if you ever want to come to Phoenix, we have the Hidden Phoenix tour where you can come. It's not an official tour. You gotta know somebody. But you can see the lake that's under our convention center, and it's just very cool to see how we are more efficiently cooling the downtown. And we think that type of investment will become more and more common.
And that's the kind of tour I want to see. You know that, Mayor Gallego. I'd happily tour most climate actions in any city. So, but I think it's such a fantastic question, you know, this kind of balance of we call passive and active cooling. And so, you know, all of these great interventions you're talking about, how to manage that heat before you need the air conditioning or reducing the kind of reliance on that. I had a question over here. Yeah, from before. This lady with a hand up just here in the blue top. Thanks.
Hi, I'm Vivian Fitzpatrick. So I work for Ireland's largest health insurer called VHI, and I'm on the sustainability team there looking at healthcare. So both you ladies, you know, so inspiring, and it's actually the fact that you sound very empowered to get things done, which is, we all know it's a huge challenge in this space. My question is around data centers, because you're doing so much, and it's like, you know, we all have this challenge of whack-a-mole in sustainability. As soon as we fix one thing, you've got a monster coming up with something else. So what do you have any plans to tackle that, or does it come up in your day-to-day? What sort of power do you have there?
So Cassie and I will have a big announcement tomorrow. Can we say what it is?
No, don't give it all away.
No. Okay.
There you go. But you can, I mean, you're in charge here. You can whatever you want to say, but keep a little bit back.
Excellent. So working with C40 mayors, including in my case, Lord Mayor Rees of Melbourne, we've been really working on helping data centers improve sustainability, and it's a huge challenge for me. So the greater Phoenix area has one of the largest concentrations of data centers in the world. You probably have gotten out your phone and done a search that impacts us on the ground in Phoenix. Data centers give off a significant amount of heat. So my friends at Arizona State University have been doing some really important research on the local heat impacts, but data centers, as you know, use an enormous amount of electricity, particularly the hyperscalers. That creates local heat impacts that are pretty significant, particularly for hotter cities. Cooling data centers uses an enormous amount of power. So we do have one very large data center that's on that district cooling center technology we have in our downtown, and it uses much more power and cooling than a very significant employer with a lot of jobs in that area. So it's a really significant. We are looking at what kind of standards we can have for cooling them and for the building envelope to make sure that they have diminished impacts on the neighborhoods. In Phoenix, many of these data centers are in residential neighborhoods, so people's homes are literally across the street, and we're really trying to encourage them to be better neighbors in that area because it's been a huge challenge for us. Many communities are now citing data centers where they can contribute to district heating. So the data center might be in a neighborhood and the heat it puts off could reduce the energy costs for the neighbors. For us, like Miami, we don't spend a lot of money on heating, so that's less helpful for us, but we're trying to understand, are there industrial processes like food production that you might be able to co-locate with data centers so the waste heat becomes productive? But for us, like, I'm very concerned about diminished property values near the data centers and the local impacts. So trying to work very hard to say we ought to put data centers where they can do the most good and bring benefits, and that they have responsibilities to invest in sustainable energy and support their local communities, really to give back. This is, I think, for us in the United States, by far the industry attracting the most money, most capital, and we have to get it right as a planet, just given the enormous resources that data center uses. But I think if we all push for higher standards, we can have a race to the top as opposed to a race to the bottom. I didn't give away too much.
No, you were perfect.
All right, everyone check your news tomorrow.
Yeah, please do. But not too much of a spoiler, but really, you know, this is the challenges that Mayor Gallego describes there as being experienced by a number of cities around the world, this kind of big influx of data centers. And so at C40, we've been looking at how we kind of bring that voice together and to see how we can really support some of that growth in a way that delivers exactly the benefits that Mayor Gallego suggested. Okay. This clock is flashing at me, so it says there's not much time left, but we've got time for one more question, and it was this gentleman in the back because he was in the first round. I'm sorry about not being able to get to everyone. Please.
This is just a fantastic presentation. And Eileen, I think it was a decade ago I saw a presentation on the vulnerability of Miami, and hearing what you're doing, it's just very inspiring to have hope in the face of what is often quite bleak. My name's Rich Wilson. I run the ISWE Foundation, which works on democratic infrastructure around the world, including the States. There's two things that I was really thinking about is denialism. Again, in very climate vulnerable places we work, we experience quite a lot of denialism. Like Lou, which is in Cornwall, the most climate vulnerable coastal place in the UK, there's huge denialism, even though large portions of the town now are effectively derelict. So is that an issue? You know, what do you do about it? And secondly, I was on how they tackled the Hungarian election. And they spoke about, on issues around climate, they never mentioned it. They just spoke about health. They just spoke about finance. And I suppose in places where you're operating, do you just not mention like the C word and instead just focus upon the money, focus on the health, focus on the things where you've got real political kind of capital?
I mean, I can tell you what I do. So just to give you a sense of Miami, we're a blended family, primarily Republican, pretty conservative. And so I don't, when I'm campaigning, talk about climate change, but I talk about flooding. I talk about how your neighborhood's at risk. I talk about how hot it is for your kids when they're walking to school or walking to the parks. I talk about how high our property insurance is. You own a home, sometimes your insurance costs you more in Florida than your mortgage. And everybody knows that that's code for climate change, right? No one is confused. Does it make any difference? They all know we're using those words to be inclusive words versus words that divide, right? If I say that, the planet's getting hotter, that's divisive. Whereas if I say storms are getting stronger, gosh, when we go swimming, the water is higher and our fish are dying. If you've got to use words that show what people are feeling and experiencing. You do not need to use kind of what I would say climate speak, the words we all use. I can't think of a day where I said the words net zero to a resident in Florida. And so you can, at the end of the day, what we have in Florida and the United States of America at the very high level is we have politicians weaponizing language, but when you get down to our level, we just talk to our residents about what they're seeing and feeling, and we fix their problems. And as a result, American cities are making huge progress on resiliency, on decarbonizing, you know, all of that. And our residents are in on the game, and they're happy to be in with us. They vote for both of us, right? I mean, so they clearly want people like us that take this seriously, and they're happy that we don't, you know, use the wrong words.
Thank you. Mayor Gallego, any closing points from you?
I would say the same. For us as elected officials, it's important to use the language that your residents use. So I mentioned when we did that public opinion polling, heat was among the most popular and biggest consensus in the city. And so we got to listen to the people who are our, like in my case, 1.7 million bosses, and try to speak to them in words that make sense and that reflect their daily experiences. So I think I agree that people know this is happening. They see every day the changes in their lives, and they want solutions to those challenges.
Well, we've reached the end of our time. Thank you so much to both of you, not only for your time today, I mean, coming all the way here to London, to sharing the action that you're taking, giving us all a step ahead, you know, a step forward in the action we can be taking, but also for your incredible leadership. I mean, it's really been very inspiring time. So thank you again, and thanks everybody for today.
Yeah.
Thank you.
Amazing. Thank you all so much. What an incredible panel. So many wonderful lessons for us to learn here, including how we talk about this subject and make sure that we're having the biggest impact. And those are themes and threads that we'll pick up on the culture stage later on today. Great news. It's time to get up, stretch your legs, meet some new people, have something fresh to drink. Refreshments are on the 2nd and 3rd floors. Our food resilience track is also starting on the 5th floor, so please head up to there as well. And join us back here for 12:10 for a prompt start. Thank you. Welcome back. Welcome back, everyone. Good afternoon, everyone, and welcome back. Thank you so much for coming back so promptly. Quick question for you. Hands up if you've managed to meet somebody new during the break or at any time today. Oh, this is very good. Couple of stragglers, though. All right. Your job for the day, your quota for today is to meet at least 3 new people. All right, I'll check back later. Okay, so far today we've talked about what's happening at the national and local levels. It's now time to get a little bit more personal with our next panel. Our next session will be led by the phenomenal Financial Times' global health editor, Sarah Neville. Sarah covers healthcare developments around the world, including our own NHS here in the UK. She will lead the conversation on the impact of heat on maternal health and look at what is already being done to protect both mothers and their unborn children, and what countries like the UK and elsewhere in the world may now need to start thinking about. Sarah, please.
Thanks very much. So I guess there are a few more poignant and direct manifestations of the impact of heat on health than the effect it's having on pregnant women and their unborn children. There's now overwhelming evidence of a link between exposure to extreme heat and some of the most feared pregnancy outcomes. More than 200 studies have shown a link with premature birth, stillbirth, low birth weight, congenital abnormalities, and hypertensive disorders in mothers. The earliest evidence dates all the way back to 1939, believe it or not, but there's been a marked increase in the past decade. But even health professionals in the field, let alone expectant women themselves, are often unaware of the dangers that high temperatures can bring. And the aspect that most surprised me when I set out to research an article on this for the Financial Times last year was that it actually affects women everywhere, including in countries that we wouldn't think of as hot, such as the UK, although I guess today none of us would have much problem believing that. But the reason is that it's to do with a woman being exposed to temperatures that she's not acclimatized to. So it's the difference between what's normal for her and what isn't that really makes the difference. And it can start when a woman's exposed even for quite short periods. As one of my interviewees, a noted scientist, put it to me, you're not safe anywhere. And tellingly, Wales is actually the site of one of the big studies that's looking at what heat does to the human body. So I have with me a wonderful panel who I hope will now join me on stage. I have 2 people who are working at the sharp end to find community level solutions to this problem. And they are Kathy Boffman-McLeod, who is founder and CEO of HERA, that's Heat Resilience Action, and Dr. Jamila Mahmood, who is Executive Director of the Sunway Centre for Planetary Health in Malaysia. And we're also delighted to have with us Baroness Rosie Boycott, who's a leading member of Peers for the Planet, which I think is a beautifully named cross-party group in the House of Lords, which campaigns for a collaborative approach by legislators to climate change and to nature loss. So she's steeped in the worlds of policy making and politics, and we'll be able to talk about how legislative levers might be pulled and politicians influenced to centre this issue and take the action that's needed to address it. And just to say before we get the discussion underway, there will be time for your questions, so start thinking about those right now, and we'll get to as many of those as we can as the discussion continues. But Dr. Jamila, perhaps I can start with you. You trained as an OBGYN. I know you're a fellow of the Royal College of Obstetricians and Gynecologists, but when you were last in active practice, which I think was 2009, you told me, heat and pregnancy was simply not discussed. But now, as I've mentioned, we have this huge body of evidence showing there is a strong correlation between heat exposure and negative pregnancy outcomes. So could you say a bit about the current state of knowledge on that front and what we're learning scientifically about that correlation? We can't yet absolutely, I think, say causation, but definitely correlation.
Thank you very much, Sarah. And I think that surprisingly, the Royal College of Obstetricians and Gynecologists still hasn't come up with very clear guidelines on heat and pregnancy, even though WHO and many of the countries in the world have already started to produce this. So I think that, the fact is that it's no longer something that is, maybe it's associated. Many will say now that actually there could be even causal affiliation. So we should actually look at the data. I always say to people, heat doesn't wait for a heat wave to be declared, right? And every single degree is already billing the uterus. So for women who are pregnant, there have been now quite numerous meta-analyses and studies to show that for example, premature birth rates are increased by about 5%. And also, they find that there are raised odds of stillbirths, congenital anomalies even, and gestational diabetes mellitus. But the stillbirth one is quite interesting because it is shown that it can actually be very, very prominent among the lower socioeconomic groups. And I think this is where heat and pregnancy is also an equity issue. When you are, able to have air conditioning or a fan or have access to cooling systems, then you have a real chance of protecting the pregnancy. But when you don't, there is, even more dire consequences. So I think, it's causation and not coincidence. I think this is what the research is trying to point us towards. A lot of these reviews have shown that extreme heat exposure, both in the early part of pregnancy and the late part of pregnancy, are also going to be very detrimental. But I want to say something about the equity issue, but also the fact that heat doesn't occur on its own. When you have heat, it's always in situations where other impacts of climate change are also present. For example, seawater rise. So in my part of the world right now, we're experiencing something called Super El Nino. The Japanese have called it the Godzilla El Nino. So you can imagine the heat in the Pacific Islands and in Asia is phenomenal. It's relentless, which means that at night it's hot, so there's no opportunity for women to recover from the heat in the daytime. And what is also happening because of the seawater level rise, countries that are inundated by seawater and intrusion, they're also experiencing a rise in hypertension among pregnant women because the water actually becomes slightly saltier. Now, the difference is this. For many of you who live in UK and in Europe, it's another hot summer. But for us, it's a hot weather, but getting hotter. And I think that sometimes we are in a worse situation than you because we are like frogs slowly being boiled in water. We think it's okay, it's a bit hotter, but every degree that rise in temperature actually has a terrible impact on your metabolism. The other thing that I want to raise is that there are also other things you have to consider in pregnancy. Your metabolism increases, your body prefers to divert heat away from you, so it goes to the blood circulation, increases to your skin so that you perspire and you release heat. So it doesn't want to perfuse the placenta, and this is where the fetus becomes really impacted. And also the fact that metabolism of drugs also changes. So women who have hypertension or women who are on psychiatric drugs, for example, and you don't give them an increase in dosage, then you get higher hypertensive crisis and also psychotic crisis. So women at the end of the day really suffer, and then they go home and it's hot, and there's a higher incidence of gender-based violence in heat, and therefore they have to suffer gender-based violence as well. And if you're pregnant and being hit by your partner or your spouse, then the impact on the fetus is also higher. So it's not good news, I'm afraid.
No, absolutely. And who would you say are the groups who are most at risk?
The ones most at risk are the ones who are more exposed to outdoor work. For example, in many parts of South Asia, a lot of the tea leaves
that are picked by women, and many of them are also pregnant. So when you have your lovely cup of tea, please remember that a poor woman who might have been pregnant and sweltering in the sun has picked that tea leaf for you. And also outdoor, say, construction workers, manual labor, right, in markets and so forth. So these are the people who have the highest risks. They are from lower socioeconomic groups, and most likely in these parts of the world, the policies on protection of the human capital or human resource is not as well developed as in some parts of the world. So not only are they hit by that, then there's no protection mechanisms.
Really interesting. Thank you, Jamila. And Kathy, perhaps I can come to you now. First of all, could you tell us a little bit about HERA and what its mission is, what your organisation does?
HERA means many things. It's Heat Resilience Action. It's also her action. It's Heat Era. It's a Greek goddess, the guardian of women. It's a female form of hero, means love in Luo, a Kenyan language. It means diamond in Hindi and Urdu. It is a beautiful capture of what we are about, and that is to protect the health, income, and dignity of women on the front lines of extreme heat. And everything that Dr. Mahmood said times 10, and women are just getting punched by extreme heat. The unpaid care burden of taking care of everyone else who is sick, the seniors, in-laws, parents, children, nighttime temperatures being driven up and up by the heat of climate, but also by the built environment we have so many people living in. And HERA's motto is strength in a hotter world. And we have solutions, and our focus is women-centered heat solutions. And to get right to it, we have a program that now has 300,000 women across India, West Africa, and Southeast Asia insured against lost income from extreme heat. And it comes with a cash support program, ways to reduce the risks, built environment interventions, cooling centers for head loaders, specifically in Ahmedabad. We are reaching women, and women receive information in different ways from men in terms of an early warning system so that you have the information that you need. And so HERA is about understanding the impacts of heat to women, quantifying them, and then building solutions. But the important part is that we don't start building solutions until we have a conversation with women. What is happening in your life? And what you will also know is that women don't say, well, let me account for all of the ways that heat is impacting my life. No, you have to say, what's happening for your work? What's happening for your kids? How much income are you losing? Our market traders in Freetown are losing 60% of their earnings from extreme heat. The things that you're selling are going bad before you can sell them. You are giving out, the foot traffic is down, and children come after school and stand with their moms in the markets. And if it is just roasting hot, the kids are also being affected. So when your income is down, your agency goes down. And if you add the mental health effects and the violence that comes as a result, because people are hot and angry, and there's so much to say about this. Yes.
And I guess heat is something that people have typically taken for granted, so that they wouldn't even think of it as a factor.
It's just hot.
In pregnancy, it's just the way they live.
It is just hot. But that's not the case. It is advancing so quickly, more than the human brain can keep up with. That's how hot it is. And when it comes to pregnancy, and you quoted some of this, Dr. Mahmood, but exposure to extreme heat during pregnancy, and this is very simple, but is associated with a 27% increase in severe maternal morbidity and a 28% increase in stillbirth. And so first we have to understand it, and then we have to co-create those solutions that work for women. And HERA's focus is for informal women workers. And so often these women are invisible. And there are 772 million women working in the informal sector facing extreme heat in the world. And so that's a lot of people, and that is a lot of economic power. That's a lot of care in a family. And women are putting 90% of what they make back into their families. Men, your number's less. It's 40%. So think about what that means financially, economically. And so heat is an economic hit, but when it comes to pregnant women, that's your most vulnerable state of being a human, is to be pregnant and facing extreme heat. And we have the choice of the air conditioning. as you said.
Yes.
And many don't have the capacity. So the fairness and justice issue comes right into your view right away.
Yes, and you mentioned co-creation, which is interesting. That's really important, that women are on board, and partners, I guess, not just women, with the solutions that you're looking to
yes,
adopt.
and our model is to partner with organizations supporting and liaising with women. And when you think about financial supports and information, understanding heat, getting the connection between what you're experiencing in your body and your income and your family and the heat, and knowing, there have been times where we've had women say, it must be something I've done. I mean, I've done something wrong because this is coming down on me. And so learning about climate and understanding that climate is driving this heat and it is not your fault, and that these are the things that you need to know to be able to protect yourself and inform yourself. And then, of course, money in and money out is essential with these partnerships. And so we've established partnerships with the Self-Employed Women's Association, with Mahila Housing Trust, with the Council of Women Traders in Freetown, HomeNet in Thailand. And those organizations are essential to have the conversation. And they take different forms. It can be that you just sit down in a shady spot and talk. It can also be focus groups and workshops, and
Right, interesting. And Jamila, that co-creation point,
Yes.
you were responding to when Kathy said that. That's very important, you think?
Yeah, I think that, many of the good examples where women's health issues are tackled are really basically when the community participates. And a lot of the very good examples are actually from the middle income countries and the lower income countries, right? So for example, teaching women who are pregnant or postpartum about heat, and teaching them how to use cold water, for example, dipping their feet, washing their faces, and so forth, is important. But also in Kenya, there was a series of workshops where they work with women, and what happened is when this education is given to the family, even the men started to do more household chores, giving time to the women to rest and cool down, right? But I think that what is important is not just these measures, but what policies then follow. Some places in Zimbabwe, for example, it's also infrastructure, which is why it is a planetary health issue. You can't solve it just by looking at the health. You have to look at built environment, you have to look at transportation, you have to look at all the factors where a woman will have to get access to antenatal care. In India, for example, they have a lot of these workers, they call ASHA workers, and they're the informal sector, and they reach the women who are pregnant, and they're very good channels for information to women, but they themselves are not protected from heat. So the protection issue is not there. Now coming back to the UK, we have the Magenta study, which is really important.
This is the study in Wales that I mentioned.
But that's a study, that's research. What needs to happen now is the policy that follows the Magenta study is going to be quite critical. I think this is where Baroness will play a very important role. So, and again, coming back to the inequity issue, that it is the poor that are really affected. It requires the people who are sitting in their offices, who are designing cities, who are designing hospitals, who are financing, built environments. How do they participate and understand that the impact of heat, or in fact any form of climate change impact, is not gender neutral? It really does affect women more than men.
Yes. So heat is a feminist issue, you could say, and I'll bring in Rosie as one of our most famous and distinguished campaigners on gender issues over your lifetime, Rosie. How do you respond to what you've heard so far?
Well, I think it's wonderful, all the things that you're doing, and I'm kind of listing off in my head all the things that we're not doing as we speak, and the initiatives that you talk about. I suppose the thing that surprised me the most, and you can call me naive, was the realization that it's about the difference in heat that you're experiencing, not the amount of heat. Obviously the amount of heat works, but it would not have occurred to me if someone said, who gets really affected, which women get really affected by heat in pregnancy, I would have thought for women in the developing world first, and not people here. And so that is an extraordinary fact that needs to be disseminated far and wide, because we're just not aware of it. In terms of our buildings, we still do not yet have all buildings built with proper flood specifications, which at the moment is the top of the heap of one of the environment bills, and heat therefore needs to be incorporated. There is thankfully quite a lot of work going on around tree planting, and I was looking at a thing at an event on trees last week, and the difference you can make, that on the tarmac it's nearly 40 degrees some days, and just literally yards away on the pavement you're back down into the 28s. It's still hot. It's not necessarily quite so dangerous. So the tree building is huge, but again, with so many things in our government, you make a mission, and I think it probably will be passed, that we are going to build the trees, but we don't have any tree surgeons, we don't have people in the councils who look after them, and trees die. And we've seen that happen in small scale. So the thing about this whole thing, heat and flooding and everything, they are all so completely connected to how we're going to have to look at the adaptation program for the entire country. And that adaptation program was published about 3 to 4 weeks ago. If we get it to work, it's a tremendous kind of underpinning of both our housing, of the way we eat, immense amount of things that all connect together. And it's very encouraging. But I do feel right now, especially as we're looking at this, at El Nino coming, and by the way, tomorrow is the 50th anniversary of the 1976 earthquake. Keep calling it, it's the 5th time I've called it an earthquake.
It felt like
the
that.
heat wave. And there was a big event this morning celebrating that, and it's been organised by the Met Office, we have a brilliant Met Office, by the way, if anyone doesn't know. It is one of the best in the world, if not the best in the world, in terms of weather predictions and how it works. And they have got this, tomorrow the television screens are going to be absolutely covered with this fact about, that had that level of heat wave appeared on the current climate that we have, we would have been looking at temperatures over 40 day after day after day. So they're just pointing out a very clear and obvious reality that at some point in the not too distant future, and indeed maybe next year because of the presence of the El Nino. So now it's time to act on behalf of hospitals. Do not have enough cool or space. Schools, we're shutting them already. I mean, I'm going away from pregnant women here, but, schools is also a dramatic thing. What are mothers meant to do when their children are sent home? And then they're sent home into an apartment that is too hot. They're sent to a park where there aren't enough trees. It's a follow-through of a society that doesn't care and is also, I think, I read an amazing book last year called The Heat Will Kill You First by a guy called Jeff Nuttall, who's an
Jeff
American.
Goodell.
Yeah, and you really get to understand the social disparity of heat and how this is a money issue, because he took in Portland when that heat dome was on, the temperatures in the suburbs, which were full of trees and grass and flowers, were 16 degrees lower than the temperatures down in the social housing units. And he also spent quite a lot of time in India, in southern India in particular, outside towns which had built over the places where, I'm not giving a plug for the British, but where the British had built reservoirs because there were some nice big spaces of water and they had dried out. And so they thought, great, we'll put up concrete housing. And the temperatures go off the charts, and they are literally like, they're furnaces. So we need a very good hard look at this, and it needs to get more into the conversations and across the department. So all this information is golden for us, absolutely golden, the work you've done.
The whole sort of aspect of lack of joined up policy making, both between, here in the UK, different Whitehall departments, but perhaps also with local government, with civic society. This is perhaps a broader point that Cathy and Jamila, you might like to speak a bit to.
I would also say congratulations to the UK for the UK Heat Risk Commission, which is recently formed and chaired by Emma Howard Boyd.
Is now doing.
So there's immense leadership in the UK and in London, and I know there's more to come from the mayor, and so bravo for that. The joined up part is really important, the awareness part, just of the way that you just said, Rosie, I didn't know. And so this is half of the work. And while we get ourselves educated, these financial mechanisms that support people who are disproportionately affected, pregnant women, are essential.
Yes.
And calibrating the product of this cash support or insurance to a woman's body, to a human's body, all sorts of data that doesn't exist. And so there's an immense opportunity. And of course, AI and technology play a role in this, but also just these conversations of joining up these dots and making sure we understand the connections between them, and the role that heat is playing in someone's financial life, and their social life.
Because you have an announcement, I think, today, don't you, Kathy?
We do.
Can you say a bit more?
I will say.
This is hot off the press. So
it's hot off the press. We announced this morning. And as I mentioned, we have a program with 300,000 women with this insurance that pays when their income is impacted, and it is called a parametric policy. And I also want to emphasize the role of philanthropy in these sorts of innovative measures, and I want to point out that Claire Harbron is here from the Howden Foundation, one of our supporters and one of the very best minds on the way that philanthropy plays a role in this capital stack, which will put pregnancy in the capital stack in separate buckets for this particular panel. But that disproportionate vulnerability of a pregnant woman and having that insurance that supports your lost income when you're pregnant, you need the money sooner and you need more of it. And so we announced this morning the world's first heat pregnancy insurance, Hera Materna. And it is heat protection for pregnancy. It comes with insurance, cash support, and early action for pregnant women facing extreme heat. We'll roll it out with Mahila Housing Trust in India with 30,000 women in 2027. Women will access the policy and enroll in it in a confidential setting in the clinic where they get their health care. We'll be doing a lot of outreach and co-creation of the product to make sure it reaches the needs. But earlier money, more money allows for better choices, the option to work less, make informed choices. It comes with the education that's needed to know that, even at 12 weeks, a slight temperature elevation means your baby will be born smaller. And so these things we need to know, and women need to know, and we need to support them financially. And so initially this product will be free. We'll be exploring a HOSPA cash, so going beyond a parametric into a health insurance essentially that lets you seek additional health care and get what you need to make sure you have a healthy pregnancy.
Really fascinating.
Fantastic.
And
I think I want to come back to what you asked earlier on. You asked me whether, when I was practicing obstetrics and gynecology, whether I knew about climate and heat. I didn't. I wasn't taught in medical school.
How could you? I mean,
and it wasn't that hot those days, right? And until today, only I think 15% of medical schools teach about climate change in medical schools. So it's a real paucity in knowledge if you don't even have basic knowledge. So for me, I was very impacted by, looking at how women particularly were suffering from climate change. When I came back to Malaysia during the pandemic, I set up a Center for Planetary Health, and we really, kind of like a think and do tank when we do some research, but we really push for policy change. And what we've done is really, leveraged on, this to build for the first, I think, in the world, a National Planetary Health Action Plan. Because we made it clear to the government and other stakeholders, private sector and public sector, that until and unless it's a systems approach, you will have these silos, and you'll talk about heat today, and tomorrow you'll talk about floods, the next day you'll talk about pollution, whereas it's all interconnected, and the health of the environment is very much linked to the health of human civilization. So, ministries need to look at how they budget and how they plan. The private sector needs to know about how their contribution is and what are the incentives and disincentives that we can put in place. And most importantly, people need to understand, and education needs to play a very important role, and values and culture and all this. And this morning we're talking about how do you communicate something like this? You can't talk about net zero. It doesn't make any sense to a farmer or person who's facing a heat wave. So I'm very pleased to share that we have the first National Planetary Health Action Plan. And just earlier this year, we also pushed very hard on education. And our next 10-year blueprint will make planetary health mandatory for all universities in the country.
Fantastic.
So irrespective whether you're doing medicine or architecture or engineering or computer science, science or culinary arts, it will be mandatory. And we started it as a pilot in 2024. So we said we can do it, so the whole country can do it. So 300 institutions. So we are now training them. We are, you know, developing the curriculum. Because until you get that change, right, that movement from ordinary citizens to understand that, yes, it's important how, you know, we are educating our young people, how we are going to then, you know, churn out these wonderful leaders who understand the connection between each. So I think this is very important. You know, I hope that this will be, you know, taken up in more countries. I know that the education movement is really, you know, gearing up. And it was very interesting. I was teaching some medical students and talking to them about this, and I said, it's your responsibility to speak up about fossil fuels. And then they said, but you know, we're medical students. I said, yes, but there's a detrimental effect of fossil fuels on health. So, you know, you're supposed to, you know, above all, do no harm. That's our Hippocratic oath.
Yes.
And to do no harm also means to do no harm to the environment. And therefore, you know, they go around on the wards and then they question the hospital director about how much green energy is there. And, the hospitals are saying, what's wrong with these students? You know, why are they asking these things? And these are precisely the kind of questions you want them to ask. So I think that mindset change must begin very young, and now it's already been moved down. So K to 12 now, kindergarten to year 12, will also have environmental education built into curriculum as well. Yeah.
And wow, yeah, bravo.
That's so how did you persuade the politicians to listen? What was the sort of fundamental pitch that allowed you to get buy-in from government and from all those departments?
Sarah, I'm an obstetrician. The 3 words I know best are push, push, and push.
That's brilliant.
But I think that, you know, timing was everything. Timing was everything. You know, in my country, I'm known as an obstetrician gynecologist, and I'm also known as a humanitarian.
Right.
So I have a lot of public trust, thank God, you know, with the public. And COVID was it turned out to be a tipping point for us because, you know, we could show that COVID, it didn't arise out of the blue. It is an environmental factor. We are all suffering now because we didn't protect the environment. Zoonotic leaks happened. So trying to show, and I was advisor to the Prime Minister then. So I could sit in these meeting rooms and literally nag the politicians in the room and the ministers to say, you're not right having the right policies. This is why this is happening. So, you know, after COVID, I can then pivot quickly to looking at climate change, and really just be really quite annoying. And, you know, going in to see them to say, these are the economic benefits. I think that is something you have to show. Health co-benefits, you have to show economic benefits. The cost to health is going to be phenomenal if you don't manage heat, or you don't manage climate change impacts or pollution and so forth. You know, it's going to be worse than COVID. So while COVID was quite recent in their memory, you know, we capitalized on that and got a group of scientists and others, you know, who work together through the National Science Council, which is chaired by the Prime Minister.
Right.
And then the Higher Educational Council also,
Wow.
I was on the Higher Education Council, so I could influence that as well.
Really interesting. Now, I think we've probably got time for one question. I'm sorry, we don't have very much time left, but
we have a few
this gentleman there, just in the middle, who's caught my eye.
Thank you. On behalf of everyone then, that was a really great panel. Thanks so much, really great. My name is Paul Knox-Clark. I'm with the ADAPT Initiative, and we do a lot of work with partners, including IMC and my colleagues here from Amref Help Africa, around resilience, building the resilience to heat for populations, particularly in fragile and conflict-affected states. And as you'll know, as Jamila knows very well, the money is very, very tight. And as you've expressed, the range of potential interventions is huge because it's a multi-sectoral issue. So I wondered if the panel could just give us their thoughts on, if you could only do 1 or 2 things that would move the dial in a refugee camp or an IDP camp, what would they be?
Who wants to start? I don't know. Kathy? Go for it.
I'll start.
Yes, that'd be great. Thanks.
One, I would say that on Wednesday we will be making an announcement about a cost-benefit calculator for solutions for 10,000 cities. And it's open source, and so the cost per unit of an intervention of a cool roof, shade, early warning systems, so a tool for everybody. So that's coming. One thing in a camp is start with a conversation, gather women and ask, what do they need? Start with that.
Bottom up, yes.
I would say, first of all, break the silos. I think that, I was speaking at the House of Lords on Monday about the decline in humanitarian financing. And I was saying, conflict doesn't happen in a vacuum. Conflict happens with climate change impacts, with floods, with all sorts of issues. Yet money is in little pockets everywhere. I said, why can't you guys coordinate, right? Bring the money together and say, all right, in a crisis situation, whether it's conflict, climate, if you map the conflict affected crisis and the climate affected crisis, they overlap. So then you could look at efficiency of funding, and how then do you develop good financial mechanisms that are more anticipatory, that are more preventive. And you don't wait for a crisis to happen before you invest in it. We know, as Paul, you are like a humanitarian like me, and for many years we know where the next crisis will hit. Yet we pretend, we are surprised when it happens. We shouldn't be surprised. All these things can be anticipated. And I think working with institutions like HERA, with the private sector, looking at insurance mechanisms, anticipatory financing, innovative financing, bonds, and so forth, and then that will be the way forward.
Well said.
If we're talking about things that are not to do with being in this country, our aid program is very distressing. I don't know quite how else to put it. It's woeful, and it has been taken away from the people who need it most. I am a great believer that if you could get the aid to women in the right places, you would sort out practically every conflict we have going. And in terms of the money, we are still very far behind it. Part of Das Gupta, I don't know how many people read his review of the financial underpinning of nature. We are not registering that yet as an economic benefit. We're still working from the other end of the scale, even though people may now have an understanding that we're all the same thing, but that we're still working from an extractive end of the scale rather than a mutually beneficial and symbiotic end of the scale, which is what needs to happen. I was talking to Nick Stern the other day, and he was saying that by 2050, the band of land below the Himalayas, across that whole between the rivers across North India, he's saying at the speed we are at, there are going to be 2 billion people on the move. Now, if you are a politician who's still only in your 40s, wouldn't that be probably the single most important fact that keep you up at night and wake you up in the morning, because it affects everything? It's not yet doing that. And I find it absolutely extraordinary. I've been very involved in that national emergency briefing, going around the country with it, talking in groups where you see that everybody is worried, except for what's happening in number 10. I am an optimist. I like Andy Burnham. I have to tell you, I'm putting an awful lot on his shoulders in my heart right now. And I hope that there is a kind of a better vision. And I think a lot of that is about inspiring mood and optimism, because somehow our politicians haven't let us have optimism. The thing is, we can do it.
We can do it.
It's not all the end of the road. We have the technology, we have the communities, and we have the extraordinary people like you two, who've pulled off something miraculous. And if we were all together in it, we could get it changed, and get it changed quite fast. So action on community levels, and speak to your MPs, call them, tell them, brum, brum, brum. Don't go passive into the good night, because we haven't got enough good nights ahead.
So well said.
Thank you so much. I'm being told very sadly that I have to wrap up. I'm so sorry I couldn't take more questions, but I think you'll agree with me that we've had a wonderful panel, really inspiring and lovely to end on a note of optimism. Albeit tempered optimism, but we can but hope. So yes, I hope you'll join with me in thanking our panel.
We have to read. We have to read them out.
Thank you. That was an amazing panel. I think you'll remember push, push, push.
Yes.
Speak, speak, speak. I think these lines will stay with us. So hello, everyone. I'm Sophie Lambin. I'm going to be the co-moderator of the session you're going to have after lunch. And I've been asked to give you a little sneak preview of food for thought for what's coming. And yes, so we will be exploring whether the International Court of Justice ruling for climate change is truly able to deliver better health outcome. I know that Paul and Alan talked a little bit about it this morning, but let me give you a few words of context so that you can think about it over lunch. So this ruling was issued in 2025, in July 2025, and it was the UN highest legal body, the International Court of Justice, that issued a unanimous ruling in climate change, which is a first in the history of humanity. And it confirmed that states have a legal obligation to act, that 1.5 degree is a legal standard, not an aspiration target or political aspiration, and that clean and healthy environment is a precondition for fundamental human rights, including the right to life and the right to health. Importantly, this ruling was initiated by a group of students in the Pacific. And it was then taken up by the Vanuatu and supported by over 130 countries. And the idea that after lunch we are going to really allow ourselves to have a clear-eyed conversation about what comes next, what does it take for this ruling to really deliver on its potential of better health outcome, and what are the other interventions that we should be also focusing on. So we will do this through a debatable format, which some of you have maybe already seen on the Conduit stage, which is really designed to surface those tensions, those trade-offs, and allow ourselves to challenge ourselves in a thoughtful, if not slightly robust way. So we'll have an amazing lineup of debaters and jury members. Come back at 2 o'clock. We don't want you to miss that.
If I could just get everyone's attention for just 90 seconds, I know that I'm all that stands between you and lovely, lovely food. So as you heard, we've got the debate happening at 2 o'clock. That's going to open up an incredible afternoon of discussions here, where we're going to be looking at protecting workers, investing in health resilience, solutions for impact, and we will have the chair of the Climate Change Committee, Emma Pinchback, talking about 20 years on from the Climate Change Act. A reminder too that the culture stage will be on at 3:30. We're going to be opening with a keynote from filmmaker Colin Butfield, and there'll be an incredible performance by Flo. And if you're hungry, the food is up on 2, 3, and 5. So please be back in your seats by 5 minutes to 2 so that we can start. Thank you so much.
that okay?
Hello, everyone, and welcome back. Oh, this is super, super impressive. It's great to see you all back, and thank you again for being so punctual. Okay, you know what I'm going to ask. Okay, hands up if you managed to make some meaningful connections over... Oh, a couple of hands already ready. Meaningful connections over lunch. Who's managed to do it? That's very, very good. It's very lucky that we've got another coffee break coming up, and we've got an amazing evening reception as well to look forward to. All right. The Conduit is absolutely delighted to be partnering with Kite Insights to bring Debatable to our summit this year. This is a format that you're usually only lucky enough to see if you go to events like Davos and COP and so on and so forth. So we really are very, very privileged. You met her just before lunch, so please welcome back Sophie Lamben, who's going to introduce our incredible debating teams.
Thank you very much, Karen. And welcome, everyone. Welcome to this afternoon debate, curated by Debatable, as Karen just said. I'm Sophie Lambin. I'm the founder and CEO of Kite Insights and curator of Debatable. So before we start, I wanted to thank the Conduit again to welcome us on this stage, and welcome for creating the space for such a candid exchange on the future of health and climate, but also for your willingness to jump headfirst in this ancient, innovative, albeit ancient debate format. Today is a little experiment. We're going to mix provocation with humor, with a little bit of theatrics, but most importantly, substance. Though you, the audience, will ultimately be the judge of that.
So the motion before us today, which will appear, here we go, is a statement: the International Court of Justice ruling on climate change will not deliver better health outcome. This is what the debaters will be debating. And yes, this sounds like a very important and serious question. And debating it is signifying our belief that those important questions benefit from this kind of exploration. We're obviously not here to decide who is right or wrong, but rather to assess the strengths and weaknesses of the arguments on both sides of the debate, and really creating this space for agreeable disagreement. The idea ultimately is to leave you, the audience, with a much better understanding of what is at stake and ultimately how we can move forwards. So with this, it's a great pleasure for me to ask you to join me in welcoming to the stage my co-moderator, co-founder of the Conduit and CEO, Paul Van Zyl. Welcome, Paul.
We've done this before, so we're old hands at it.
Yeah, there's a sense of déjà vu.
Exactly.
So, Paul, you have spent most of your career really working at the intersection of law, justice, accountability. You have served on the Truth and Reconciliation Commission of South Africa. I can't think of a better person to help us frame what is at stake whenever we ask whether a landmark legal ruling can truly deliver change for the people who most need it. Can you give us your take on the motion? Don't say too much. We need enough for the debaters to argue. But what is you think, what is at stake?
Well, firstly, Sophie, I really, when we presented this topic, I was kind of hoping that we could have a debate which is like, do you prefer Gruyere or Stilton or Ibiza and Mallorca, you know? But now we have to debate something complex, technical, only at the Conduit. So I think that there are a number of ways to think about law. Too often, I think we think of law in the sort of fetishized, go into a courtroom, there's a judge, and there's some kind of enforcement mechanism. So I think there are many, many ways, but I would at least offer 3 ways to think about law. Firstly, there's a normative dimension. Law exists to tell us the difference between right and wrong at a normative level. And so I think what I'm going to be looking for from the debaters is to get a little bit of a sense of, does this judgment have a normative signaling effect as to what is permissible and impermissible in the conduct of human affairs? The second, there's an enforcement dimension, right? You can think about law as the thing that when you violate it, you go to jail, right? But if you think about it, the vast majority of laws are actually honored in the breach, right? So the number of times that people actually go to jail for violating laws is vanishingly small. Just ask women in relation to gender-based violence. So one of the things I'll be looking for is to think about, is enforcement really the right way to think about it? And then finally, and there are many more, and I won't go on, there's an administrative dimension, right? Sometimes the existence of a law never lands up in court, but it changes the conduct of important parties and actors in ways that gives it an effect in the real world. So corporations, for example, may take heed of a law and its shareholders, its directors acting under fiduciary duties, or its customers may expect that a society complies with the law, and the law then has effect regardless of the fact that it actually does or doesn't have judicial bite. So I think this is going to be a really interesting conversation about the role of law in this important existential question about the relation between climate change and positive health outcomes.
Great. Thank you, Paul. That's a great setup. And what I also want to clarify with this debate is really we are not asking whether the ruling matters. Of course it does. The question is how much and how it matters. And that's really what we want to get to the heart of. If we over-index on the ruling, do we risk neglecting the infrastructure, finance, and political will that communities need now? If we under-index, do we risk squandering a once-in-a-lifetime opportunity? So with this, I think we should bring the debaters on. What do you think, Tom?
I think it's a great idea. Let's do that.
I don't know why I called you Tom.
So many questions. So many questions.
All right, so I think it's time to bring the debaters. Is that right? Am I?
Yes, you are. Bring them
okay.
on. Absolutely.
All right, so debaters on the fourth side. Let me just make sure. Sorry, I'm turning my cards. Have I missed something? Yes. Okay, here we go. Please, audience, be ready to welcome the debaters to the stage. Arguing for the motion, we have Belinda Ricky Money, Laura Clark, and Sandrine Dixon de Clèves. Please join me in welcoming them to the stage.
And arguing against the motion, we have Shweta Narayan, Shana Tabak, and Joanna Guzman. Please welcome them to the stage.
Can you go back to the point about the audience?
Yeah.
Yeah. And I just wanted to say that Paul and I, without losing any of our neutrality, will temporarily holding allegiance to one of the team. I'll be standing with the foresight.
And I'll be representing the better team.
I did say without losing any of our neutrality, but that's something you stubbornly refuse to agree.
Every time.
Every time.
So this is how it's going to work. After our debaters speak, you will decide the winner. Based on the arguments you hear today, you decide which team you find the most compelling. And we will take a vote using the latest, incredibly sophisticated, technological, carbon-neutral method of assessing performance, clapping. So let's do a practice run. Can you clap?
You can clap, which is great. So we are going to ask you, in fact, this is your one and only opportunity to actually tell us what you think, because after that, you'll be judging the team that does the better argumentation. So I'm going to ask you, if you agree with the motion that the International Court of Justice ruling on climate change will not deliver better health outcome, please clap and cheer now.
I told you I've got the better team. And if you disagree, and if you think the International Court of Justice ruling on climate change will deliver better health outcomes, clap and cheer now. And if
yes, I would be careful. We've seen change of hearts. Yeah.
And if anybody is undecided, please clap now. So the problem with the polarizing nature of modern politics. Nobody's undecided, Sophie.
We have a few swing voters still that we can change. So I just want to make clear that this statement, that is currently a question, but it is a statement for the purpose of the debate, is not meant as a statement of truth. It's meant as a provocation. And our debaters are therefore not necessarily arguing from a position of the personal conviction. And even if they are, we've asked them to lean on the side of that they represent today. So it's important for you to know that they have bravely agreed to defend a specific position for the sake of the debate, for your enjoyment, the audience, and in doing so will go beyond their own conviction, which, as you can imagine, will require a mix of intellectual agility, courage, creativity, empathy. So it's very important, you, the audience, that you support both teams along the way throughout the debate. So you are invited, authorized, asked even, to whoop and clap whenever one of the teams is making a good point.
So after the debaters have spoken, we will turn our attention to the esteemed jury. So I'm going to ask the jury to wave their hands. There they are, esteemed as they are. The jury members are Catherine Bowen, Professor and Deputy Director, Melbourne Climate Futures, Professor Sir Andy Haynes, Professor of Environmental Change and Public Health, the London School of Hygiene and Tropical Medicine, and Letty Thomas, Head of Field Building and Networks, Foundation for International Law for the Environment. Now, crucially, this is not a jury who is going to decide who wins. The jury, or rather the observers' job is to present challenges to the debaters. They will shine a light on what they liked, but also on what they feel the debaters may have missed. Debaters take good notes on what the jury may have said. You will then confer amongst yourselves before one or all of you return to the stage to deliver your final rebuttal, the moment when the gloves are off and hopefully you clinch victory. Then our wonderful audience will vote with their hands.
Great. So I think we are ready to kick off. Are we ready to kick off?
Yes.
All right. Debaters, you ready? Yeah. Okay. So on the far side, it's my great pleasure to invite Belinda Hikimani to come to the stage. Please.
And on the gay side, we have Shweta and Narayan.
Now, a fun fact about Belinda, so that you can relax in the moment that is about to happen. Despite growing up in a small Pacific island and spending much of her life surrounded by the ocean, Belinda cannot swim in the deep ocean. Her family finds this endlessly amusing, but be warned, when it comes to navigating the deep waters of climate and health policy, there are few people better placed than her to navigate that boat.
And something you may not know about Shweta is she's dedicated her life to protecting those most at risk from harm, and that doesn't stop when she gets home. She lives with 10 rescue dogs.
All right. The scene is set. You have 3 minutes. The clock is here. You go.
Thank you very much. Before I begin, I would like to thank and acknowledge my fellow debaters, panelists, and everyone joining us today. I should note at the onset that I have been invited to argue that the proposition that the International Court of Justice ruling on climate will not deliver better health outcomes. This does not diminish the significance of the advisory opinion, which is a landmark achievement in the pursuit for climate justice. Rather, it invites us to examine whether it is, on its own, the strongest mechanism for improving the health and the well-being of our people that are most affected by climate change. As you may have known, I cannot swim in the deep ocean, but perhaps there's a lesson in that. Being surrounded by the ocean does not automatically mean that you can navigate every challenges that it presents. In the same way, having an important legal ruling does not automatically mean we achieve the outcomes we seek. It can act as a springboard, but the tools, the resources, and the action will be more important in getting us where we want to go. As someone from the Pacific, I see the advisory opinion as a lighthouse that is incredibly important, that warns us of danger, helps us to navigate uncertainty, and points us towards safer waters. But a lighthouse does not row the canoe. It does not provide the fuel, the paddles, or the crew that it needs to complete the journey. For Pacific communities, better health outcomes means children growing up with reliable access to clean water, despite prolonged droughts. It means communities having resilient health clinics that can withstand cyclones and extreme weather events. It means reducing spread of climate-sensitive diseases such as dengue fever and diarrhea illnesses. It means ensuring food security when changing ocean temperatures affect fisheries and coastal livelihoods. It also means addressing the mental health impacts associated with displacement, loss of land, and uncertainty of the future. These outcomes are achieved not through legal declarations. Investments, implementations, and action on the ground will be the decisive levers that improve both health and climate. In fact, some of the most meaningful health improvements we have seen in the Pacific have come from community-led actions. Communities have restored mangroves to protect shorelines, establish local disaster preparedness systems. It strengthened traditional food systems and worked alongside health providers to respond to emerging climate risks.
Time. You have to finish the sentence.
The advisory opinion can clarify legal obligations, but it cannot build a cyclone-resilient health center in Vanuatu. It cannot install water infrastructure in drought-affected communities. It cannot strengthen disease surveillance systems and provide adaptation funding to vulnerable coastal communities. Those outcomes require governments, development partners, health practitioners, and communities themselves to act.
Wonderful. Thank you. Thank you. Can stay to keep company to the other side. And Shweta, I will give you a few more seconds to make up for the extra time.
I'm against this motion. Health is not determined only in hospitals. It is shaped in the homes we live in, places we work, the air our children breathe, and the water they drink. The climate crisis is poisoning all of this. This ruling says enough. States have a legal duty to act. The ICJ advisory opinion will deliver better health outcomes, not because a court order can cool a heat wave overnight, but because health improves when power shifts, when responsibility is harder to deny, and when communities who have long been treated as collateral damage finally can say, this harm is not accidental. This is deliberate, this is preventable, this is unlawful, and someone is responsible. So here is how this ruling will shape health outcomes. First, it shifts accountability. For the first time, the world's highest courts have spoken clearly about duties of states in the face of climate harm. This is not symbolic. This gives frontline communities who are most harmed and most marginalized a stronger basis to demand protection, remedy, and justice. Second, it makes health evidence harder to ignore in the legal arena. Now, the Lancet Countdown Europe report of 2026 found health references in 58% of over 900 climate litigation documents since 2011. Health is no longer a side issue. In the climate litigation, it's taking center stage. The advisory opinion strengthens this shift by linking climate harm to human rights, to right to health. And that gives a stronger basis for the health communities to demonstrate climate harm is not only environmental damage, it's preventable harm to life, health, and dignity. And third, it forces the health community to show up. For too long, health community, health professionals, civil society have been present in the evidence space, but less visible in the legal and political arena. This ruling breaks those silos. It supports health communities to show up at the scale the response is needed for this climate crisis. So the ecosystem that can deliver and support better health outcome is already forming around it. Now, the other side will tell you that this opinion will not improve health. They will say we'll need finance, we'll need fossil fuel phase out, we'll need clean air protection, we need workers' protection, resilient health systems, and they're right, but they're missing the point. This ruling is not supposed to replace those efforts. This ruling is supposed to strengthen them, provide it a legal weight, the moral compass, the political urgency, and a sound rights-based framework. So the question is not whether this ruling will act alone. Of course it will not. The question is whether this ruling will unlock the ecosystem that will deliver better health outcomes. And yes, the answer is yes. Health professionals are going to use it. Communities are going to organize around it. Civil society is going to litigate with it, and the governments will be pushed by it. Because better health is not only created by treating diseases after the harm is done. It's created by supporting the conditions that allow us to live and thrive in good health, that is clean air, clean water, resilient health systems. And this ruling gives us that tool, a strong tool to defend those conditions. So I will urge you to vote against the motion. Thank you.
A very spirited first round, though you used you were definitely not following the rules as far as time is concerned. But we'll let you go for this first round. But Belinda, are you really saying that you warn us about putting too much faith in the ruling? You said healthy communities will not be in a courtroom, and they are built by the communities themselves. Thank you.
I mean, I thought that you were a metaphor for this entire debate because you were scary. And you were an embodiment of the power of law, and I didn't want to mess with you in the way you didn't want to mess with law. So thank you for that compelling argument.
Wonderful. So round 2, on the fourth side, we have Laura Clark.
And on the against side, we have Joanna Gussman.
We're the blue team. Yes. Matched by the dress. So a fun fact about Laura, as a child, she was an expert chicken wrangler. Who would have thought? Anyone who has tried will know that getting the flock to move in the same direction requires persistence and calm under chaos. It is now very clear when you think about it that it's been an excellent preparation for what's to come.
So not many climate lawyers can say they've appeared in a major dance film. But Joanna earned herself a cameo in Step Up 2. I've seen this film 3 times. It's a classic.
All right, Laura, the clock is in front of you. Good luck.
Thank you. Friends, the ICJ the ICJ advisory opinion will not deliver better health outcomes. We need litigation to force action on public subsidies and corporate accountability. Let me tell you why. As you all know, gathered here today, the Lancet Countdown on Climate and Health each year writes a report documenting the mounting economic losses from climate-induced health damage, from lost working days, deaths, pressures on health systems. The cost of the state to responding to climate impacts grows every year. And yet, and here is the outrage, governments also continue to subsidize the very companies that are generating those climate impacts using our tax money. And those companies make massive profits. After the Iran war, the world's top 100 oil and gas companies banked 30 million an hour in profits. So this is an outrage. It's a question of private profit at public expense. Health systems left to absorb the costs with ever more limited funds while the damage compounds. So the taxpayer pays for the cause of climate change and the damage. The polluters profit. No one is held accountable. Now, the policy prescription is clear to me, and when you look at the maths. First, we need to end explicit subsidies to the fossil fuel industry and redirect them. Imagine what you could do with $1.3 trillion annually for health infrastructure, education, nature. Secondly, we need to put a health levy on big polluting companies, making a reality of the polluter pays principle and shifting the business model. So does the ICJAO get us there? No. Of course, it tells us what good looks like. It's clear that subsidizing fossil fuels may be an internationally legally wrongful act. It's clear on the obligations of states to regulate the behavior of non-state actors, and it's clear that a healthy environment is a precondition for the enjoyment of human rights. But it's not enough to be right. Ask any climate scientist. It's how you close that gap between what is right and what happens on the ground. There is no enforcement mechanism from the ICJ, and let's be clear. Governments right now are not listening. Businesses are not listening, and the business as usual continue. So we need action and regulation at the national level to shift the business models of polluting companies and deliver better health outcomes. So what does that take? Well, when government action is less certain, businesses' action is less certain, we need litigation. We need a coordinated campaign informed by the ICJ advisory opinion, drawing on attribution science, to hold governments to account for not doing enough to protect citizens from climate harm, challenging government subsidies on the basis that government finance is contributing to the damage done to citizens, and bringing more and more class actions and damages claims against big polluters. Let's be clear on the moment we're in. The Iran war shows us that fossil fuels do not equal energy security. So this should be the moment, this should be the tipping point where we tip subsidies over the edge and we really hold the fossil fuel industry accountable for its pollution. The ICJ told us what is right. National courts have the binding powers to make authorities do what is right, and litigation is critical. Thank you.
Well done. Joanna, the clock is in front of you. Good luck.
So the ICJ is an essential catalyst to start the chain reaction that was just described by my fellow debater. And I think that is the critical inflection point as we are talking about, because I want to start first with people. As one of the team members that went to Tuvalu, Kiribati, and Fiji to get the community's reaction to how a court case can change their lives, two things became very clear. First, the climate change crisis is a health crisis, a human health crisis. And two, communities want accountability. And so what we did in bringing this case forward was centered on that, because we all know it. When your Palaka pits are salinized and you're literally sick to your stomach because your ancestral land is underwater due to sea level rise, when you're a child who cannot think about their future because they're not sure if there will still be the land you live on, that has a toll. And the crux of the entire case was on the idea that those who had the least to do with the climate crisis are the ones who are bearing the biggest burdens. That requires accountability. And one of the greatest things that came from the ICJ, my favorite paragraph, 427, that was referenced as well, is a blueprint for precisely how that accountability can action. When we focus on the root cause of the crisis and ensure that folks have the enforcement and accountability that is required to deliver it, that's how we do it. Okay? When you say no more subsidization, no more exploration, no more production and consumption, you are going to see better health outcomes because they are directly connected. One of the best things, though, that I am most excited about is that we have precedents on this. The World Health Organization Framework Convention on Tobacco Control, asbestos, petrochemicals. What do all of these things have in common? They were health movements alongside law, from people in the room, just like this, that stood up for communities, ensured that they were empowered, and ensured they received the type of legal responsibility that is required. I think that is something to be hopeful about. I think that's something to celebrate, and I think that's something that cannot happen alone without this incredible case. Speaking of inflection points, we do not have time. We do not have the luxury of dismissing the most authoritative legal clarification of our history as secondary, as symbolic, as poo-poo. It is an absolute game changer, and it is the requirement that's needed to get the health outcomes that we want to be able to go back to those communities and actually deliver. And we need you to do it, so vote for this side. Thank you.
Well done. A very confident second round, Paul, I would say, and I'm not going to ask you to comment on my side. But anyway, Laura, I think you said no court ruling, however historic it might be, will move the needle until we stop subsidizing the companies profiting from the very harm that is depleting health system.
Yeah, and starting from Shweta's really amazing, incisive analytic point, we then had Joanna going, this legal ruling is the embodiment of people's struggles, and it's the crystallization of community mobilization. And because they've gone to that mountaintop and enshrined that ruling in the way that they have, it demands the respect that has been earned through those struggles that has then been secured in courts.
I think next time we should debate. What do you think? Wonderful. So that was our second round. We're now going to go for our final round of debaters. And on the fourth side, I'm delighted to invite Sandrine Dixon-de Clèves to the stage.
And on the against side, Shana Tabak.
So, most people in this room have probably heard Sandrine talk about planetary boundaries. Fewer of you know that her daughter is a Belgian pop star. Yes, that. So we'll leave it to you to decide which of these of the two of them has a harder job to win over a crowd.
And a fun fact about Shana is that she speaks 3 languages fluently and then married a French speaker. French wasn't one of those languages. She's always expanding the terrains in which she can be persuasive, and you're about to see it.
Sandrine, you ready?
Yes.
3 minutes.
Ladies and gentlemen, I want to remind you that today we are in Code Red. The Met has called today Code Red. Has the ICJ done anything to stop us from being in Code Red, or for me to actually wear my red pants because it scares the shit out of me that we are in Code Red? We are being told that a legal recommendation and adoption of a text has actually guaranteed that we will have good health outcomes. I would like to say today, please dig into yourselves. What is tech bro feudalism, or the lack of the rule of law with populism, giving us today in terms of the rule of law? Even this team decided to go over their time and forget the rule of law. So let me focus very clearly on what we are debating today, and that is the reality. Of course, the ICJ is important, but will it really deliver good health? No. What will deliver health today is all of us realizing that in addition to a legal recommendation, we need action. We need action on the ground, as has been instigated and told by my team. So let me give you 4 key points that you can take with you as you decide whether you want to be delusional or realistic. The first is we are in the middle of climate change. Code Red, people. Everyone is talking about the health outcomes that we're going to see this week. Mortality rates going up and illnesses going up. This is just an example in the west of Europe of what so many are feeling outside, the most vulnerable that are impacted by these temperature hikes and by climate change. As much as this legal ruling is important, it's not going to change that. Number 2, let us remember, and with the Commission on Climate and Health that I was so proud to be on, we clearly recommended that we have to invest in health infrastructure. We are far underneath the resilience that we need in our health infrastructure. We cannot guarantee good health with an ICJ ruling if we don't invest in health infrastructure. Number 3, let us remember very clearly that actually a policy that does not declare an emergency does not put in place the emergency measures that we actually need today. That is why we're in Code Red. We're in Code Red so that hospitals can be on alert. We are in Code Red so that teachers can be on alert. We are in Code Red so that we can all be on alert. And those of us that can stay home or stay safe will do so that we don't have higher mortality rates or illness. And the last key point, at the end of the day, it is a macroeconomic structure that does not take into consideration health and climate that is problematic. We continue to burn fossil energy, we continue to overconsume, we continue to go beyond the boundaries of planetary Earth. Ladies and gentlemen, vote with me. We cannot assume that the ICJ will deliver good health. Thank you.
That was a powerful condemnation of the power of the ICJ case, but I am here to tell you otherwise. The North Star acts as an anchor in the night sky. While the rest of the stars in the northern hemisphere appear to rotate, the North Star remains completely stationary, the brightest star in the sky. So what does astronomy have to do with this ICJ case and with our debate question today? Let me explain. My colleagues have talked about the importance of finance, policy, equity, health systems. These do matter in order to get us to where we need to get in terms of health justice and climate justice. But what the ICJ case does is gives us a North Star, an organizing principle, a light in the darkness for how to get there, and also demands legal accountability to build all those systems that you're saying need to exist. So it is that North Star.
No one gives a toss about the rule of law, my friend, especially
Objection.
First,
order.
Let us just begin with the legitimacy that we have because of the origins of this case, and I do not want to undersell the important, critical origins of this case. Where does this case begin? In a courtroom. Wrong, not in a courtroom. In a law school in the Pacific, where students ask their professor, we're studying international law, but how can we use international law to change our lives, to put people at the heart of climate action? And those law students went from that classroom in order to convince the government of Vanuatu, to convince the United Nations General Assembly to bring this question to the International Court of Justice. So what we know is that we need to put people at the heart of climate action, and we know that, as my colleagues have said, many, many people on this planet are disproportionately impacted by climate change in a way that they are not responsible for. That's climate justice. And frankly, I was surprised to see the court dig into that question. I'll out myself here and say that I actually worked at the International Court of Justice. And let me tell you, it's not really a place where people are kind of inspirational and talking about justice on a day-to-day basis. In fact, my performance review said, she talks about human rights too much. But what I will say is that I was thrilled to see that this case actually delivered on its promise, and to prove to us that the ICJ case in this decision does not need to be just a legal instrument, but actually a tool for real change. Second, in laying out this North Star, the court held that all human rights are intrinsically related to the right to a clean environment. The court really drew a clear line between environmental impacts and human rights law here, and this opens the door, as my colleagues have said, and lays a path for litigation. That litigation is critical, but what we're seeing is that the courts that are already working to advance climate justice on this issue are citing to this ICJ case. They are using the ICJ case as the primary holding in why they are advocating for health rights in different courts across the world. And lastly, I want to say, please don't be fooled by the failures of multilateralism that we're seeing today. Look, we all know that we're living in a difficult time with regard to multilateralism, but we also have to look to mini-lateralism. The court lays out this North Star. It's not only about litigation, it's about ways that law and policy can interact using the ICJ case as a North Star. So the court here was really playing the long game.
Rule of law, people, they're not following.
If you recall, I think I lost 10 seconds over here.
Yeah, but you're over 50 seconds, my friend.
Thank you very much for giving me this opportunity.
Well, that's the spirit.
You know, it's a close debate when people stop disagreeing agreeably. Got a bit tetchy in the end there, didn't it, Sophie?
Yeah, well, they did hug it out at the end. So anyway, talking of a scary delivery, I think that was masterful, Sandrine. But basically, Sandrine is saying we are in an emergency. Do not wait for litigation cycles.
And I thought that the invocation of the North Star was stellar. And I think that it gave us a metaphor that is going to stay with us, because it is around this pivotal judgment that so many other of the stars that form the constellation of social change organize themselves.
Wonderful. Well, we need to keep going because we need to catch up on lost time. So we're now going to, this is not over, that's a good news. You know, we're a bit more than halfway through. But now we're going to invite esteemed jury members to the stage. And they have this very inviolable position, or uninviolable, we don't know yet, to stir things up a little bit. And remember, jury members, you are not judged yet. You come to reflect on what you heard, what you loved, and what maybe you have wished to have said. So please welcome me in joining to the stage Catherine Bowen, Professor Sir Andy Haynes, and Letty Thomas.
Hi, everyone. It's a pleasure to be here today. And I'm glad that democracy is really the focus of how we resolve this issue, that we all get to vote. But what I'm going to do is try and very briefly sum up some of the key issues that have been brought up by our speakers to give you all some additional context and information to help you make the decision that you think is correct. So what we have heard are that climate action is necessary at the local level, at the systemic and national level, and at the international level. And so the great question is, how can this opinion deliver those health outcomes? Well, the first thing to say is that the world we are living in now is very different to the world of previous International Court of Justice advisory opinions. The realpolitik suggests that a number of countries do not listen to this opinion, they will not abide by it. There will be no change in those countries as a result of this opinion. But on the other hand, the desire for the opinion and the content of the submissions delivered to the court suggests widespread agreement that this is necessary and it's important. So what we see is the advisory opinion providing a pretext for government action and change. And just to give you a sense of that, at least 85% of the submissions delivered by the court were explicitly communicating the links between the health impacts in their countries and the role of climate change, with a couple of exceptions where those governments actually just decided that what they wanted to talk about was how bad the science was. So there we go. So we have the international situation. If we then go to the national and legal level, what we already have is a good bunch of strong climate laws. But as we say, the regulation against corporate polluters is difficult. And of course, this side brought that out very, very clearly. And they said, well, what we need is more litigation. And of course, litigation can be incredibly effective, but litigation isn't possible everywhere. There are lots of countries around the world where it's very difficult to litigate, but it's easier to bring in strong national policies that are spurred by a really clear, deterministic international opinion. Which brings me to the final point around, oh gosh, that was quick, the local, which is basically to say climate action happens locally, litigation happens locally, and you can also sue people using the ICJ for harmful projects in your backyard. So that's me.
Thank you, Letty. Well done.
Amazing. Can I say, I think I have a harder job, though, in trying to really... What I'll do is provide a bit of feedback from both sides, or for both sides, and also talk about where I found some really great light spots, which seem to be a metaphor for the debate, actually. We talked about lighthouses, we talked about North Stars. I think they're beautifully strong metaphors. I think the lighthouse metaphor, warning of danger, helping us to navigate, but it doesn't row the canoe. I found that a really strong and compelling argument, and wondered whether we could solar power our lighthouse, perhaps, so we can see that it's forever adapting and playing a core role in our mitigation as well. I think I heard about a health levy on big polluters. Sounds amazing, but I'd love to hear more detail on the political appetite for this, especially given the lobbying power we know that exists in our big polluters, especially where I live in Australia. And policy doesn't declare an emergency, so we heard our 4 debating teams say that, but I didn't hear a really convincing argument to tell us what our direction is to respond to the Code Red. So I'd like to hear a bit more about that in your final remarks. For the against team, I think the line you brought to us around health improves when power shifts, the critical aspect of power was probably a little bit underdone in what I heard in the debate. So I'd love to hear a bit more about how power plays such an integral role at every scale with which we live. And the ruling doesn't act alone. I found that also really an important establishment as well. Just quickly, because I know I'm out of control, but out of... almost out of time. Maybe I'm also out of control. I was very happy to hear the plain packaging comment. I think that that's a really, really, really strong argument for the 4 team to consider. We've seen that the final legal challenge in 2020 was decided in favour of Australia. Australia, in this case anyway, has forged the way in terms of plain packaging for tobacco, and we've seen a reduction in tobacco use, and that's been a really, really important role of legislation and government action as well. So I am over time, so I'll stop there. But well done, both sides. Really fantastic.
Thank you. And as you say, not an easy task to do. Over to you, Ian.
Well,
only men, by the way. I think we should thank
Well, thanks very much. I think it's been a brilliant debate, and I congratulate both sides and made wonderful arguments. I wanted to raise just a few points in my remarks. It's very clear that one of the reasons we're in the state we're in is because climate change has been conceptualized as an environmental crisis, and that doesn't mean much to most people. Reconceptualizing it as a health crisis is much more likely to, hopefully, actually stimulate change. There are a couple of specific points I wanted to make, and I want to pick up, I think, Laura, you made the point about attribution. And I think this is absolutely crucial, because one of the reasons that previous cases have failed, legal cases have failed, is because they haven't used attribution science. And it's really important not just to make the general case that people die in heat waves. We've known that for centuries. The point is that climate change amplifies those impacts, and putting a number on it is very, very powerful. So attribution science, not just to climate change, but also health effects, is going to be crucial in forging the way forward, whether that's through the ICJ or national legislation. I think it's really also important for us to understand that it's not just extreme heat. There are a whole range of different impacts. And we need to understand the impacts of human climate change on pregnancy outcomes, on nutrition, infectious diseases, and so on. Second point is about adaptation. I think at the moment adaptation is failing, and we can see that, for example, because many people are still dying in heat waves. Just a simple fact. So we really need to understand what are effective adaptation strategies and to put in place strong legal controls to advocate for those. Thirdly, mitigation. Mitigation is not actually happening at the necessary speed and scale, but it will bring major benefits, not just in the long term from reducing the risk of dangerous climate change, but also from the near-term co-benefits. And any legislative approach will have to capitalize on that. So let me finish by emphasizing or discussing very briefly the 3 points at the beginning that you made, Tom, but not Tom. First of all, the normative function. I think the ICJ ruling is very strong in that area, creating a normative function. Enforcement, to my mind, rather weak, rather inadequate. So that is a deficiency, to my mind. Administrative, plus minus. Not sure about that. So major success in terms of its normative function. Some questions about the other functions that it can really push that agenda forward. Let me end by calling for collaboration between legal and health professionals, because I think this is a real conclusion of this event.
Yes.
We need much closer collaboration. Thank you.
Thank you, Ian. Please join me in thanking the jury members. You can take back your seat. Thank you very much, Paul. What's happening next?
So thank you, jury members, for your incredible remarks, and I think we should give them a huge round of applause. So debaters, you have heard what the jury has had to say, and this is your opportunity to decide how to respond to the jury's remarks. I just want to say that as you ponder that, we should think about Catherine's statement in particular that lighthouses don't row canoes. Great. So you have 3 minutes to huddle in your teams, prepare your final rebuttal. You can elect a person, you can do a division of labor between yourselves. We don't mind. This is your last chance to convince us and to clinch a victory. An audience, while the debaters confer, we invite you to discuss amongst yourselves. Where do your views now lie? Have you changed your perspective? Remember that changing your views is the sign of an agile mind. If you were on the jury, what challenge would you have posed to the debaters? And if you were a debater, what would your final retort have been? The clock starts now. Off you go. Discuss amongst yourselves.
Well done. Thank you. No, you were. Yes. It's not easy, as you say. Yeah. Please help yourself. Yes, we do that a lot on all difficult and complex and potentially polarizing issues. Yeah. You know. Oh yeah. Right. So we did it 2 years ago in Baku, in the blue zone. We did one as part of the action agenda. It was amazing. It was really, I would love to. We will be there. We will be there. Yeah? I mean, maybe you need to help. I mean, the way we have done it in the past is with the champions. So if you tell me the way in, I can. Right.
Who's doing the wrap up?
Yeah, no, we'd love. And I tell you, it created a dynamic.
Better both, but we'll both be. We'll finish dead on time.
And it was fun.
Super sharp. Yeah. Why don't you tell her? Go tell her.
For the people agenda, but it was really powerful. I'd be very happy to do that. Yeah, I'll give you my details. Yeah.
So you're both gonna do the wrap up.
Yeah,
We don't want to make sure we end time on time. So
Yeah. No, it's. Keep looking at my watch. Yeah. Here we go. Sorry. No, don't worry. Can come together if you want that. And you starting. No, you can keep it. You can come together to the stage. They'll start, you follow, okay? Okay. Okay. Hello. Woo! Order. Woo, that worked. Well, so delighted to see you had plenty to discuss. That was the idea. Debaters, you ready? So we're going to switch things around, and the again side is going to start. You have 90 seconds to seal the deal. As you could have seen from the debate, the teams have really leaned into their sides, going beyond their own conviction. Remember that when you listen to their final retorts. So 90 seconds, over to you.
Thank you, Tom, for reminding us that Lighthouse don't row canoes. But I would be very worried to row a canoe in the darkness, especially if I don't know how to swim. I want to remind us that health is not about treating diseases. If we define health as treating diseases, we have already lost our health. Health is about clean air, clean water, food security, social protection, and all that conversation that we're having today would not be here, we would not be doing so if we didn't have this advisory opinion. So the ecosystem is already forming for better health.
And one massive part about the power shift that was mentioned is that the UNGA passed the ICJ resolution endorsing this advisory opinion, 141-8. And those countries of 8 read as a list of the exact countries you want to be on the other side of history from. I think that, more than anything, is an absolute endorsement of the power of this advisory opinion.
The last point here is that when we talk about systems of power and we talk about justice, per your point, Judge Andy, we have done too much thinking about the environment and not enough putting people at the heart of climate action. That is what this case does. This decision is a North Star for us to put people at the heart of climate action. Thank you.
Woo! And we were within time. 3 seconds.
Yes. Right on cue. Well done. You're learning fast. Next team on the full side. Wait, the timer, if you can start. You ready? You go.
The question is not whether the ICJ is important enough. We know that. The question is, are we realists? Are we delusional?
Real
real world action doesn't happen internationally. We need action on the ground. We need action nationally. That means at the government level and at the local community level. The ICJ advisory opinion is normative, but it is not actionable. So we need governments to regulate polluters, stop fossil fuels, stop the subsidies, to invest in adaptation and resilient infrastructure. And we need community action on renewable energy communities, driving renewable energy, health communities thinking about resilience, and class actions and damages claims that really shift the calculations of big polluters.
And even though I might not know how to swim, but I must say, the lighthouse does not row itself, and we need action, and you are the ones to do the work. So we are in this together. Thank you.
All right. We are talking of boat. We're going to paddle very fast towards the end of this session. So this is the moment of truth, the moment that you've all been waiting for, where we can hear you, the audience, tell us what you think. Remember, we're asking you not to vote necessarily about what is your personal opinion, but for the team that you think has done the best job putting this very difficult argument forward. All right? So, if you think that the faux team did an excellent job putting that argument forward, please clap now.
And if you think that the against team did a stellar, remarkable job, clap now.
I was going to suggest that maybe we need a rematch, but maybe not. Maybe we have a winner.
I think there is a clear and obvious winner, and that winner is the quest for a more habitable planet.
Nicely said. And if I can also say, I think a huge round of applause for that team, because they start with much less clapping than they ended up with. So you clearly touched the room.
Yeah, they definitely
well done for
did.
that.
They regained claps, there's no doubt about it. They rode their lighthouse.
Anyway, I think you would have all understood by now that who wins and who loses is totally secondary to this exercise. It's really about deepening understanding of those difficult questions, the nuances, the trade-off, the tensions, inevitable tension. And yes, we can absorb those difficult conversations whilst having some levity and fun. So thank you to all of you. Thank you to you, Paul. Wonderful co-moderator. You should definitely debate next time. And thank you to the jury members. And thank you for you, wonderful, spirited audience.
And thank you to Sophie.
Thank you.
Thank you.
Well done. You should have
Well
had
done.
it.
Well done. Well done. You guys were amazing. Amazing.
Super well done.
Well, that was absolutely incredible. Thank you so much, everyone. That's definitely one way to avoid any sort of post-lunch slump. And I think for sure what we have seen is that was a bit of a victory for optimism. Now, as my colleagues here just helped to clear the stage and reset it, we're going to talk a little bit about what comes next. We are going to take that discussion in terms of the ICJ and the UN and what that potentially means for us into a little bit more of the practical level and take a look to see how the UK is faring. Shh. Thank you, everyone. I promise you there is a break coming up relatively soon, so you can continue the conversation then. So, yes, so how is the UK faring? And what does it take for a country to actually be well adapted? That's the next topic for our conversation here. And we're also going to be looking at what it means to protect workers in a way in which there is climate change happening around us, the excess heat that we've been talking about, and so on and so forth. For this event, one of our media partners is The Beautiful Truth. This is a remarkable print magazine and online hub which tells the human story of business. I am going to shortly hand over to Adam Penny, the CEO and co-founder of The Beautiful Truth, who's going to guide us through the next part of the afternoon. Adam will first host Emma Pinchbeck, who is the Chief Executive of the Climate Change Committee. in conversation. As we heard earlier on in the morning, Emma and the Climate Change Committee have just set out a remarkable report called A Well-Adapted UK. It's also about 20 years on from that landmark Climate Change Act. We are ready on stage, so I can invite Adam and Emma up on stage, and we will then have a session looking at the risks to workers from extreme heat. Adam and Emma.
Thank you, thank you. Thank you. What a lively debate to follow. Hopefully we'll be both lighthouse and rowers, but we will see. So with me is Emma Pinchbeck, the CEO of Climate Change Committee. You've just released your 4th report. Is that right? Walk us through some of the key findings that you have there.
Hi. It's really hot. Can I just say that? We should not let it get this hot over and over again. Whose job is that? So, look, for those of you, because I'm aware it's Alcor and we often have an international crowd in, but this is a rare moment where the UK gets to plug something that we're doing ahead of the pack. And the CCC is the independent arm's-length body of government. We're required to give the government advice every 5 years on the UK's climate targets, but also every 5 years on the climate change risk to the country and how we might adapt to it. And it's that report that we've just done. Usually what we do is the technical assessment of the hazards, which those of you at scientists will really enjoy, but almost no one in the real world reads, because it says things like highly likely, likely, unlikely, to do with the risk of things like heat and flooding and drought. This time we've done that assessment of the exact hazards facing the country.
Excellent.
But we've also, for the first time ever, said this is what good looks like in every system that we looked at: health, culture, infrastructure, and so on. So try to set what an objective could be, and to our knowledge that's the first time that's been done globally.
Yeah.
And then on top of that, we've worked out every solution possible to get us there.
Amazing.
Costed it and tested it with social research with the public. So there is a lot of analysis online. We are a public body, so you can find it all, including the underlying data. And now it's the government's job to take that advice and turn it into their own climate change risk assessment and a national adaptation plan.
Brilliant. And it opens with the idea that the UK that was built is the climate for which the UK is built no longer exists.
Yeah.
So that we need to now get ready for solutions.
Yes, I did a speech this morning. It's like my 5th one of these, and I did a speech this morning where they asked me to talk about my kids.
Very well,
Thank
I
you.
have to say.
In the heat, why is it hot? We know why it's hot. Yeah, I think the thing about what we might lose is really stark in the report. And when I was talking about it on launch day, I said it's really pitched between the hope and the fear. And it's very rare in the time I've been doing this to see a report which so clearly articulates the risks facing us.
Yeah.
Not in a hysterical way, in a very science-led, this is the central estimate way, but then it also talks about the solutions.
Okay.
And on loss, the thing I was thinking about is that this morning I was asked to talk about my kids, and there's the kind of tangible and intangible losses in this document. And the tangible ones we'll get onto, things like health, but the intangible things like the British way of life. Like, we like complaining about the weather.
Yeah.
And by that we mean it rains all the time. We don't know what to do with this. I don't know what this is, but it's not like living in the UK. So there's some stuff to do with who we are, what it means to be here, that I think we need to do a better job of reaching people with.
But it covers sort of broadly extreme heat, flooding, and drought.
Yeah, it covers, Livia's at the back, I always get the number one, 14 systems. I can list them all but never do the number. And then within that, there are 8 key risks, which include everything from food security and health. But we pulled out 3 in particular: extreme heat, drought, and flooding. And we were really keen to focus the report on extreme heat, partly because when you talk to people about risks in the UK, they completely intuitively think it might flood more.
Sure.
They've heard about rising sea levels. They've lived in the UK, they know it rains. Getting people to believe the UK is a hot country is really counterintuitive, so it's harder to get people to take action. So I don't know how many of you are from the UK and have a family WhatsApp. if you work on climate change, just stay off that thing, because I've got like half my elderly relatives being like 39, woohoo, and me just being like, no. How much am I willing to upset my mother-in-law?
Because there were, am I right in my quote that there were 3,000 deaths in?
It's yes. So in 2022, the 2022 heat wave. So in the report you can see, and they may be able to put the map up for you, but we modelled forward what 2022 would look like in a 2050 world. And in 2022, 2,000 to 3,000 people died in a heat wave. So far as we can tell from the evidence, that's fairly typical. By 2050, that becomes 10,000 people with no action. So, you know, heat waves become more frequent, they become longer, they become more intense, and the people that are at risk of that, there you go, you can see on the board behind me, are the elderly, those with underlying vulnerabilities. So if you're wondering why the map changes colour, it's because it's not coming up. Oh, I can see it.
We can see it.
How nice. There you go. You can see it on the slide over there, maybe.
There we go.
So this shows you what a single temperature spike looks like rolled forward, which is why some of the colours change over, because it's a single day in a weather system in a kind of particular set of climate conditions. But it does show you the story. It also shows you that at 4 degrees with no emissions reduction, we're in a world where we don't know how to adapt to that, and many more thousands of people die.
Yep.
So the extreme temperature on the far right of that diagram, the highest temperature in the UK we think might be possible is more like 49 degrees. In the middle one, and at 2050 it will be more like 45.
Okay, so what does this mean in terms of the recommendations that you guys are making?
So we're the statutory public body, and the first thing to do is work out what does good look like, which, as I said, we've done in the report. Now, this again might be counterintuitive, but good doesn't mean no damage.
Yep.
Good means the damage that people are willing to tolerate in the economy. We test that 2 ways: 1 on the money, and 2 on kind of social willingness to be disrupted. So, for example, if you're from the UK, the trains are never on time. People's expectations are not that you will make the trains run on time every time there's a weather event. Their expectations are, though, that their A&E will be open. So we've kind of worked through that. And then what that means for health is say when I want to progress the slides, could you put the one that's got vulnerabilities on?
I'm not sure we might. Do we
like
have
the
that
third one or fourth one? It's purple. There we go. So for health, what's really important is understanding, 1, the hazard, which is heat or flooding or drought, similar, and 2, where are the vulnerabilities, where are the critical services? And when you map those 2 together, you often get a priority which is different to what you would expect. For example, the heat in the UK will be worse in London, but the priority for adaptation is in the southwest of England, where we have an older population and less access to critical healthcare infrastructure.
Okay.
So what we've done is work out what those priorities are, and the overarching priority in the report for heat is install cooling, install it in care homes, hospitals and schools, and of course passive cooling too, loads of trees. But like, you've got to get air conditioning into buildings as fast as possible where there are vulnerable populations.
And a legal maximum working temperature.
Yes, so there are kind of sub-recommendations throughout the report. This is one that we went big on, not least because there was a heat wave when we launched the report. We're suggesting a maximum working temperature regulation. There's a minimum working temperature regulation in the UK already. This doesn't mean everyone downs tools when it reaches a certain temperature outside, but what it does is put the onus on employers to keep workers safe. So do you have cooling in your buildings?
Right.
If you have workers outdoors, are they wearing the correct PPE?
Right.
And we know that there's already a significant productivity lag from where people can't work outside when it's hot in the UK. Again, we're not used to being a hot country. And of course, that's very familiar all around the world. Yeah.
And are you seeing businesses and organisations in the UK start to put things in place already, or are we unprepared?
We are fundamentally unprepared for the risks that are coming.
Okay.
We also say that. So we've had 20 years of a national adaptation programme in the UK, with the exception of flood defences, which are a small bright point, and even then not enough. We are nowhere near prepared for what we will need to face in 2050, let alone what we could face if we continue to delay emissions reduction. Business does tend to get this. Why? Because it's an insurance premium approach almost. Like, you're spending money to protect yourselves against the risk that will materialise. So businesses we speak to get it. Government has historically not focused on adaptation.
Right.
So we need to get them there.
Okay. I know we are short on time. We only had 10 minutes. What would you like the sort of businesses and organisations in this room to take away if they took away one thing?
we can do a lot to mitigate some of the risks that we all face.
Okay.
Now, I'm not naive. You know, if we don't take action on emissions reduction, those risks start to become ones we can't adapt to. But at a 2-degree world, we can keep a lot of people safe. We can continue the quote-unquote British way of life, or the way of life in countries around the world as it has been. We can protect the things that are really important to us, whether that is the oak tree at the field at the bottom of my garden in rural Gloucestershire, or whether that is my lovely great granny in her very hot house.
Yeah.
Like, we can do some of this. What has been missing is the thought process around the risks and the action. What has been missing is government having a clear understanding of what needs to happen and kind of objectives. And very lastly, if I'm allowed another cheeky point, it's really cost effective. In a world where everyone wants to talk to you about costs all the time, most of these measures pay back immediately between like a minimum 2-to-1 ratio.
Right.
For stuff like putting cooling into care homes, it's like a 40-to-1 ratio from the second that you do it.
Right.
It's really, really cost effective to do this. We should crack on and do it.
Okay. Okay, we're done. Time-wise, thank you very much, Emma,
You're welcome.
for joining us.
Thank
Have a
you.
good week. I'm sure
Thank
you'll be
you.
busy.
Thank you.
So we now have two other people joining us. Asif Sheikh, who is from the People's Courage International, who work with workers. Please, I think we're going to grab another chair. Fantastic. So, yes, I will sit in the middle. You work with migrant workers, like millions across Asia and South Asia, and also Graham Peterson, who comes from the Greener Jobs Alliance steering group here in the UK. Welcome. Thank you for coming. So, Graham, I want to start with you. You've been in the trade union movement on climate since before most organisations were taking it seriously. What pulled you in? Give us a sense of your story and what keeps you going.
Well, I suppose you could say that most trade unions have actually been born out of the struggle for better health and safety conditions at work. And I started as a union rep in the early 70s, just when the Health and Safety Act was coming out, which laid a responsibility on all employers for the first time to protect workers' health and safety. And it wasn't really until the early 90s, after the Rio summit, that started to think more about, well, okay, there are occupational health and safety risks, but there are climate risks as well. Sure. And employers, have a responsibility to actually address both. And they have to address one under the Health and Safety Act, but it's a lot less clear of their legal duties when it comes to climate risks.
Okay.
So, in terms of what's keeping me going, as you can see, I'm an old bloke. I should have given this up a long time ago, but this is the year, 2026 is the year of trade union climate action.
Right.
And I think it's important, because unfortunately, there is a capacity issue in the trade union movement, lack of prioritisation. It is going to be important to try and make sure that union reps do have resources to really, get something out of that campaign.
Okay, and we're really seeing. I've also been around a while, and it's the first time I'm really starting to understand, and certainly one of the messages today is how linked climate and health are, and climate health and therefore workers. So we're seeing lost productivity. The Climate Change Committee has just recommended this legal maximum working temperature in the UK. What are your thoughts on that?
Well, I think it's great, and speaking on behalf of the trade union movement, I really welcome it, and it's long overdue. People probably know there's been a minimum temperature by law in place for a long time now, but nothing on the maximum. And it's really crucial that the government picks this up and responds to it. The TUC's issued a release today saying that we need to make sure that the Health and Safety Executive are petitioned to act on this, because we don't want this, the well-adapted UK report to just lie on the table. We want government and agencies like the HSE to pick it up and actually introduce the sort of protections that we're looking for.
Okay. You also make a link between extreme heat and air pollution. Can you tell us about that?
Yeah, well, I mean, although I said really welcome the report, if I was going to be a little bit critical, I do think that there should have been a stronger link with air pollution, because Emma talked about the main areas that it covers.
Yeah.
But it is well established, and the WHO recognise this, and most of the medical profession, the link between air pollution and extreme heat, kind of synergistic effect. And what I mean by that is things like, well, you know, the mayor's recognised it today, put out a pollution warning for ozone, that when you do get extreme heat, you get ozone build-up. That's an air pollutant. When people are working in very hot temperatures, then you're talking about, you know, the lung capacity, breathing in more pollutants, the urban heat islands and this sort of thing.
Okay. One of the things I think was interesting when I was doing the research was the education unions have developed this heat wave protocol already. Can you talk about that and what we can learn from it, or what other industries organisations?
Yeah, my union's the University and College Union. I was the environmental policy officer, and we're a number of unions that have signed up to this protocol. And what it shows is that, you know, what it's calling for is unions to act with management to try and actually put in place the kind of control measures that are needed, because, you know, it's not hard to look at the kind of controls that, I mean, interestingly, just very quickly to give you an example, there was a dispute 115 years ago across the river in Bermondsey where 15,000 women workers went on strike over the heat. So if nothing's done, you know, workers can take industrial action to put themselves out of danger. And that was a very successful dispute. I mean, it's a really interesting read if people get the opportunity to find out more about it. But it's where those women workers who weren't unionised got unionised. Their demands around not just heat, but a lot of other things as well, but were met. But it included things like, you know, at that time, if you fainted on the job from the heat, you know, these are people working in very hot industries like jam and glue, then you'd be fined by the employer.
Wow.
And there are still issues like that, you know, not quite so stark, that workers, you know, are being penalised as a result of working conditions which at the end of the day are very unsafe for them.
Okay, I think, Asif, this is a great moment to bring in you, because obviously your work, which is incredible when I looked at it, because you work with so many migrant and informal workers across Asia and Southeast Asia. Tell me what extreme heat looks like in a working day for these people.
Yeah. So I'll share two stories actually. So recently I met a daily wage worker in the state of Madhya Pradesh in India, and he was hospitalized almost for 7 days because of the heat stroke. And just after the recovery, he again started work as an outdoor worker. And I asked, you should focus on your health. And he gave me an answer, if he will, health can wait, but hunger cannot wait.
Yes, hunger.
So he need to deal first with the hunger related issue as comparative his health.
Yeah.
So that's one example and a very solid statement. And last year I met another guy. His name is Santosh in Churu district of Rajasthan, and Churu is one of the very hot district in India. And basically he told me one very powerful the point. If he kept candle outside his house, by 11 or 11:30, the candle melted.
Really?
And in that kind of the temperature, the construction, he was a construction worker. So the construction company and the contractor expecting him to go and work outdoor. So that's the situation of the worker. And I think sometimes we are thinking this whole issue like the heat is only related with the health, but that's not a reality. Heat is related to their poverty, their vulnerability, and because of the heat or climate change, the vulnerability is also increased. And if they are more vulnerable, then they face another difficulties also, such as like trafficking. So we are running a helpline for the migrant and informal sector worker. Every month we receive about 25,000 complaints. And many people basically fall into the bonded labor practice or forced labor or trafficking because the climate change is forcing them to leave the villages and go to other places.
Okay.
And previously, like, the migration corridor fixed actually. So people migrate from one place to another place for 10 year, 20 year, 25 year.
Right.
Now, because of the climate change, the whole idea of migration corridor is completely collapsed. So the people are migrating from this place to another place for 1 year. The next year they are going to the third place, fourth year they are going to another place. And basically these things also create a huge, like, the vulnerability in the communities.
Okay.
So lots of things are disturbed at a community level because of the heat and other climate change related issues.
Okay. So tell me some of the solutions. I'm particularly interested in this parametric insurance that you talked about when we spoke.
Yeah, so basically the parametric insurance is a one solution, but we basically create a bundle, service bundle of the services. So parametric is a part of that, like the package of services. So basically we started with the air quality, and we strongly believe like every climate risk is well connected, as he shared about like the air quality and the heat.
Right.
So we are trying to focus on all the climate risk, and we started with the parametric insurance on air quality in Delhi.
Okay.
Then we added like heat and humidity, and now we created a comprehensive parametric insurance solution, and that called like multi-parallel parametric insurance, and cover all the climate risk. So basically now the industry and other people are paying the premium. It's a 1 year like the policy, and we are covering thousands of workers in India. And apart from the parametric insurance, we are also providing other insurance facilities to the community. Altogether we are covering about 10 million informal sector workers.
And what does the insurance mean, and who is paying?
Yeah, so initially philanthropy paid the premium, and now we are trying to convince the private sector, because end of the day these people are part of the like the supply chain of industry, so the industry should pay. So in many places, like currently industry is paying these kind of like the premium, and on a longer run I think the industry, government and the philanthropy need to work together on the parametric insurance and other solution.
And I think you said $10 per worker per day.
Yeah. So if the like the multi-parallel parametric insurance is like between 10 to 12 million, sorry, 10 to $12 per year per worker.
Per year
Per worker.
Okay, cool. And how are organizations and companies taking it up?
Yeah, so it's in the initial period it's a little bit difficult, but as I said, like we are not only focusing on one climate risk, we are adding different kind of like climate challenges in a one like the product. So initially we faced some difficulties to convince the private sector, but now we saw lots of interest. So for example, last week about 3,500 workers received payout from the insurance company. So these kind of like the examples are a very powerful tool to convince the private sector for paying the premium.
And what's being done with workers to protect them when they are working? You talked about a few solutions, whether it's roofing or vests.
Yeah. So basically, the parametric insurance is a one solution, but we started cooling center for the gig workers, like the drivers, taxi drivers, three-wheeler drivers, or other like the delivery people. So the cooling center is a one solution. The cooling vest for the construction workers and the other workers working outdoor. So that's another solution. We started a very large program for the hydration facility, and again with the industry. So industry is paying for the hydration facilities for their workers as well as the workers in general.
Okay, thank you. So you're both saying solutions exist, evidence exists, the business case exists. So what's stopping things happen? What's stopping it actually getting traction? What do you think, Graham?
Well, I think that it's been touched on today. There is a pushback against this. I mean, it's not new. I mean, in health and safety, we know that employers have pushed back, but also the media talked about, being woke and nanny state, sort of thing. And the same thing's happening now with climate. When the report came out, the CCC report, we got an immediate reaction from some of the right-wing press. talking about, oh, means that workers are just going to be sitting down on the job. Yes, and this is a burden on business, and we shouldn't underestimate the power of the business lobby. Some parts of business, I know there are businesses represented here who probably do think that this is still a good thing, but there are a lot of organisations out there, and we've seen this with the kind of pulling back from climate commitments because they feel that the tide is turning around climate, and I think that people need to recognise that and have a vigorous response to it.
I also wonder whether, as Emma said, we just haven't yet made the link that extreme heat is in this country. I don't think that people go, oh yeah, that's the UK. We are also suffering from extreme heat. I wonder whether it's a shift in mentality that's needed.
Well, you're right, and I think certainly this week is going to actually help with that shift. But there are other issues as well. There's the HSE, Health and Safety Executive statistics show that 4,500 workers contract skin cancer every year from working outside. So that's not extreme heat, but that's working in the sun. And there are a whole range of things like that need to be brought out into the open to show that when we're talking about climate risks, this is something that affects people at a very fundamental level. It's not some abstract thing down the line in the future.
Asif, what do you think the UK can learn from your experience and what you've seen in Asia?
Yeah, so I think even from last night I realized in the countries such as India, even people are not using the air condition, but we have infrastructure where even the poor people basically managing the heat at some level.
Right.
But here it's a very difficult to manage the heat. So I think in particularly the climate change related solution, the West or like the UK, US should learn from the like the global South, because people try and test various kind of like the solutions. So that's a one thing actually, particularly the heat related solutions and other. And the second thing, I think in the global South, lots of conversation going on about the respect of the labor. Because like these people, like the migrant people or informal sector workers or gig workers, they created the economy, they created cities, they basically created, like built the airport, temple, like the highways and everything. And in this difficult situation, they need a support from the businesses as well as the government. So as you raise the point, everything is available, solutions are there, like the money is available. But I think the biggest thing about the political will, not only in the political parties or the government, but also in the industry and the communities. And I think we should recognize, I think the recognition of the contribution of the workers is very, very important and crucial, because people are dying. Like the heat is killing the people, and still people are going and working, and they are providing services to the other people. They are contributing to the economy, they are contributing to the nation building. But actually, like still we are struggling for the finance. We are still, like organizations such as us or trade unions and other people are still mostly depend on the philanthropy or like the charity. I think now the time is how the businesses and the government should invest in these kind of ideas.
Sure. And what's the reality of businesses seeing that, do you think? I mean, businesses losing money for worker time being lost, but did they really understand what's needed?
Yeah, actually some people are taking this whole issue to support their own worker or clean their supply chain. But some people, I think they realize if they will not invest in these kind of ideas, their supply chain or their like the profits will affect. So everybody is taking these issues from a very different perspective.
And do you see, Graham, in the UK, do you see certain businesses or certain industries taking it seriously, or not yet?
Yes, I mean, I think, we had the Deputy Mayor of London here this morning.
Yes.
We have been in discussions with him because, the GLA does have what's called a good work standard. In that, it is a requirement, if you want to achieve that standard, for employers to alert workers when there are heat risks, and also to then discuss control measures with their workforce. And I would just urge people that haven't seen it, the ILO, the International Labour Organisation, the tripartite body between government, employers and unions, has recently produced a set of guidelines. They won't be fully endorsed until November, but they have been agreed, and they represent a really good set of a basis for any employer and union to sit down and have discussions about the sort of approach that's needed.
Excellent. We do have some time for some questions. If anybody has some questions from the floor, please. Do we have microphones? Great, thank you.
Hi, my name is John Bulstrode. I work for BRAC, which is a
Hello.
Bangladeshi organisation, works with a lot of migrant workers. My question is about the World Cup, because I heard stories about construction workers dying in the US, Canada and Mexico. And I just wondered what the panel thought about the Qatar World Cup, the reporting on heat deaths. Has the conversation changed, and what role do these sporting events play as a platform to talk about some of these issues?
Fantastic. Asif, do you want to kick off with that? Or Graham?
You can go first, yeah.
Yeah, I think, well, that's a very pertinent question. And the whole issue of migrant workers is something that really came out in the open with the Qatar World Cup. I think, there's been a lot of talk about playing in extreme heat. And again, it's a way of actually, bringing this issue to the fore. I think, obviously there's one stadium that's air conditioned, but it's going to be interesting to see, what impact this has over the next few weeks when you're talking about, playing in temperatures which are off the scale. And really, if you're interested in health, then you shouldn't be exposing fans, but also particularly the footballers themselves to those kinds of temperatures.
Because we're seeing hydration breaks, aren't we? I think it's the first time I've seen a World Cup with hydration breaks.
Yeah, which is good, but they're being used as a commercial activity as well.
Yeah,
that's true.
Even like in the last World Cup, lots of conversation because lots of Nepali workers lose their life, and basically lots of civil society organizations raise this question. But actually, like these issues highlighted by some like the media people and the media channels, but still like globally about 2.4 billion workers are affected badly because of the heat, and about 1 billion people affected badly because of the air quality. So I think this issue is not about 100 worker or 1,000 worker or 1 million worker. Billions of workers are affected very badly because of the climate change, particularly because of the heat or air quality alone. So I think we need a comprehensive like the movement where the civil society, the activists, the industry representatives, everybody should come together and work together to solve these kind of like the issues.
Fantastic. Anyone else? Some more questions? On the floor. Over here, please. I think there is a microphone winging its way to you.
Thank you all, really inspiring talk. My worry always is about equity. And I suppose when we think of like in the UK, we may wish it differently, but many workplaces are not unionised anymore. Or the companies are too small for collective action to really be as powerful as we would like. I think the insurance you're talking about is fantastic, but do you know who is able to access that insurance? Is it only one section of society, or is it everybody? And just what do we do about the people that we're not currently helping? The workers
in the UK?
Everywhere, really.
Everywhere, really. Okay, maybe we'll start with the UK. Graham, what do you think?
Well, I mean, it's not easy, but I mean, certainly, health and safety and climate work is an organising issue. That just having a union isn't a guarantee that you're going to get decent conditions, but it does help, and the facts and the research bear that out. So I think unions do need to put a lot more effort into the unorganised workforce, migrant workers in this country, to actually show them the benefits of this. And for me, the whole issue of climate risks is something which is accessible. Both, people do understand it. We talked about the language that's used around environment and climate, but people do understand these things, and that I think that, it is something that should be an important mobilising tool.
Yeah. Asif, I think we've got time for one quick comment from you.
Yeah, actually, in the current political situation or the external environment, it's very difficult to mobilize or like organize the migrant population particularly, because they are moving from one place to another place. So even the unionization in the migrant population is very, very difficult. So I think how we can create some different alternative structure also, we already discussed, like in many places, it's very, very difficult to build the unions of the worker. But at the same time, how we can use, particularly in the case of technology, how we can use, in the case of like the parametric insurance, how we can use the technology and create a different kind of like the system. So in parametric insurance system, there is no any requirement for assessment or like the field visit or any other thing. Worker can get, once the temperature cross, worker immediately receive the payouts in their bank account.
Amazing.
So these kind of like the solutions are very, very crucial, and we need to scale these kind of like solutions.
Okay, fantastic. Graham, Asif, thank you so much for your time. I believe we're on to the next session.
Yeah. Thank you so much.
Thank you. Thank you. After you.
Thank you so much for bringing home to us just exactly the scale of the challenge that has faced workers today. This afternoon, you really have you are spoilt for choice, essentially, because we are kicking off with the cultural stage, which is happening up on the 3rd floor. So that's just getting underway, if anybody would like to join us up there as well. And otherwise, time for a very, very quick refreshment break, and we'll see you back here at 10 to 4 for our closing session of the day. Thank you very much.
The back is hard. Yeah. Even on 3rd, where you
Do we have a voice of God? Yeah. Yeah, because everyone's standing up. Let's just get them to sit down. Yeah, great. Hello again. Oh. Hello again, everyone. Don't worry, there's not too much left of me for this afternoon. And I am going to also promise you that stick with us for the next 90 minutes and you will be rewarded with a lovely, cool cocktail up on the roof on this beautiful summer's day. Hopefully it will cool down a little bit by then. But also I just wanted to say a massive thank you to everybody for leaning in and just being such an incredible audience today. So thank you very much. And give yourselves a round of applause because who else will? There you go. Thank you. Okay, so in the final part of the program, we are squarely focused on creating the conditions for solutions that succeed. Next up, we are going to look at the opportunities to unlock new forms of investment for health prevention and resilience. We're going to discuss how funders, investors, and partnerships can back solutions that protect public health now and strengthen systems for the future. To lead this conversation is my colleague, Gabby Morgan. Gabby is a partner at Conduit Connect, where she invests in early-stage companies building solutions across integrated health, sustainable industry, and financial resilience. Thank you, Gabby.
Do you want to come up behind me? Thanks. We'll just sit under our names. I'll stand up here first. Hi, everyone. It's wonderful to be here. So just to reiterate, I'm Gabby Morgan. I'm a partner at Conduit Connect Ventures. We are the venture capital arm of the Conduit Club. And so our mission is to invest in innovative technology businesses that are solving some of the greatest challenges facing people and planet. And I'm particularly excited to be here because of the focus of the conference today, because the way that we've invested at the fund over the last 6 years, or the way that we think about investing, has evolved. We used to think about investing in climate and health as isolated sectors, and now if you look at our sort of investment thesis in our deck, it is literally a Venn diagram of saying, you know, we are investing at the intersections of where integrated health, where sustainable systems, and where financial resilience converge, because we feel that this is the only way to invest for true systems impact and also for true commercial scale as well. And while my expertise sits within the venture capital space, or the sort of private market space, I'm so excited to have this fantastic panel of expert philanthropists with me today, because so much of what we do relies on the work of philanthropy to fund R&D and evidence and de-risk a lot of the investments that we ultimately invest in. So many of our investments have raised significant non-dilutive philanthropic capital before they are ready or before they're appropriate for private market capital, if that's the type of business model that they have. So we're going to dive straight in. We have 3 big questions to cover, so we're going to go quickly. But I just want to introduce you briefly to my esteemed panelists. So first we have Charlotte Watts, who's an executive director of Wellcome Trust. Wellcome Trust being one of our founding partners of the conference today. Dr. Naveen Rao, who is the vice president of the Health Initiative at the Rockefeller Foundation. And finally, Roger Mark D'Souza, who is a vice president focusing on the environment at the Pew Charitable Trusts. Thank you so much for being here today. So as I said, we have 3 big questions that we're going to cover. So I'm going to introduce the question and ask each of the 3 of you to comment on them. So I guess first what I'd like to do is really place philanthropy in the sort of stakeholder map of climate and health, and ask you to share, number one, why has this become such a strategic focus for your organizations? And then critically, what can philanthropy, and again, your specific organizations do that other types of funding cannot do? Governments, venture, whatever it may be. Where can philanthropy really move the needle at the nexus of climate and health? Charlotte.
Great. So good afternoon, everybody. I'm really pleased to be here. And for us, Welcome is a science-based global philanthropy. So our interests really are on how do we improve health worldwide and how do we use the power of science and evidence to really drive action. So climate and health for us is a major priority. Because the climate crisis is the biggest crisis we all face, we were seeing that health was not getting the attention that it should get in the climate negotiations. But actually, when you start understanding the implications of health, it's profound. It's across so many aspects of health that climate is creating a health. The climate crisis is essentially creating a health crisis. And so organizationally, we've got behind this in a major way. And what we've been trying to do is say, actually, let's start to surface some of that evidence, but also to continue to build that evidence base. So, for example, we've supported the Lancet Health Countdown, and just in last year's reports, it tracks a range of indicators. They're flashing red. Basically, we are not taking the action we need to address the health threats from climate change. And so as we move forward, we're trying to say, well, how do we not only generate that evidence and support the academics, and particularly bringing in the climate experts with the health experts to really join up that conversation. You were talking about working at the boundaries, right? They weren't working together, I think, until Welcome came in such a big way. But also then, how do we continue to generate the evidence that we need? So, for example, areas that we are looking at now is, what does heat mean for pregnant women? We know it's increased risk for them and their children, but actually, how do we really understand that? How do we work out what we can do to reduce that vulnerability? We also work in mental health, and again, the connection between heat and mental health. What do we understand about those links with anxiety and depression? And also other aspects of health, be it infectious disease or other areas as well. So for us, fundamentally, it's the importance of that evidence base, because evidence is really powerful to take to policymakers and go, do you realize the risks that we are facing now, we're seeing now, and the urgency of action, as well as then generating evidence about what we can do about it.
And also, as you say, specifically understanding how to communicate the intersecting data between climate and health. I think where later stage funders or different types of funders fall down is where we find it difficult to understand what are the overlapping KPIs that we need to be looking at. And I think philanthropy has the capacity to create those frameworks that we need in order to follow on with confidence. Dr. Naveen.
Thank you. Thank you to the organizers for having me, and I really appreciated this comment, Charlotte. You asked, there were two parts to your question, Gabby, and I want to answer them in two parts.
Please.
First is you asked why climate and health and why now? And the second is what are you doing about it, or what can you do as a philanthropy about it? If you go to Google and search climate change on a Google search and then type images, you probably will get to 5 or 6 screens. You'll see polar bears, you'll see smokestacks, you'll see polluted air before you see a human face. It is amazing that even today, people haven't connected climate change to humans. And in that Venn diagram you talked about, I think the intersection there is the human face. And I think that has reached proportions of focus now and priority, and that's why people are paying attention. Let's just take heat. Heat is rapidly becoming one of the biggest killers in terms of climate change. And there is evidence now that it's about 1 person every minute is dying from heat. And these are just the ones who are dying. Then there are millions who are affected by quality of life and morbidity, whether it be kidney disease, heart disease, pregnant women. So it is affecting people. It's a lived experience, and that's why. But also, two other reasons why people are talking about it now. One is it's rolling back a lot of the advances we had achieved the last 2-3 decades in public health, whether it be TB, malaria, whatever it is. Because of climate change and the way we are, and with aid cuts and geopolitics, we are actually rolling back. So people it's getting into people's consciousness. And then the finally is climate and health is not just climate and health, it has an economic impact. They dare say that it's about $7.1 trillion will be lost in productivity by year 2050. So it's the human face, it's the fact that it's affecting everyone, it's a lived experience, and the fact that it's also an economic. So that's why everyone, including the politicians, have woken up. So that's the first part. What are we doing? Philanthropy. And I wanted to move away from philanthropy as a grant maker. So if you looked at philanthropies the last 100 years, we were grant makers. We gave grants, and we need to move from that mindset, and we are moving from that mindset to market builders, market shapers. And we basically have 4 tools in the innovative finance, and I'm focusing only on finance because that's how you set up this session. So if I look at, first time it's not working, can you hear me now?
There we go.
Oops. Did you hear anything I said? Sorry, I'm just. So the first, other than grant makers, if we really look, grants being one tool where we give grants and then we follow and we expect results, and in a way we sit back and wait for those results. Those are traditional. We now are very involved in blended finance, and Rockefeller Foundation has been one of the pioneers in innovative financing. And blended finance basically has 3 levels. I think this has come from some architectural connotation, but the first level, at the ground level, is first loss. So foundations like ours have endowments, and so I think our endowment is somewhere around between 5 and 6 billion. I don't know where we are right now, but that's just money sitting on our balance sheet. And is there a way to use part of that as a first loss? So if we were to say on an innovative but a risky project, that Rockefeller will take the first loss, and that we will put X amount from our balance sheet, which is not really money we're putting on the table, but we're putting our name and our balance sheet, and based on the strength of our balance sheet, we take the first loss, and that attracts the other partners, whether they be development partners or commercial partners, to come to the table because they feel more confident for that. If we go through the ground level, the next is called the mezzanine level, where we put in money and we do the first loss, but we also attract the development banks and the development partners to come in. And they are more likely to come in if organizations like ours put the first loss and take the first risk. And finally, of course, is commercial, where all 3 floors, we have the ground floor, the mezzanine, and then we attract commercial partners to come in and put the big bucks, because they now feel they can actually make money on this project, and that project is going to help us with the vulnerable patient. So that is the blended finance. The third tool we have is outcome-based results. So we can put in our funding on 2 different kinds of issues. One is where we pay for performance, and we kind of ensure success because we are performance-based, but also we can use our money to float social impact bonds, where we say we will put the bond along with donors and people who want to put in money but also want their returns. And then we say, for example, if you're looking at maternal mortality, we'll say if this country reaches a maternal mortality rate, a reduction of so-and-so, then those people will pay, the investors will pay the companies that the NGOs that have done the work, and if they don't, then we will be accountable for the difference. So can we float bonds? These are all new ways of using our finance beyond just giving grants. And the last one is, of course, investing our own money. We have in our endowment money, and we have people who invest that money to get returns for the organization, so then we can use that for philanthropic work. But what if we were to invest our own money in projects that have an outcome that is important to us? And so we have what is called program-related investments and mission-related investments that have different levels of return of investment for the company, but also advances mission in it. So the answer to your question is twofold. It's here and now, and there's new ways of doing it, and philanthropy needs to wake up.
And just to bring it to light again in terms of how that translates to later stage funding. So in an investment that we made recently, we invested in a prostate cancer diagnostics business. That business had been funded for about 7 to maybe it was even 9 years, primarily through philanthropic and non-dilutive or catalytic capital. So a mix of all the things that you're talking about in order to build the evidence base, because at the point that we are investing, we have a mandate to sort of return capital to investors or exit these investments within a 7 to 10 year horizon. We would not have been able to fund from that stage, and that is what all of you are able to do, and to provide that sort of patient capital that venture and other forms of capital can't. So it has a huge impact in helping those businesses get to a point where they can scale. But Roger Mark, I'd love to bring you in on this.
Do you want me to use the microphone?
I think yours might. Yeah.
Better? Yeah. So, I'm so inspired by hearing what you both have to say, and this is exactly why we're working together. So the Pew Charitable Trust, as a donor, has come into this space thanks to the leadership of both Wellcome and Rockefeller. And I'll tell you a little bit about the trusts. We are both a donor and an implementer, which is a little bit unusual in the philanthropic space. So it means that we do research, we support research, we implement programming, we fund programs, and we help mobilize funding for the work that's being implemented. And that is a particular niche that we feel with our profile that we can leverage around climate and health. Now, the way that we are organized is we are registered in Philadelphia, and our programming in Philadelphia is doing heat-related work in the state. We also have a program, a department that focuses on fiscal responsibility, and they look at these issues from a fiscal perspective at the state level. And then we have our environment program that's doing conservation and climate change work in a very innovative way. And we are using both sovereign and non-sovereign debt and financing models to really mobilize long-term financial instruments that would result in benefits to beneficiaries in perpetuity. And this is an unusual model that we are looking at how we can apply in the climate and health space as we look at extreme heat and super pollutants. One of the things that we know for sure is that we are hearing this demand from governments. We're hearing it from communities, and we're hearing it from indigenous leaders. And this is a very important model and approach. So we're able to put into place an evidence base that's tied to innovative financing around extreme heat and super pollutants to respond to community demands, to push governments to really get into blended finance opportunities with us. And we see that as a very unique role and opportunity.
Well, this is a perfect segue into what we wanted to talk about next, which is, so we've now defined where philanthropy sits in climate and health and what you can do that others can't. But another hugely important piece of this that's been threaded throughout the day is collaboration, not only amongst philanthropy, but collaboration with all the stakeholders that we need to bring in to have the impact that we want. So I know each of you have some really specific examples of how you're working on this. So Charlotte, I'll start with you. So how does philanthropy need to collaborate and coalition build to make change?
Yeah, great question. And I mean, just to pick up actually on the role of philanthropy, I think what's powerful about philanthropy is the way it can be catalytic. And actually, we can be catalytic in surfacing ideas for us, bringing evidence on climate health, those sorts of areas, and getting that evidence to government. But actually, we can also be catalytic in saying, actually, once we see that evidence, once we start to see what are those priorities, then how does philanthropy start to work together? Really in a joined-up way to tackle some of those big challenges. They're huge, right? And the risk is that the philanthropic space, it's big, it's complicated, that actually we're all pursuing our own interests, but actually it's not adding up to the scale of change, the transformative change we want to achieve. So a key element for us is, I'm working with Rockefeller and Pew, is agreeing actually where are areas where we align, where we have shared goals, we have common priorities, but also we might bring different types of expertise to to those agendas. And so we are together funded the Climate and Health Funders Coalition. And for me, that's just a really important space where we are sharing what we learn. We're starting to identify investable projects. And then we're coming together to collectively support them and really try and take them to the scale that actually they need to have if they're really going to have an impact. So it's the way that we can be ambitious collectively. So give you a feel, together we are jointly committed to spending more than $300 million over the next 3 years on the agendas of extreme heat, super pollutants, climate sensitive infectious diseases, and data for decision makers. And what's important about that is you can really be far more transformative if we work together, but also it gives a platform where we can also engage with others. And so for us, as we look forward on that agenda, we'll also be saying, well, actually, how can we bring in governments? What is the role of the private sector? In many cases, we're supporting innovation, we're generating evidence, we're taking those early risks, right? But actually, we know to go to scale, we need government and private sector partnerships, and that's where other types of financing can come in.
And helping to define a thesis,
Exactly.
which so many funders need,
Thank you. Thank you, Charlotte. Again, Gary, your question was all about collaboration. And one of the collaborations was what Charlotte just talked that we're doing together. I do want to give a shout out to Alan Denger, who's leading us on this from Wellcome Trust. And really, it's fascinating to see how funders are coming together in collaborating. But since that example has been given, I want to give another example of where we are collaborating and how we are reimagining the future. And specifically at Rockefeller Foundation, we felt it was our responsibility to reimagine global health in the 21st century based on, obviously, geopolitics with aid cuts, climate change, conflict. They're all coming together at the same time, and they affect the same populations, mostly the vulnerable in the most vulnerable countries. So if that is the case, how can philanthropy collaborate? And here I want to give an example of how we're collaborating with heads of state in these countries. We, along with President Mahama of Ghana, are supporting and launching a program called Accra Reset. But the basic tenet of Accra Reset is, can we help countries transition themselves off aid to self-reliance and sovereignty? The whole idea is, can we not waste this crisis? Can we come out of the crisis better and stronger? And we are helping this transition to sovereignty. And the whole idea is, how can we help these countries build resilient health systems, resilient primary care health systems, resilient health systems that can withstand shocks, current shocks and future shocks. And the future shocks, there are two big shocks facing these countries, all of us, but more so these vulnerable countries. One is climate change, and the other is pandemics. And unless we get them self-reliant, domestic financing, a sense of ownership, away from aid, and then in that process, I think our collaborating with heads of state, with countries, with other funders, bringing in the development banks, bringing in the private sector, bringing in other civil society and philanthropists to come around these heads of states who have planted a flag saying, enough, we want to be self-reliant.
And in practice, that looks like, as you said, providing funding, but also providing the thought leadership, the research that these governments need in order to implement these programs.
And build capacity.
And build capacity, yeah.
And I'd like to, I love these examples. I'd like to give an example of another kind of partnership that Pew Trust has helped establish. It's called Enduring Earth. And it's unusual because there are 4 key partners to it. There's the Pew Charitable Trust. There is Zoma Lab, which is another donor, one of the big US donors. And then we are together as equal partners with the World Wildlife Fund, WWF, and the Nature Conservancy. And this partnership being equal partnership with these large environmental NGOs and going to governments, to multilateral agencies, to donors, to individual philanthropists, to make the case for long-term conservation, which is premised on a model that's called the Project Finance for Permanence, whereby we work with an independent conservation trust fund that then invests the money that in perpetuity go back to the communities and indigenous leaders. So this is a model that's new, it's innovative, it had been done before, but in coming together in the last 5 years, we have closed 11 deals, both in developed and developing countries, and have mobilized close to $2 billion. So this is a catalytic way with an unusual partnership. And we are interested in looking at those kinds of models and to see the opportunities for climate and health. Because what we're hearing from the governments and from the leaders and the communities is that the social dimensions of conservation are more and more important. They want us to look at worker well-being, at the impacts on labor, on the health impacts of the community, and the climate change dimensions. So we're hearing this directly from the beneficiaries that we're working with, and they're so struck by this unusual partnership where everyone is coming together. They're not competing with each other, and that is enormously powerful.
I think what's incredible about what all three of you have shared is, Naveen, in your opener, you said, I want to really move away from thinking of philanthropy purely as grant making. I think it couldn't be more evident in these projects that you're working on that you are moving so beyond pure grant making and funding to ecosystem building, coalition building, stakeholder advocacy, to build capacity in the ecosystem, which is incredible work. I'm getting the 2-minute flashing light. I'm very glad we went down from 4 questions to 3, aren't you? The final one that I wanted to pose to you, so we can do it as a quick fire, is you are leading some of the most sort of consequential philanthropic organizations in the world. If you were able to walk into the office tomorrow and have one initiative funded, what would it be? In climate and health, of course.
It's a really hard question because I'm really excited about what we are doing, which is on those focal areas. And I think they're really important, is actually where you say heat, you can get traction, super pollutants, you can get traction. So when we're thinking about how we have progress on climate, it's saying what are the things that resonate and that will mobilize greater action. So for me, I would just double down on each of those areas, but it would be how do we double down in a way that moves it from not only philanthropy stepping up, but also bringing in those blended finance options, and also ensuring that in the approach that we're doing, we're building on the networks that we're supporting across Africa to really shape that pull-through of the evidence that we're investing in and generating to work in partnership with communities to say, actually, does that really translate into action on the ground? Yep. So it's that translational element that, if anything, we would just, really make sure that we've got the right alliances to move forward with that.
Fantastic.
If I had $100?
Yeah.
Okay. If I had $100, I'd put it all in helping countries be resilient to the threats of climate change, and specifically I'd do heat. I'd do early warning systems and health action playbooks. And think of it this way, that you need both a smoke alarm and you need the fire engine. If you only have a smoke alarm that's a good early warning system that the heat wave is coming, but you don't have a fire truck to put out the fire, it's pointless having a smoke alarm without a fire engine. And similarly, having a fire engine not knowing where to go, when to go is useless. So you need both early warning system and action playbooks. I put my money there. I put my money on AI capabilities in these countries to leapfrog infrastructure problems and go to the 21st century. And the example right now is in Bangladesh, we have a project called Heat Shield where we are helping 300,000 farmers withstand the heat shocks by giving them early warning, telling them when the heat wave is coming, what they can do about it, And fascinating is they talk to each other through a chat box and through each other through WhatsApp and technology far beyond what anyone thought they would be able to use. So giving them the tools, getting AI, making them resilient, getting them early warning, and so that is where I put my money.
So I have two sons. They're in their 20s now, but when my younger son was 7 years old, we were having dinner, and he said to me, "So Dad, what did you do today? Did you spend your day in meetings or did you make a difference?" So we need to move to less talk and more action. And I think that action needs to be centered with those who are most vulnerable, and to understand that they have leadership models and approaches that would allow for the sustainability of interventions. So we see this with the indigenous leaders that we work with. It's not easy. It's very, very difficult. But we're working with indigenous leaders in Canada. We're working with indigenous leaders in Panama to address similar challenges, and they're learning from each other. And that ensures that it will have long-term application and sustainability.
Thank you. Well, we've reached the end of the session, so I'll just close with saying it's clear that there's incredible innovation being supported and built out of these organizations, and a huge number of ways that we can all get involved. So I really encourage you to look up some of the work that they're doing, and think about maybe how in your organizations you can contribute, support, join, and be part of these coalitions, because this is really at the bleeding edge of innovation when it comes to climate and health, and we need these funders to be there in order for these businesses to scale and have the impact that we want. So join me in thanking our fantastic panelists. Thank you.
Thank you. We covered a lot of ground. Thank you. I'll see you soon.
What an inspiring conversation.
Oh my God, it's hot
a great
up there.
reminder of the power of philanthropy.
It was just
very much connects to the discussions we had
thank you.
earlier this
we got
morning
through a
as
lot.
well,
We
about
did
how
it.
philanthropies can be shapers, and they can go where other places don't necessarily go. And
Oh my
really
God, I got so
take
hot up
action.
there. Could you see
And
me
I also
sweating?
do hope that sometimes being in a meeting or perhaps being in a conference also means that it leads to action too. So that's the takeaway for today. We are sticking with the theme of solutions and innovations. And our next panel is going to look at how we can move from essentially looking at adaptation and action, going from pilots after pilots to actually integrated system-wide solutions for climate and health. You heard Paul talk earlier today about our new solution scouting program here at Conduit, which we're very proud to be partnering with Welcome On. To lead this next panel is my new colleague, Kitty Parter-Brooks, who is from Systemic, but she has been seconded
We have to
into
work
our
on
team
getting
here at
our
Conduit
mothers to read
as our
our work.
expert in residence on our health work.
Team, what a day. I am warm, but I'm energized. This is the last panel of the day. We've hung on in there, well done. And I'm really, really thrilled to be joined by this amazing panel today. So if you weren't persuaded this morning that climate and health are inextricably linked, hopefully you are now persuaded. If you're not, we haven't done our job. But what we've also heard today is that transforming what we know into action on the ground is hard. It's complicated, it's non-linear, it takes a lot of work, it takes a lot of coordination, a lot of effort. So we want to talk about that today, and we're going to ground our, sorry, this is very close to my, we want to ground our discussion in what it takes to transform cities, because so many of the climate and health conversations are happening in cities, and it's helpful to transform, base our conversation in a kind of specific context. So I'm going to let our panelists introduce themselves, and also I would love it if you guys could give me a kind of snapshot of what you think are the greatest challenges that you're seeing in your work. Maybe Charlie, I can start with you.
Brilliant. Thanks, Kitty. Hi, everyone. My name's Charlie Hicks. I was a councillor, local politician in Oxford from 2021 to 2025, where I focused a lot on sustainable transport, delivering walking and cycling policy. And during that time was at the middle of the global conspiracy theory around 15-minute cities. So I've become very interested in the politics of transport and how to deliver policies that are great for climate and health around active transport. I now do research on that subject at the London School of Economics at LSE City. So I'll focus on those political barriers, I suppose.
That's great, thank you. And I'm going to ask Emma to introduce herself. Emma's going to have to leave us 15 minutes early because it turns out if you are chair of the National Heat Risk Commission on the second heat wave of the year, you're very, very in demand. So Emma's going to have to leave us 15 minutes early, but maybe if you could introduce yourself and just give us a view of what you think the challenges are.
Brilliant, thank you. So Emma Howard-Boyd, I am former chair of the Environment Agency. I led the London Climate Resilience Review, which Mette talked about earlier, and hopefully later this week we're going to see a heat action plan launched. I'm currently chair of the National Heat Risk Commission, and it's because one of the key recommendations from the London Climate Resilience Review was around heat and some of those gaps that exist between national policies and local authority and city policies that I'm focusing now at the national level, but understanding that so much of what we need to see happen takes place at the local level. Standards play a huge part in this too, but I'm sure we're going to come back to that as we talk.
Fantastic. And Tallulah, maybe I can come to you.
Thanks, Kitty. Good afternoon, everyone. How's the energy in the room? Yeah, okay, good. Excellent. I'm Tallulah. I'm a public health physician and urban epidemiologist. I'm a clinical professor at the University of Cambridge, and I'm the founder and CEO of Urban Better, which is an Africa-led global institute focused on a youth-powered movement and a next generation of civic, city, and science leaders for earlier, healthier climate action. My work is on the nexus of health and climate in cities, predominantly in cities across Africa, because that's the most rapidly urbanizing region with the youngest population, so the opportunity to get things right the first time round is really critical. You asked about the barriers that I see in my work. We focus on at the systems level. So at that nexus of health and climate in cities is things that shape the air we breathe, the ways we move, including heat and the built environment, and the food that we eat. And there are three systemic barriers that we have observed and really informs the work that we do, and we'll go into the solutions. The first is a power systemic systems failure of power. We work a lot with young people, so that's the framing I would use, but the same thing applies for people really at the coalface of these risk exposures that we see. And we see in many cities the power in terms of the young people who are most invested in the futures that are being shaped are systematically excluded from decision making. The second systems failure we see is evidence. And I don't just mean generating evidence, I mean evidence that is connected to lived experience. We see, when we're talking about evidence, who is asking the questions, who is designing, what data is collected, who is determining what evidence means. So that evidence systems failure is the point to be addressed. And the third systems failure we see is infrastructure. And I don't mean hard infrastructure in terms of the city. I mean the infrastructure that sustains and connects that lived experience, that evidence into action and sustains it at scale. And I can go into that a little bit more.
Super helpful, thank you. And Marjorie, coming to you.
Hi everyone, and thank you for the invitation. So I have a background in global access to healthcare at Sanofi. I'm driving sustainable and equitable access to healthcare in vulnerable populations who are mostly affected by climate-sensitive diseases, such as respiratory diseases. And I'm honored to be here today to represent the Resilient Cities Reimagining Health Partnership, which is a partnership between the Resilient Cities Network and the community of practice of 33 cities worldwide, with the private sectors, Reckitt, Bupa, UCB, and Sanofi, and also with the support of Yale School of Public Health and Mode Economics. So what we've learned over 1 year of engagement with the community of practice is that there are three main common challenges. The first challenge is about competing priorities and tight budget. The challenge is about getting department to see climate and health prevention as a shared agenda and not a competition for budget. The second challenge is about governance, governance silos between departments. When we ask cities about these barriers, they tell us that only 20% of cities report a strong coordination between Department of Health, Planning, Environment, and Transport, which makes a joint-up action difficult. They also lack a common vision, and they need for capacity building to train stakeholders who are less familiar with the topic. And the third barrier is barrier to finance. Only 55% of cities report having access to national or international funding to support climate adaptation efforts. Climate and health money sit in separate institutional buckets, and cities struggle to access funding streams. And there is also a huge disconnect between the size of climate-related health challenges and the resources allocated. Health is systematically underfunded. Health receives only 6% of climate adaptation funding, which is just 0.5% of multilateral climate financing. And when we look at national level, only 21% of nationally determined contribution address comprehensively health, physical, mental health, and health systems. So there is a clear need to mobilize domestic financing at national and city level, ensuring that at city level there are dedicated budget lines for climate adaptation to make sure it is integrated into city development plan. And what we've heard from cities as well is that they need political support and they need help to build compelling, locally relevant cases that resonate with their politicians, policymakers, communities, funders. And so this is where the Resilient Cities Partnership can support.
Fantastic, thank you. And you picked up on this point around governance. Emma, maybe I can come to you. What role does national, local governance play in raising this up the agenda and kind of creating impact at scale?
A lot of the impacts are really felt politically at the local level. And we've really seen that in the UK, and particularly on heat. And making sure that the powers and responsibilities cascade down to the decision makers who are going to politically feel it is something that you hear in London, you hear it at a combined authority level, but also at a local authority level, and you hear it across the UK, and you hear it around the world as well. We have political change taking place in this country, and having spent some time with the former mayor of Manchester, and heard how he has wanted to use his convening superpower as a mayor, I am really hopeful that in this next phase that we are going forward into in the UK, that the mayors across different combined authorities act together to really make sure that national government understands how that power and those funding can land at a local government combined authority level. I think also you need national government to recognise the importance of resilience. We have going through Parliament a whole range of different legislation or strategies, so relevant to heat at the moment and some of the conversation around schools and the health of our growing children. We have a strategy that was launched by the Education Secretary back in February around 10 years of estate refurbishment. This is where we need to make sure that we are locking in action and making the most of the experience that we're having this week from a heat perspective, so that our children are learning in healthy environments, and the teachers that are teaching them are feeling good too, because the calls I've been having from teachers and the messages that we're hearing right now, it's very, very difficult in schools that don't have the right kind of cooling options.
Mm-hmm. And I think this is a key point, because, you know, when we talk about massive systems numbers, global numbers, systems change, it's easy to forget that, you know, certainly when it comes to transforming cities, that boils down to hundreds of mayors, thousands of local authorities, millions of employees and citizens every day doing the work to implement those changes on the ground. So, Marjorie, can I come to you? How is the Resilient Cities Reimagining Health programme thinking of that kind of systems view, integrating it into local cities?
Yeah, so the purpose of the Resilient Cities Reimagining Health programme is really to help cities, as I said before, to build compelling cases, compelling business cases to shape policies, unlock funding, and implement a concrete action on the ground. So we developed some tools and resources. The first tool is the Climate and Health Impact Dashboard that helps cities to quantify the risk and the cost of inaction and to measure the potential impact of a set of preventative interventions on climate, economic and environmental outcomes. And the objective here is really to support cities and to guide them step by step through the process to integrate health into a broader resilience planning. So this is really how we plan to help cities to make the case investable and scalable.
Fantastic, thank you. And Tallulah, maybe I can come to you, because I think the work you're doing through Urban Better really speaks to this point and is fantastic. So where are you seeing the most success and traction with your work?
Mm-hmm. So I'll pick up on where I left off with the systems failures. But just to start with an anecdote, yesterday we had a clean air walk run. We have built, as part of Urban Better, civic infrastructure that allows young people to collect data about their lived experience, and is based on personal exposure. So they have wearable sensors, they go and walk on a run, they have a citizen science app, and they can collect data. So yesterday we had the run, and just to come to your point, and the earlier point around synergistic action, for a start, a significant number of people did not show up because of the heat. And then when we looked at the model data between heat and air pollution, there were high levels of ozone that meant that for people with existing conditions, it was not safe to be physically active outdoors. So when we talk about taking action, the importance of that synergistic action, but to really connecting it to the lived experience, is really powerful. The reason I talked about those three systems failures of power, evidence, and infrastructure is because I found that in over 2 decades of doing research, we would generate evidence, and we've been using citizen science a lot in our research projects. And you get to the point where, okay, we shifted from generating the kind of evidence that doesn't connect to shifting our methodology, so we're actually creating the kinds of evidence that is really connected to, so the second systems failure, connecting to lived experience on the ground. One of the things that we found was that then when the project ends, just to the point where those people with a lived experience, and again, because we predominantly focus on young adults, where they just get the agency, they get the skills, they get to understand, okay, we can actually generate data, we can actually shape decisions in the city, and then you go, great, thank you very much, the research has ended, let's have a dissemination workshop, see you in 2 to 3 years when we hopefully get another grant. And then we leave them to it. And then when we come back again, then we have to start up that. So I started realizing that we need the evidence and we need that intellectual infrastructure, but there is this civic infrastructure that is not sufficiently invested on the ground. Because the reality is there's young people, if we talk about health being the human face of climate action, I would say the young people are the legitimacy of that action, because it's about intergenerational fairness. They're the future leaders of these cities, and they're extra motivated because it's their futures, right? But often we see grassroots and local action as this disconnected, disjointed things that happen episodically. And so the challenge when I set up Urban Better was, how can we think differently? How can we think about an institute where at its core, rather than just thinking about the research that we design and then look at how to disseminate and engage people, what if we flipped it round? What if we thought about what is the infrastructure needed so that outside of academic, outside of research, people are equipped with the skills, with the agency to articulate and make more visible the health and climate intersecting risks that they face, to articulate what and shape the priorities and how to do that, and to generate actionable insights that are policy legible and politically relevant. That is not a project. That is infrastructure. That is a movement. And that needs sustained investment. And so one of the things that we found, just to give you an illustration, we had of how Urban Better came about, we had a research project that was looking at the health and climate risks that people faced whilst being physically active outdoors. And we asked them to tell us, right? So in public health, we have this rising obesity, particularly in cities, and we focus on, there's insufficient physical activity. How do we get people to be more physically active? But I started asking, because I'm also a runner, how can we flip the question around and actually ask people who are already being physically active what risks they face and how do we ensure it's safe, and design environments that make it safer for them as a way of making the environments more conducive for us to be physically active. And they identified air pollution, they identified heat, they identified safety as risks that they encountered. We then brought them together at the end of the workshop, and then brought together the city leaders to say, and it turned out that the measurement wasn't being done either on heat, on air pollution, and they needed support with that. So then that was the first point. We collaborated on that, and we got a project to then deploy a low-cost sensor network to monitor heat, etc. And then the young people were like, okay, so what do we do? And I thought, well, this project's come to an end, but they were activated. So I said, what does it look like to rethink that? So we developed what I call precision advocacy. So how can we apply what we think about in research into advocacy and activism so that we're actually thinking about these actions as being evidence-informed? So we ended up developing a whole model of and training and developing the training platform, again, externalizing it from us, because sometimes the researchers, we think, oh, people are not doing this right in this way, they need us because of X, Y, D. They need us because we don't externalize the things that they don't need us for, and build the infrastructure for that. And so that when they need us for more intensive, more rigorous and more deeper research, they can come to us. So we developed a whole model that starts with how do you ask a question, what data do you need, how do you collect the data, how do you analyze it, how do you scan the landscape, to identify policy windows, the stakeholders to engage. There's no such thing as government. Oh, we asked the government and they didn't engage. Who's that? Who are you asking? Are you looking for the right opportunities to engage? So we end up doing that and then realizing that the power of surfacing those stories did a couple of things, gave decision makers stronger signals on where the issues were, really connected to personal exposure, but it started building data-backed and evidence-informed public support for ambitious action. Because often when we then talk about what actions need to be taken, we know these things are ambitious and we know the things move us from our usual status quo. Often the voices against mobilize very quickly and they're very loud. But if we're not investing in that sustained infrastructure to say the people who want action, how do they generate the data and actually surface and sharpen that demand and be positioned with the skills, with the agency, with the data that is connected to their lived experience to show that there is demand for it and be positioned to shape that. So we saw that, for example, in Nairobi, where they were developing a new clean air action plan. The young people identified this, they collected data, they designed the first ever citizens' assembly for clean air. They looked at what they collected data, they convened experts, themselves included in terms of the data that they collected. They had a petition and they got 80 young people together, came up with recommendations, they understood who to speak to and they got those recommendations and started working with the city government to shape that, and they continue to work with the government now in terms of accelerating that the implementation. So the actions is not just the data, it's not just the power, but how do you sustain action, widen that political space for action in terms of accountability, in terms of governance, because what happens after the policies, after the plans, the next day, in the city where we are, the young people are like, okay, you know how you made this massive announcement and we took pictures, what are we doing today? What are we doing tomorrow? Okay, mind you, we're going to be collecting some extra data. We're going to be making noise about it. Can we do this together? Or are you going to wait for next photo opportunity? So you start to look at how that investment generates a kind of data. And by the way, just another example, in Lagos, we ended up doing something similar. When they then needed support because they were doing something like air quality and they realized heat was something they didn't have the capacity to do, they then reached out to us as researchers to say, we need evidence on that. And we ended up designing a research project together that we then, through the Wellcome Trust, was funded to do that. But I would not have asked that question myself if I was sitting in university going, what should we do? But the question came from that lived experience, and that was really critical.
That's fantastic, thank you. And Charlie, I see you really nodding your head. Do you want to jump in here?
Yeah, absolutely. Picking up on those points, it reminds me very much of our experience in Oxford when everyone was sort of in a bunker with this huge amount of backlash that came about from delivering controversial transport policy. But there were a few similarities there. So one, on the citizen science side, a lot of NGO citizens got very engaged. One of the things they did was put up traffic counters in their windows, which would allow them to sort of citizen science collect the number of cars going past their window to sort of prove the point where it was the case that the effect on traffic. The other big other key points, I think, in terms of how to overcome the political barriers in some of these more controversial projects is thinking about what can shift the Overton window. And there are a couple of examples from Oxford I'd like to highlight. One, very similarly, a citizens' assembly representative group of the population across Oxfordshire is brought together to discuss and make recommendations on transport in the city, and they suggested, much to the surprise of the council officers, a car-free central Oxford. They recommended a congestion charge, which was then later implemented, and that really gave, I think, much more confidence to both council officers and the politicians that there was public support and legitimacy behind some of these more ambitious policies. The other one, which I think was hugely influential but is little spoken about from within the political side, is the local journalism ecosystem that there is. So most local newspapers now are driven by clicks and by ads as they're in competition with social media sites, which produces very inflammatory, divisive, polarized kinds of coverage. Politicians locally and MPs really focus on their local newspaper, in our case the Oxford Mail. But around the time that these policies were being introduced, there was another volunteer-led outlet called the Oxford Clarion, which really provided this sort of counterbalance, much more long reads, evidence-based kind of journalism. And the effect that had on my fellow councillors and council officers to be able to see this sort of other side of the public debate being represented in the news made a huge amount of difference. So those are two, I think, quite, you could take those and apply those in any city, the sort of local ecosystem of journalism and deliberative citizens' assemblies to get that extra legitimacy around these decisions.
Fantastic, thank you. And Emma, I know you need to leave us in 2 minutes, so I just wanted to come to you and ask, from your perspective, in terms of the priorities for tackling systemic issues like heat at a kind of national and local level, what do you see as the biggest priority for us to focus on in the year, 2, 3 years ahead?
That's a really difficult question to answer succinctly because there is so much that we need to prioritise. I just want to quickly go back to observing what other parts of the world are doing, which ahead of the UK in terms of needing to deal with heat. I have the huge privilege of co-chairing HERA. Cathy Buffman-McLeod was speaking earlier, I think, and HERA stands for Heat Resilience Action. And seeing some of the projects that HERA is doing in partnership with mayors around the world, with partners at the local level, and seeing real things happen at pace. Also seeing, there's one memorable moment when I was visiting Freetown, Sierra Leone with Mayor Yvonne Akisoya, who happens to be co-chair of C40 Cities alongside Sadiq Khan, with another mayor, with women who had been provided shading, very simple shade structures, and hearing how those simple steps were making a massive difference to those market stall holders, mostly women, their children, providing heat, was something palpable that the other mayors could see, real action delivering change. So when it comes to London and some of the things that we need to start doing in partnership with businesses, with local authorities, with local groups, there are some simple things that we can learn, like shading, Shade the UK, Shade London, based here in the UK. Claire from the Howden Foundation has shown me this amazing bit of cloth about which is cool. You can cool individuals. We just need to get on and act, because we have so much that we can do, and get out of the environment sector, which is where I've traditionally come from, although my background is in finance. So again, the work that Welcome with others are doing around the sports agenda is huge. Sports England, which looks after all of the sports facilities and local community sport, is working on heat right now. So that is a massive way of communicating to large numbers of people in this city, but in the UK, some of the simple things that they can do to get ready, but also to look after their health in preparing for things like heat.
Fantastic.
Thank you very much.
Thank you so
I've got
much
to
for
go.
being here. Please, I'm glad you're able to join us. And Charlie, can I just come back to you, because I think we heard from the panel previously about the need to finance solutions. I mean, it's all very well having a solution, but then the next question is, so how do you finance it, and how do you finance it at scale? What's been your experience of this in a local government context?
Absolutely. So a couple of points. One is, yes, local government is underfunded and has been massively, their budgets have been massively cut since periods of austerity. However, they still have a lot of money, and a lot can be done in local government. So for example, the council that I was in, Oxfordshire County Council, has an annual budget of 1.4 billion a year. And I would say, especially with so many councils that are in no overall control, there's a lot of ability around budget setting time for councillors across any party to have quite a high influence on the budget, or it's another place that advocates could go to and seek to influence those budget setting processes in councils. Another one which we had experience of in Oxfordshire was working with the Green Finance Institute on new forms of financing local government. So for example, we set up a local climate bond, which allows local residents to invest their savings to get a low risk return, and that money was then used by the council to fund retrofits of council buildings that then saved them costs that then could pay for the interest back to local residents. But there are lots of these new financial models that the Green Finance Institute in particular, and I'm sure others, are developing, that allow finance to be used by councils and for sort of local place shaping projects in new ways. So I definitely recommend their work if you haven't seen it already.
Thank you. And Marjorie, maybe you can jump in here, because I know that you've talked a lot about the role of public-private partnerships in creating change. What's your experience of this at Resilient Cities?
Well, I think it highlights the critical role that private sector can play in the game. That's important that, we should keep in mind that all actors carry the financial risk and the reputational risk of not doing anything. Mm-hmm. So that's critical that we can trigger action at city level. And this is the beauty of this partnership, that we can co-create together with cities, with communities, programs that will address the local reality. This is, I think, the program is where the science meets the local reality, the local community reality. What we've heard from cities is we are data rich, but we are decision poor. And so the program will help to translate data, to translate science into narratives that are compelling and that will help unlock funding and unlock concrete action on the ground.
Fantastic, thank you. And I want to come to the audience for questions, but I guess one final question to you, Tallulah. You know, this panel is about adaptation in action. How do you see this as a trade-off between adaptation and mitigation?
Yes, so no, I think the shortest answer is I don't. Because again, if you're centering this on the lived experience on the ground, if you go to speak to anyone who is facing climate risks, they don't say, no, hang on, are you talking about adaptation or mitigation? Because I'm one and not the other. It's not a reality on the ground.
Mm-hmm. Okay, well, that's a very concise answer. Thank you.
Yes, I'll let questions in.
Fantastic, thank you. Does anyone in the audience have questions for our panelists? Yes, there's one right in the middle here.
I talk loud, so I don't know if I first and foremost, so I'm Kristen Koska. I'm also an epidemiologist, so I'm just really excited to know my kind are here. I work for the NHS in clinical AI, and I sit on a board of a sustainable transition. So I'm actually really curious to know the language that you are all speaking. You've managed to actually talk from 3 very different points of view. For those of us who are sitting in the audience who are trying to take this out, what are the talking points we should be talking over, networking in a bit? Because you've given us a lot of data-driven decision, evidence. Like, what are those 3 things we should hold on to? And you each had 3 different things. So there were 6 and maybe 15 minutes, all the different ways to do it. But what are those 3 salient points for someone like me who's like, this is exciting, but I still don't understand how to apply it?
Mm-hmm. I think that's a fantastic question. And I think that this is where the reality of collaborating across industries is really hard. I mean, first and foremost, before you can get anything done, you've got to make sure that you're on the same page. So maybe Charlie, let's start with you.
I think from my perspective on the politics side, some of these solutions, the political will is already there. Others it isn't, or it's more difficult. And I suppose that's my focus. For those ones, I really think the inclusion of citizens and civil society, both sort of informally, but also formally through deliberative democracy, participatory democracy, sort of democratic innovation in general, both helps to legitimize and the decisions and improve, move the Overton window, move what's possible politically further forward. So I would really advocate those approaches, whether you're in civil society or whether you're in government or another actor.
Okay, fantastic. I think that is something that's coming up again and again today, is where are things politically possible? And if they don't feel politically possible right now, actually, what are the mechanisms we can use to push open doors?
If I may.
Yeah.
I want to maybe be more explicit about something, because implicitly we talk about solutions and then how to implement them. Baked in that is an assumption that the solutions are technical and how to implement them is just after the fact. So maybe if there's one thing I want to leave you with, is that part of these solutions are the how to. And often when I talk about, like, I don't work in technical solutions, I work on civic infrastructure that is evidence-informed as the connective tissue that actually allows that uptake to happen. Too often, we don't think about that as a solution. We think about that as, we'll wait for the solution, which implies you're talking about solar panels or materials or something, and then we talk about how to upgrade it. I think we should be thinking about solutions as that connective tissue, that civic infrastructure, that coalition infrastructure that makes these things palatable. How can we frame that as solutions, and how can we invest in that and scale that?
Thank you, that's really helpful. Marjorie, do you have any builds, or?
Yeah, no, I just wanted to jump on what you said about climate adaptation and climate mitigation, that we don't have to choose. And we had this reflection as well within the partnership, that the strongest solutions are not labeled either as climate adaptation or health resilience. What we are trying to put in place is preventative measures that will improve people's lives now and improve the resilience of communities and health systems to better prepare for the future. And so yes, there is no dichotomy, and we should make sure that we capture the full value of these interventions. That's important if we want to make this intervention investable and scalable. And another thing I wanted to raise is about health, because health is where resilience becomes visible. And this is also where the value becomes tangible to all actors. Health is not controversial, and that's really important, not to treat health as a side benefit of climate action. Health is the primary return on climate action. So this is a point I wanted to make.
I think that's an amazing talking point. Yeah.
Thank you for this. Is this on? Yes. Thank you for the panel. All of you spoke so much to my heart. I'm Nabiha Kazi Hutchins. I'm the president and CEO of PAI. We're a global reproductive health and rights advocacy organization, been around for 60 years. And you know, as we look at who are the most affected, as we think about solutions and infrastructure, it's women. And if we drill down further, it's their reproductive health. I think you all know, and I have to share this because it has not come up, and we're coming to the end. A 1 degree increase in temperature leads to close to a 4% increase in domestic violence against women. We have almost 15 million women who will lose access to contraceptives in the next 10 years because of climate displacement. FGM goes up, child marriage goes up, there's a lot of harm. And so my question for you on solutions for impact, how do we get away from the fragmentation of solutions for impact, looking at a moment or a situation for a woman who is on the front lines of working in the most vulnerable of situations, most climate vulnerable situations, and think about women and girls more holistically. And how do we evolve from solutions that are, as I said, avoiding the vertical and looking at the comprehensive and the health, well-being, and safety of women and girls?
Thank you so much. That's a fantastic question. Is there someone who wants to jump in? Yeah.
Instinctively, I want to say we ask better questions. Often part of the siloing is because we start from, okay, I'm a heat researcher, what am I going to do, what are the pertinent questions? But the advantage of, again, having that, I'm going to keep repeating that civic infrastructure because it's really important, allowing those questions to surface from the ground up. And if we listen in ways that are more, that our disciplines don't allow us to, those interconnections come out. So, for example, an intervention that you mentioned transport, and interventions that support active mobility would be looking to reduce air pollution exposure, reduce heat exposure, make physical activity more healthy and safer. There is a report that was conducted by the UNFCCC and UNDESA on quantifying the synergistic benefits between climate and SDG action. And if you look at interventions that actually target those three, I didn't say it was a heat intervention, I didn't say it was an air pollution intervention, I didn't say it was an activity intervention, because actually the issue on the ground determines what the action is. And this is the power of evidence and urban epidemiology of bringing those coalitions together and bringing those data silos together and truly answering the question of what is the impact of this solution. Not just this is a solution, I'm a heat researcher, let's look at how it impacts on heat. And if we can do that, then we address these solutions at scale, both in terms of, we optimize the potential to improve health outcomes of the most vulnerable.
Thank you, and I think that really speaks to the fact that in the end, we can talk about air pollution, we can talk about heat, we can talk about flooding, but what we all care about is what's the impact to me, to my family, to my children, to my mother, and I think that grounding our discussions and our research and our decision making in that will always make it the most powerful. If we're at the end of our day and people are going to walk away with one priority, one sentence, one idea from each of you, what is that? I'll start with you, Marjorie.
Okay, you start with me. Let me check what I will include. Okay, so one practical action would be to back city prevention as an investable infrastructure. That means bridging silos, bridging governance and financing silos, and making sure that we clearly integrate health into broader resilience strategies. This is not obvious, and that means also reshaping the investment case to make sure that health is part of the investment matrix, which may not be the case today.
Fantastic, thank you. Charlie.
Don't forget the politics. No matter where you are in the system, it's always going to be important, and thinking through how can I present this policy approach or this kind of solution in a way that politicians across the political spectrum are going to be able to pick up and run with is key, no matter if you are in a sort of political post or not. And key to that, I think, with some of these more controversial policies is citizen involvement, as I was saying, both informally and formally through things like citizens' assemblies, democratic innovation.
Fantastic, thank you. Tallulah.
And because you've mentioned the civic infrastructure, I think I would say one thing, which is actually three things in one, which is investing in the leadership pipeline of civic, city, and science leaders. There's a lot of conversation around science leaders and thinking differently about creating those transdisciplinary, participatory methods and baking that into how we shape that next generation. Absolutely critical. There's a lot of conversation so far around the civic leaders and how we invest in that at scale. You just talked about that. So I'll leave with the third point around city leaders. By 2050, based on the pace of urbanization globally, the world is going to need 300,000 city leaders. And yet, at the moment, when we talk about leadership, if you look at the patterns of leadership, we focus on mayors. Mm. So we wait for people to come all the way through the system, and then we get to mayors, and we're like, let's train them. We started realizing, working with young people, that we were exercising and strengthening their civic muscle, but then we realized quite a number of those young people were already working in government. And they were going to, so we're going to wait 10 years for them to be Commissioner of Environment to then say, how do you think in a systems way? So there is a new Masters of Cities Administration for planetary health that we're starting to think about. And I think it's really important that we think ahead and think so that the next time we're having this conversation in a decade, we're not talking about this as the exception. We're seeing that there is a cadre and there's a groundswell of a next generation of city leaders that instinctively think this way and instinctively think about synergistic approaches to address health and climate action.
Thank you. So you've heard very clearly we need to reimagine the investment case to put health at the center of adaptation and resilience. We need to keep politics front of mind and invest in that civic infrastructure. And we really need to train leaders right from the get-go and not wait until they're already in positions of power to set them up for success. Thank you so much for your time. Please thank the panelists for your time. Much appreciated.
Thank you.
Thank you all so much. What a fascinating conversation.
I felt like
incredible to see the way in which it all joins up and really
it was quite hard to
manage
some of these.
Community. And when it comes to that politics, we have to remember to push. As Jamila told us.
How are you? Good to see you.
Paul comes up to give us some closing thoughts and wrap the day up and gives us our marching orders. I am thrilled to invite our final guest speaker for the day. We have with us today an incredibly distinguished global leader in humanitarian work, global health and international development. Al-Hajj As-Si has held senior roles across UNICEF, UNAIDS, and the Global Fund to fight AIDS, tuberculosis, and malaria. From 2014 to 2019, Al-Hajj served as the Secretary General of the International Federation of the Red Cross and the Red Crescent Societies. He currently chairs the board of the Kofi Annan Foundation and has led the Kofi Annan Commission on the Governance of Food Security. He is also governor at Wellcome. He has a very senior position with the Liverpool University and with a host of other organizations at the forefront of global efforts to address climate adaptation, child welfare, and emergency preparedness. I can think of no better person to close us out for the day. Thank you very much, Al-Hajj.
Thank you very much. And good afternoon, friends and colleagues. I just landed some hours ago from a place called Kaolack. I think Dawda knows it. It's So if you check on the map and then the meteo of Kaolack for the last weeks, you feel that it is quite cool here. So when I then hear you talk about heat, so let's meet next time in Kaolack. But what does it mean for people in Kaolack? It's about, first of all, their livelihood right now. Farmers are waiting for the rain to seed, and no rain is coming. 6 months ago, they were waiting for the rain to stop so that they can harvest, but there was flood. What does it mean for the fishermen? Now, we stand on the beach today. That beach, which was some years ago 50 meters away from the wave, and then realized that their former habitats today, including even the graves of their ancestors, are no longer on the beach, but they are far away, 50 meters in the ocean. It's also about livestock, because pastoralist communities who used to just circle around for the search of grazing land, are walking miles and miles and miles through the savanna and the desert, and seeing mile after mile their cattle dying. Well, it's about also the living space of people, because then you have to move away from your usual habitat, and unfortunately you're encroaching into the natural habitat of other species. We have to remember, when humans, by the way, that we are not the only species on this earth. We share it with others. And that proximity is often a deadly one. The bat live with Ebola, we got it and we die. Other species, host viruses and bacteria in their bodies. We cannot survive with that. So it's, of course, not only about living space, but it is also about life. Now, if you have something that is impacting your livelihood, your livestock, your living space, and your ways of life, now because nomads are obliged not to be in a sedentary setting, rural people are obliged to live now in peri-urban and urban settings. And all of that now impacting both on the health as well as on the well-being of people. Because when we talk about the health, let's first talk about the well-being. We never understand what it profoundly means by a pastoralist to witness your cattle dying day by day. You cannot understand, how deeply it can affect the fishermen whose parents and grandparents' graves were right here on the beach, part of the transmission between the living and the dead and the continuation, of life now being buried in the ocean. You never understand what it deeply means, for somebody who was living on a farm in a rural setting, to be squeezed in a spontaneous, peri-urban or urban, unplanned, city. Then, of course, if we start beginning to understand that, we understand what does it mean. If we say, that climate will be impacting heavily on the mental health of people, to start with. Because of course we think often about the kind of a trauma it can give, physically, with malnutrition. Of course, if you lose, the livelihood, your livestock, depression of the human system, of people, to be more vulnerable to all the kind of diseases. To see some diseases that were close to elimination coming again, and in territories where you would not expect them. All of that has been quite well researched and known, and the evidence is being built on a daily basis. But the kind of invisible wounds it leaves, in people, their mental health, so that they're able to preserve what is most important to them and to you and me, which is our human dignity. Our dignity to live a life that is fulfilling, to care for our families, to care for our children, and also to respect, again, this transmission between those living here and then beyond, which is so important in many of the cultures, where we have this kind of an impact. What are those communities and people doing? In the jargons, we talk about adaptation, we talk about mitigation. I don't know if they adapt or if they mitigate, I don't know. But I know that they're trying to cope. They're trying to cope, but the coping mechanisms are being stretched and stretched and stretched of the max. And then if we're really staying true to what we are saying every time we talk about these global issues that are impacting us globally, including health, that none of us is safe until we all are, then we should also be as concerned as those who are living that on a daily basis. Where have we been putting our efforts so far? To do exactly what I'm doing today, to describe the situation, to make the case. How long have we been making the case? For whom are we making the case? Certainly not for the categories of communities and people that I've just mentioned, because that they live it and experience it on a daily basis. Maybe it's time to make a move. The move from making the case to do something about the case. And we want to do something about the case, let's always start from the beginning, namely where it matters most. In our jargons, again, we talk about last mile that we need to walk. Well, if it is true that the problem is really in the last mile, maybe we should flip the response and make it our first mile of response. And that first mile of response, will be to understand what are those coping mechanisms, of the communities. What are the scope and the limits of those mechanisms? Where is the traditional knowledge upon which, we can build on? What are the lessons that we're drawing from the science and the experiences from making the case and translating them into action? What are the support, that should be given? What is the trust and understanding that needs to be built? Often the time, we wait until there is a big disaster that we come in. And often the time, we don't understand that we do not right away have the opportunity to engage and then build the type of solutions. Why? Because it's extremely difficult to build trust and collaboration in the middle of crisis. Where were we before? Where are we during? And where will we be after? That continuum of partnership should be aligned with the continuum of preparedness, early alert, early response. And when we respond, what are the capacity that we are leaving behind so that next time around, when those very communities are facing the very shocks, they have the capacity to withstand, those shocks. But let's just reflect on our own work. Shocks and hazard in, shocks and hazard out. We in, we out. And again, and again, and again. And we find ourselves in that vicious circle that we call the vicious circle of panic and neglect. When the shock is so big that we sometimes believe that it can even threaten us, we all panic and come in. When we think it subsides, we disappear until the next time around. And the next time around, again, those communities will find themselves in the same level of vulnerability, as before. That have to change. And I think that is that continuum of preparedness and response should be also the continuum of collaboration. What are the kind of a long-term partnership, we need to build? And that is the key. Partnership between the rich and the poor, between the rural and the urban, between science, and the communities, between analysis and an action, between this generation and the next one. Because it's going to be very important that we reflect on what are we going to be doing today so that we have the outcome we want tomorrow. What are we going to be doing today that will not be having a negative impact, but rather an empowering, a supportive impact, for the next generation in front of us. And it starts with each of us, and it starts with me. My behavior, my attitude, my consumption method, my mobility, all of that, will be having an impact, on the common good that we have. And all of that, will be having a negative impact, on the future. If we change it, we can maybe turn it into a positive. So let's come together and then partner in that spirit. And I thank you.
I don't know how I always draw the short straw of standing between you and rooftop cocktails, but here I am again. You can't possibly sum up this conference, so I'm not going to sum up this conference. I'm going to just make a few concluding remarks. The first is just to reiterate the enormous thanks to all of you who attended, to the incredible speakers, genuinely blown away by the quality of the contributions and by all the people whose support made this conference possible. If I sort of draw back, I actually had a realization in the last sort of, just listening to our last speaker, about the fact that we are in this existential crisis in the world and as a species, and we are trying to feel our way through finding a vocabulary and a solution set that is equal to the moment. And I think it's fair to say by almost any measure, we are consistently a day late and a dollar short. And so we respond with increasing urgency to this existential challenge. And what gives me hope about the constellation of talks we've heard today is it's sort of reflective of the best of the human condition. We begin to find a source of imagination, a language, a vocabulary that starts causing us to think about the solutions we need and how you build the coalitions and the ways of communicating them and the fields of endeavor and the forms of experimentation and the kinds of cooperation that get us there. And so we began to stay, like really early on, there's something remarkable about latching onto health, because health isn't abstract. It's the thing that afflicts the human body. It's what we know ourselves in our own body and the bodies of our loved ones, of our children, of our community. And if you can connect that to the climate crisis and make it real and make it salient, and you heard those three remarkable mayors in a row talk about the delivery of exercises of local governance in ways that was wonderfully apolitical and at the same time profoundly political. They were able to go, here are the solutions, this is what we do, this is how we explain it, this is what we're trying to innovate on. And when you hear that, you really begin to think that this is an area of activity we should be focusing on and celebrating, because those people closest to the real lived experience of the impact are doing something remarkable, and we can take something from their playbook. And then you pivot and you talk about the different other endeavors we looked at. So sport, we as a species do this all the time. It's a way of doing recreation and war by other means, and we do it in this way that is really, really good for us and which enlightens us and inspires us. And I think the Adapt to Win initiative and all the other plethora of actions in this space are a way of translating what fascinates us and engage us in a way of lifting up our consciousness and innovating in the space. And then the food stuff, if you listen to if we move to a 10 billion person world, we'll have to increase our overall production by 60%. But if we use sensible methods, we can reduce our land usage by 7%. If we switch to healthy diets and we think about regen agriculture, if we think about how we educate people through school meals, if we switch to venison, and all of a sudden you begin to see an essential communal part of the human condition, how we feed ourselves, can be a lab for experimentation and can take us closer to what it is that we need to do. And then if you want to make food fun, then you have to think about culture. And if you looked at all the enormous stuff that emerges there, from music to film to literature to ways of engaging, it's a whole unexplored area of endeavor that can, again, raise our consciousness, can innovate, can experiment. And I'm going to end with two things. There's something in the stories about the use of parametric insurance, which I think is a kind of a parametric insurance, which I think is a metaphor for all of us. We can develop insurance products which says that when the temperature goes above a certain level, you don't have to go to work and you don't risk dying or fainting or being afflicted on the shop floor of where you work, and you can stay home and be safe. Now, firstly, that's a mixture of both financial ingenuity and a humanitarian impulse. But what's really cool about parametric insurance is not that. It's that it widens the scope of people who have an interest in dealing with the trigger. Because once you have insurers and employers setting a price signal and a financial signal relating to temperature, there's a broader group of people with power who are interested in dealing with the fact that it's becoming unbearably hot, both in the factories themselves, but also to the underlying syndrome or condition or driver or cause of that all. And so in a way, parametric insurance gives us a clue as to how we need to address these problems, because I think if we try to do this work in silos and in small ways and band-aid, we're destined to fail. But if we try to expand the group of people who have an interest in the solutions and expand the vocabulary and the language and the coalition that brings those people in, we have a much greater chance in succeeding. And then I'm going to close just reflecting on our last really amazing speaker. I think we may have been a little guilty in our curation of this conference to think a little bit too much about Miami and London and Phoenix, and not about pastoralists whose cows and animals die, and for whom adaptation is an entirely different question. It's deeply and directly existential. And I think that, there are tons of people in this room who work on this all the time. And if you think about the work of Wellcome and what they fund and what they do, it deals with this question. But I think we would do well to think more deeply about the differential speeds in which this is happening and upon whom it falls. And that then returns me to a point I made earlier, which was health and climate are going to cause a range of very undesirable impacts on humanity in a way that will both afflict the poorest and the most vulnerable in the most dire way, but they will also affect middle class and privileged people. And that gives us a real opportunity to draw the broadest possible net, to cast the broadest possible net that we can, to bring in a group of people who will produce politically durable coalitions to address these problems. Because when dengue comes to South Kensington, there is an opportunity to be able to explain that in terms of the lived experience of other people far away who have that all the time. When flooding goes to middle-class people's homes and the value of those homes go from 3 or 4 million to merely 1 or 2 million, you can make the argument that that experience is analogous to people who have their homes washed away entirely. And if we can draw those analogs and we can make sure that we don't cast what we're doing in narrow silos, we again expand the group of people who can deliver these solutions. And I'm increasingly convinced, as I sort of let today wash over me, that we have to, both in our politics and in our science and in our conceptualization of impact, produce broad churches and strong language to take the largest number of people with us. And along the way, we'll lose some people because some of the things we're going to do are going to be hard. But if we can build the broadest churches on the largest number of issues, the chances of us affecting system change and getting there go up exponentially. And if we're honest with ourselves, we've been too narrow and too technocratic for too long. And what I loved about today is that I think it stirred, at least in me, and I hope in all of you as well, the possibilities that we can be more imaginative in how we go about doing this. So I'm super grateful that you all came. I hope you made dozens of meaningful connections. We are doing this major solution scouting exercise together with Wellcome and Howden, and frankly, anybody else who will join us on the journey. We're going to report back regularly to you on this, and we will find a set of solutions, if it kills me, that we will be able to scale and show real innovation in over the course of time. So see you on the roof. Thank you to everybody who helped curate this. The group of people put together were from a committee of people from the Conduit, from Wellcome, and from others. And thank you to everybody who delivered this really remarkable event. Thank you.